Welcome, everyone. Good morning. This is the second day of FIS Week, the largest health experience in Latin America. As you know, there are three events: FIS 21, the largest leadership event; Simetria, the first ESG event in Latin America; and Company Limits. Companies generate content, and we have an augmented reality app and virtual reality. You can download that from the App Store or the Play Store. You'll be able to see monuments from Egypt, from ancient Rome, and of course, enjoy our debates. All of that is within Trust, the social media where health connects itself. You can connect to members, sponsors, and of course, our speakers. Let's get started. This is the FIS panel, ensuring access through health management of populations. Leonardo Coelho, AON, Director; Paulo Rebelo, ANS President; Javier Bayona, Community Medicine Director; and Manuel Perez, CEO of Bradesco Saúde. Share our hashtag FISWeek and use our Instagram filter and tag us so that we can repost your publications as well. Good morning, everyone. It's a pleasure and an honor to be here as a moderator in this panel to ensure access through the management of populational health. I would like to thank Leonardo Coelho, Paulo Rebelo, the president of ANS, Leonardo Coelho, executive director of AON, Mr. Javier Bayona. It's a pleasure to welcome you here this morning. Thank you for being with us. Thank you for having me. These debates are very important indeed when we think about populational health. These are the most important topics. This is a matter of concern throughout the world. We're referring to access to healthcare. The second topic has to do with reducing costs, including technology, of course, and how to make sure, while we make sure healthcare is provided with the top quality possible. So again, how to make sure there's access to healthcare. One of the problems we're faced with is the interest in health prevention. It has to do with populational healthcare. One of the most important things in our case is the fact that we have a very fragmented medical practice, fragmented in several attention areas: hospital, outpatient wards, offices, diagnosis support. Everything is very fragmented. In our country, and as well as in other countries too, this is a fragmented support so that you cannot provide good populational health. We should have professionals that are familiar with the promotion of healthcare services. So it's indeed a very interesting panel. I would like to kick us off with Dr. Javier Bayona. So we would like to hear his experience on how to manage populational health from his point of view, of course. Thank you for being with us, Javier. Thank you for having me. I'd like to share my screen. Could you please show my first slide? Well, these are my conflicts of interest, first and foremost. They're related to my scientific/professional activity. I worked for the Catalan Health Institute for over 20 years. A little over 20 days, I joined the Catalan Agency for Health Quality. I am part of the Community Medicine and Family Health Association. I've been a consultant for several programs there. I'm also at the sanitary health management in Catalonia. I believe that in Latin America, you follow these same principles that we apply here in Spain, as far as these things are concerned. In order to ensure access through population health management, we must understand that the sanitary system, the water and sewage treatment facilities are important. However, there are other important characteristics: lifestyle, the workload, the education of populations, the work conditions, living or housing, the food quality. All these things have more influence than the water and sewage treatment systems per se. So sanitation accounts for 15% of the quality of health. Other studies indicate that it can reach up to 25%. So the main reasons are away from the sanitation per se. These water and sewage treatment costs a lot of investments. So that's not directly related to health results. Of course, we know we must provide that initial investment, that initial expense, and then there's a curve from a certain point of investment. Budget allocations. From that point on, health won't improve. Clinical practices and sanitation policies should be evidence-based. What do I mean by that? So we should focus on the decision-making process and the clinical practice, taking into account populational values or the people's values, taking into account that you have to make shared decisions. Only then populations will feel empowered to adopt those measures that will matter the most to them. So what is value-based practice? the clinical interview has to have quality. And as a backdrop, there must be some clinical reasoning. So decisions are shared with those that are interested the most. You have to adopt a strategy from the National Analysis Service or from other initiatives. And of course, that requires teamwork, most preferably in a multidisciplinary fashion. Studies show that sanitation systems can perform different actions, and some of them do not add value to the health of populations. But once they are installed, there's a cost associated to it. We have to apply the Sutor law. William Sutton would do that. Where are the practices that do not add value? The money saved there can be then invested in those actions that can add value. Michael Porter said, we should have health objectives that would make sense to patients. Everything that is invested in sanitation that can improve accessibility, clinical practice overall, that could be measured. It should be measured. Sanitation services should, according to the needs of the populations and the different types of diseases. There's this triple objective. Once we have taken action to provide accessibility in sanitary services, once we achieve that, we have to make sure the health of the population is increased, patients' experience is increased at the most reasonable cost possible. So these are the premises I would like to show you so that we can provide good access, taking into account healthcare of the population. So that should be based on community activities. Primary care is very powerful, it's very present, and everything should have the support for all the healthcare or specialized healthcare throughout. I believe that this is helpful, and I'll be available to answer any questions you may have in the end. Thank you. Thank you. I truly understand when you talk about lifestyle as a very important aspect of populational health. And lifestyle, sanitation is marginal when compared to lifestyle. And your point about primary care was on point. Let me ask Leonardo now. What's your take on the possibility of providing more services on education, health and education, just like Javier mentioned, as to the health objectives, maybe placing more emphasis on the health or the education of people. Good morning, everyone. It's a pleasure to be with all of you this morning. This conference is just amazing. It gives us the chance to discuss very relevant topics when we talk about access to healthcare in Brazil. I think we have come a long way. We're still in a very fragmented industry, just like you said at the beginning. This is indeed a major hurdle. But as a consultant, we believe that corporate healthcare is getting stronger and stronger. Companies are more and more concerned about occupational and healthcare. Companies are taking the center stage, and patients too. So you can add technology. Primary care is very present, and you are combining the online and the offline worlds. We can see that happen both in providers and insurers, and much more care on mental health, prevention, and education. We've seen a major increase in remote tools. Telemedicine is one of them, among others. These services end up connecting all these elements together. When we look at this entire scope, we know how hard it is, how difficult it is to connect these players within that industry. So when we look at the Spanish model and some other models in Europe, Brazil does have the public health system as a major player. However, health in Brazil still rely on the private initiative. We see many tools being implemented, more advanced health management system to treat chronic patients or specific diseases, patients that suffer from specific diseases. So the population is becoming more and more aware of these tools. The pandemic sped up the entire process. It allowed us to experience that connection from remote primary care with other types of services. We see that happen, and that is an actual change when we look at the Brazilian health industry. Thank you, Leonardo. The way I see it, you believe programs implemented by companies for their employees, taking into account prevention and special attention to chronic patients. But just like Javier talked about how important it is to have primary care as one of the key elements to improve the health of the population overall, I would like to take this opportunity and ask Dr. Paulo Rebelo, what can we do in the healthcare industry to promote not only access, but looking for primary care as their number one focus of people and corporations as well, when compared to the hospital-centered care. It's not only more expensive, but it won't necessarily address the problem and won't provide a continued line of care, just like primary care. I don't know what you think about the lack of emphasis in primary care.
Thank you, Manuel. I had a slight problem in the beginning. My connection froze, but I'd like to greet you and greet Javier. I'd like to thank Dr. Shozier for the invitation. It's really a pleasure to be here. This is an important subject when it comes to population health. It's an important assumption if we want to guarantee not only access, but egalitarian access to health. And the agency has been looking into the need for us to make an adjustment in this administration so that we can continue to maintain our focus on continued high quality access to health. From that perspective, we've been trying to change the role of the actors in this sector, and so that the producers of care, the caregivers and beneficiaries are all aware of their autonomy and their condition with an increasingly more qualified agency, increasingly more efficient, so that we can regulate the industry and reinforcing the importance of collaboration between the contractors and contractees, connecting the roles of the several different players involved. The supplemental health plus the collective business plans represent 60%. So the contractors are a fundamental organization in this change that we intend to make through health management, moving towards this holistic model based on value, promoting the improvement of the system and encouraging better care and the adoption of health prevention and health promotion programs. The agency already gives incentive to these programs, and these amounts can be extended to these new programs. There's also a bonus that is paid to operators that adhere to this program. So we firmly believe that by placing the patient at the center of the discussion, we will provide a high quality health care and health treatments in the industry as a whole. Well, you mentioned the incentives provided by the agency. And on the other hand, we see that companies are not maintaining their level of success. Or if we look at the triangle showed by Javier and the goals that we must set in terms of obtaining better quality of life, highly motivated by better lifestyle, which is responsible for most of the chronic and degenerative diseases. I wonder if the agency would have new tools to improve this incentive to companies so they can invest more, and encouraging people to look for a better lifestyle and to promote self-care in a better way, because everything's related to education in health, but that requires a lot of investment. Disseminating this type of information in the population, especially if the population is constantly renovated due to contract terminations and whatnot. So many of these services are often lost in the contract. So, which additional incentives, I wonder, could the agency promote to improve that situation? Because my specific perception is that probably with these incentives, we have not been able to encourage the companies to make higher investments for people to adopt a healthier lifestyle and to produce better indicators from the perspective of the population. Well, you're correct, Manuel. There's this promo prev incentive, and I believe that over time there will be, and companies will see. And Michael Porter, his book specifically says that over time we are going to have that benefit, and I obviously agree that this is too incipient, adhesion is too low. And to give you an idea, in these programs that have been approved in the agency, we have over 1,000 programs, and they encompass a little over 1.5 million beneficiaries, which is too low in a sector with 48.6 million beneficiaries. So that's one thing that we have to talk increasingly more frequently. There's also CONTACT, a technical chamber that's open to discussion. The agency has been allowing contractors and operators as well as providers to be within one same space to promote discussions, because as you said in the beginning, there are structuring challenges in the sector. There's a demand from the population for new technologies, having an increasingly greater impact on costs, and we really have to change that perception. And it is through the promotion of health and prevention of diseases related to occupational health that will be able to bring down these costs. And above all, as I mentioned, the participation of contractees is important if we want to encourage these people to become aware that it is only through self-care and through the adoption of physical exercise and a healthy diet that we're going to be able to reduce these costs. Otherwise, we'll not be able to bring these costs down. Thank you, Paulo. Thank you for your comments. Javier, in your opinion, what are the best investments that could be done to encourage the population in general to adopt a healthier lifestyle that is enough to improve the health indicators? I mean, what are the tools that the healthcare system can use to encourage and teach the population to adopt a better self-care and better control their lifestyle when it comes to, everything, the consumption of greasy foods and consumption of sugar, smoking, alcohol consumption. I mean, all of these things that affect the population in general. Well, I have an important bias because the health system where I work is clearly different to yours. And this maybe might lead me to say something that is not feasible in your environment, in your setting. And given this bias, or given our differences, well, let me tell you, in my country, we are making significant efforts with few economic resources behind them, which is health for all policies. What does that mean? It means that in the government health care plans, what they did was an agreement for all departments when they implemented an initiative that they take into account that the most important values of society is the well-being of the population. In this healthcare system, we should also think about the emission of gases that might lead to climate change that have an influence on the population health. Pollution is a risk, a factor for early death due to cardiovascular reasons. There are policies that encourage the adoption of sports in community by making it easier for people to do jogging and other types of sports that have no high costs, but which that encourage the population to be aligned with a healthier lifestyle. Of course, the consumption of toxic products is another thing. We should encourage people to bring down their consumption of alcohol and tobacco, but that has to be aligned with the policies of primary healthcare teams and policies and other policies that might lead to the decrease in the consumption of toxic products. In that regard, I would globally place a bet on the program that I mentioned to you to have healthcare crisscrossing all policies. There is a component now that does not encourage service providers and clinics, labs, hospitals, service providers in general. Keep in mind the general health of the population that they serve due to the compensation system, which focuses on the provision of services and not on the population. The higher the amount of services provided, the higher the compensation, and that's a business. On the other hand, we experience a drama in that the population sees healthcare, and maybe that's a global phenomenon, as a consumption of service and not as health as we know it, as population health from a conceptual standpoint. And as consumption, the population needs or wants to have access to it. Given this dilemma between what the population thinks about healthcare services, seeing it as a consumption service, and service providers seeing it as a production line that's perfect from the point of view of service provision, what is the best rationale or the best recommendation you would make in this scenario that is apparently so chaotic in terms of trying to obtain a better population health management? Well, the healthcare systems, the evolution is different in the entire world, and the resources allocated are also different based on different parameters. If I had to focus on the production system, and if I wanted it to be accessible at reasonable prices for the population, I would place a bet on the proximity services, similar to the ones that we have in models of different countries where we have national healthcare systems, where the community and the social and sanitary services and primary care are the first level of access to health services. And the first level of access is open 24 hours a day with a minimum service for the weekends. And from Monday through Friday, it's open full time in hospitals, and especially the tertiary services at the level of hospitals. By choosing a continuity that must occur between the primary and specialized care, and through protocols and clinical guidelines based on evidence, not only on evidence. And this has an impact on the services provided to patients with special needs. If we want to help them choose the best path to achieve better health. And of course, that reduces the amounts received by some providers or services, but the quality of service increases, and in a system connected like that, from a macroeconomic standpoint, the entire system would win, of course, especially citizens. Thank you, Javier. I'd like to pick up on what you said and ask Paulo, because I could summarize synthetically what Javier mentioned as the hierarchization of services, something that could be possible in more vertical private systems, and maybe, of course, people want a free access, and free access is not hierarchical. If access is hierarchized, it ends up having a lot of waste and too little synergy in terms of the healthcare management of people, especially in terms of the continuity of assistance. How do you see the possibility of the agency contributing to encourage the hierarchization of medical and hospital services? Well, in line with what you mentioned, I think that in Brazil, we have this model where you pay by procedure. There are other alternative models, though, but this model is being tested in several different countries. He's breaking up. And I believe that the agency's been encouraging through guidebooks. We have a regulation that places recommendations. We do not force operators to adopt any given model. So we believe that it is through co-creation that we're able to create a new model. And I think that this recommendation of a model based on value will change this paradigm and imply paradigms and be transformed into a cost reduction process. Of course, we should not lose sight of the fact that we should be keeping our focus on the best patient outcomes. And the agency has been encouraging the construction of healthcare indicators to serve as a guideline for that construction. And through increasing social participation and by encouraging competition, that will lead to a change in the model that is adopted. As you said, it's only that way through co-creation that we'll be able to find a reasonable model that is adequate for our industry. Thank you, Paulo. I want to ask Leonardo more or less the same question. Leonardo, could you review your experience? Ale is a global large broker with customers all over the world. So how do you see the possibility of fostering hierarchization of the access to the healthcare system with a focus that is not so much on consumption, but rather one that is focusing more on the health of the population rather than on the provision of services? What's your opinion about that? Well, I'll make an analogy about what Javier said. When we talk about fostering public policies, and that depends on the model adopted by the country. And in Brazil, we think there's also room for private initiative to create its own incentives and its own strategies. So what we see from the perspective of change is that first, it is a change of a mindset through the HRs themselves. So I think that companies now understand increasingly more that managing population health is fundamental if we want to deal with this dilemma which is the dilemma of the fragmentation of the supplemental health system, because consumption habits are really very strong in the health sector. And especially if we take into account a fragmented system, we see that there are many companies trying to find a different format for their products, whether it is by implementing healthcare administration models, or by incentivizing its collaborators, by engaging collaborators in healthcare programs, or in well-being platforms to prevent and promote health. That's also seen as an added benefit to products that are made available by operators, insurers, but also as part of the HR strategy of these companies. We also saw a greater openness to discuss healthcare assistance models, and regardless of whether the operator's model is verticalized or not, models where the company itself is willing to adopt access products that are more hierarchized, whether it is through more technological tools that allow for a sublayer of products, or by means of programs established in partnership with the occupational health sector of these companies, through companies with their own outpatient offices, or companies that work with advisory boards in helping promote and implement these healthcare programs, but all of them in line with these models. We know that Brazil is a huge country. We have challenges related to coverage of our network. And of course, I'm referring to the private market. So that's a bit of our perspective.
Thank you, Leo. Let me just make a couple of comments, and then I'll turn the floor over to you. Let me start by saying that modern medicine, and especially the movement to cities in the 50s and then in the 60s, that's a dilemma faced by the entire world, which is medicine. A huge amount of needs and finite resources. This is something that's been discussed the world over. But the major challenge is to have these three pillars. How to make sure you have healthcare, this iron triangle, retention of costs, quality, and access. How to make sure you balance these three pillars: quality, contention, and access. That's our challenge, so that we can have access, we can ensure access. Fortunately, given the technological revolution, costs go up much faster than inflation, than the capacity to generate wealth. So health is always faced with higher and higher medical costs. Very few countries can balance that increase in costs and at the same time generating more wealth. Our private system, in particular, is faced with the same dilemma. How can you make sure populations have access at a reasonable cost, creating new technologies at the same time, something new, and managing that demand that a population that sees health as a consumption service, as a service. So we should focus on populations and prioritize their lifestyle, their habits. This is a challenge we're faced with day in, day out. Of course, in a country like ours that is faced with economic issues, it's difficult to give more access to private education because of growing costs. Our population aged much more quickly than that of Europe. Lower birth rates, and people living longer despite the pandemic. So ours is a country that embraces technology very quickly, but the costs are high. Consumption is encouraged, not always in the way that should be. How can we therefore ensure access to private healthcare? So this is my closing remarks, but I'll turn over to Javier and then Paulo and Leonardo to wrap things up. Thank you for your comments, and thank you for sharing so much knowledge. These are decisions that are made in the political realm. Healthcare is key for all citizens. And this has to do with the legislative. At the operational level, providers and insurers can do many different things. They can reduce access barrier, and the most important barrier there is the cost. Patients that would like to have access to those services. The second barrier is the quality of service you provide. Just like I said at the beginning, that has to be based on the value, the added value that these services can provide. All therapeutical and clinical activities should be evidence-based to show that what's being done will provide more benefits than harm to the patient, whoever they may be. Not doing anything can be a good treatment, and there's no cost associated to it. Professionals have to have incentives to give the population they serve access to whatever can add value to their health. And move away from bureaucracy overall. It has to do with this, with the skills and the services they can provide. For example, if there's a specialist surgeon that specializes in cataract, there will be more cataract operations there than in other regions where there's no such a specialist. Of course, specialization is necessary, but you have to associate that to the cost to make sure it is providing more benefits than harm, as I said. So there are three levels: a political decision, an institutional decision on the part of the organization, be it the health provider or any other corporation, and those professionals that actually provide those services, that play those roles. Thank you, Javier. Over to you, Paulo, for your closing remarks, please. It's important to have a regulatory framework so that we can make sure the product makes sense to patients, can help them manage their health. It has to be economically sustainable. It should fit the pockets of companies and families. You have to have some good ratio between quality and price. Fewer and fewer companies and families have to afford their health management. The population is aging. The prevalence of diseases that are more and more chronic, non-transmissible. These are long-term, high-cost treatments. This puts even more burden on the costs, healthcare costs. This is a very interesting discussion. This is what we need, democratic debate, so that we can evolve to make sure families can afford their healthcare with the appropriate treatment, to make sure at the same time that there's sustainability for the entire system. So these discussions are all indeed very important so that we can move along. It's important to include every player in that industry. When Leonardo talks about the HR departments, it's important that they discuss these issues. Companies used to have more of a secondary role. Now they take center stage, and that's important. So absenteeism goes down when employees have good health care. The regulators will have to define policies to minimize that friction so that we do have sustainability while providing more access to population. Thank you, Manuel. Thank you. Thank you, Dr. Paulo Rebello. It was an honor to share this conference with you. Leonardo, your closing remarks, please. We can't hear you. I'm sorry, I was muted. Thanks, Manuel. Thank you for inviting me. This was indeed a very interesting discussion. I believe we'll keep on moving along. There's no silver bullet to our dilemma, I believe. I think we have come a long way when we talk about the importance of companies and their HR departments, but also more involvement of major players, insurers, providers, healthcare providers themselves. They've understood that the equation has to make sense, balance between cost and quality. That notion that we must concentrate in a more generalistic medicine to make sure we have to go back to the primary care. Specialization is very important, has to be there, but it has to be very well directed. I'm a firm believer of the correct tool for the right problem. Telemedicine is a very productive tool, and it does not do away with the physical care of doctors, with the physical presence of doctors, but that has been helping to make sure people have access, not only for employees, but their relatives as well. And this is supported by the agency, all operators, all providers, to provide better products, to offer reasonable costs, providing new alternative mechanisms with all the innovation we have seen in Brazil. Once again, thank you. Thank you so much for inviting me, for having me. Thank you. Thank you, Leonardo. This concludes our conference. I would like to thank Josier, the entire FIS team. Thank you, Dr. Javier Bayona, once again. Thank you, Dr. Paulo Rebelo. And once again, thank you, Leonardo Coelho, Aon's Executive Director. Thank you. I think we have a very positive discussion, important discussion to the industry, and of course, ensuring access, a very relevant topic for many countries with new technologies and lifestyle associated to climate-related issues. Based on what we've seen in COP26, we haven't been able to address the climate change solutions that are reasonable throughout the world. We may not be taking good care of ourselves, not even the world in which we live. We have to think about these things. Anyway, so thank you so much once again. Goodbye.
Transformar o cuidado, criando soluções acessíveis, proporcionando excelência em cada detalhe, somando expertises e multiplicando as capacidades assistenciais. É para isso que o Américas existe. Composto por 18 hospitais e 37 centros médicos e centros de excelência, distribuídos em 5 estados brasileiros e no Distrito Federal, o Américas promove o cuidado em mais de 60 especialidades médicas. Juntas, nossas marcas formam um sistema integrado de serviços de saúde, garantindo acesso a um atendimento diferenciado em todas as fases da vida, com excelência no acolhimento, humanização e alta performance. É assim, unindo estrutura, solidez, experiência e paixão pela medicina, que cumprimos a cada dia a nossa missão de ajudar as pessoas a viver de forma mais saudável e contribuir para que o sistema de saúde funcione melhor para todos. Onde tem Américas, tem saúde.
Trying to find my way. Every day, just trying to find my way. Every day.
É muito nova pra ficar tomando remédio pra louco. Essa geração é cheia de história.
I'm gonna break through.
Saúde mental é real. E quando alguém minimiza esse assunto, só aumenta o problema. Se você está passando por isso ou quer entender mais, a Amil pode ajudar. Saiba mais em amilsaudemental.com.br.
This is for scientists and those who believe in the potential of science. It starts with curiosity. A surprise in the pattern, an obstacle that can't be explained. Step by step by step, they challenge, explore, and unlock the unknown, fueled by imagination, alone and with others, repeating an experiment 1,000 times to have the chance to get it right, once, but for forever. Making brave choices, choosing to push the boundaries, and choosing again and again to be led by science in everyday decisions, everyday interactions, no matter where they are. Because putting science at the center of everything is the best way to understand and transform disease. The best way to change people's lives. This is why we believe in what science can do.
O Rio tem um laboratório que se importa com você, certificado e acreditado. Não paramos um minuto sequer na pandemia, realizando mais de 1 milhão de exames por mês. Conheça mais. Laboratório Blessing, de mãos dadas com a saúde e com você.
Em meio a tantas mudanças, temos uma certeza: a saúde continua sendo um fator decisivo na vida das pessoas. 1 a cada 4 brasileiros busca um plano de saúde para ter atendimento de qualidade. São pessoas que se preocupam com uma boa assistência médica e odontológica, inclusive na hora de escolher um emprego. Além de oferecer saúde e melhorar o dia a dia das famílias brasileiras, os planos privados salvam vidas. Nós da Fena Saúde temos o compromisso de promover bem-estar e transformar a vida dos cerca de 50 milhões de beneficiários de planos médico-hospitalares e dos quase 30 milhões de brasileiros com planos odontológicos. Proporcionando assistência 24 horas por dia. Criamos mais de 3 milhões de empregos. Realizamos mais de 1,5 bilhão de procedimentos médicos e odontológicos por ano. E movimentamos mais de 3% do PIB. Nosso desafio é garantir que a saúde suplementar acompanhe as transformações do mundo, priorizando a satisfação dos beneficiários. Nossa missão é oferecer saúde, cuidado e qualidade de vida para mais e mais brasileiros todos os dias, garantindo tranquilidade em tempos de tantas incertezas.
Fazer com que as pessoas façam mais, sintam-se melhor e vivam mais. Essa é a nossa missão na GSK. Somos uma empresa de saúde global com foco em ciência. Contamos com 3 negócios globais que atuam na pesquisa, desenvolvimento e fabricação de medicamentos, vacinas e produtos de consumo. Há mais de 110 anos, estamos transformando a saúde dos brasileiros. Somos líderes em soluções para a saúde em diversas áreas, como vacinas, HIV e respiratória. Nossos valores e expectativas guiam tudo o que fazemos na GSK e nos apoiam em nossa missão de ajudar as pessoas a fazer mais, sentir-se melhor e viver mais.
Microsoft Cloud for Healthcare brings together trusted capabilities to healthcare organizations and partners that enhances patient engagement, empowers health team collaboration, improves clinical and operational data insights, and protects sensitive health data. This integrated solution enables your organization to quickly access a portfolio of released and new healthcare capabilities tailored to the unique requirements of health data in the cloud. It unlocks the power of Microsoft 365, Azure, Dynamics 365, Power Platform, and our extensive partner ecosystem to create trusted end-to-end healthcare solutions. Together, it makes it faster and easier to provide more efficient care and helps support the end-to-end security, compliance, accessibility, and interoperability of health data. Microsoft Cloud for Healthcare empowers your organization to engage in more proactive ways with patients and gives caregivers tools to improve workflow efficiency, streamline collaboration, and connect data across existing sources to turn insight into action. Its connected cloud is designed to address your most pressing issues, enabling you with the speed and agility to adjust to change and build resiliency to help you weather today's challenges so you can begin to reimagine tomorrow. Microsoft Cloud for Healthcare, empowering health organizations to deliver better experiences, better insights, and better care. Learn more at aka.ms/cloud-for-healthcare.
A Pronep Life Care, uma marca do grupo Sodexo, é uma das empresas pioneiras na atenção domiciliar no Brasil. Desde sua fundação, a Pronep Life Care já cuidou de mais de 35 mil vidas e atende em todo o país mais de 2.000 pacientes por dia, atuando no cuidado e atenção às mais variadas necessidades. Tudo feito por uma equipe altamente qualificada e especializada na casa do paciente, de acordo com suas necessidades individuais e com acolhimento e cuidado. A qualidade do nosso atendimento garantiu o reconhecimento da Joint Commission International, JCI, que nos certificou com um selo respeitado mundialmente. Tudo isso para levar ao paciente e sua família qualidade de vida e conforto, sem abrir mão de cuidados médicos de excelência.
A Pronep não deixa faltar nada para minha filha. Eu sou muito bem tratada por eles. A equipe é muito boa, é tudo muito bem engrenadinho. É mais vida para o paciente, mais vida para você.
Pronep, movidos pela vontade de fazer o bem.
Nestes mais de 120 anos de história, entendemos o poder de um diagnóstico preciso e rápido na qualidade dos cuidados com a saúde. Quanto mais conhecimento, melhores são as decisões. E maiores as chances de superar desafios para vidas mais longas e com mais saúde. Por isso que na Roche Diagnóstica, investimos tanto em pesquisa para o desenvolvimento de soluções e equipamentos. Em pessoas que podem inovar e melhorar processos e serviços. E no compartilhamento deste conhecimento que produzimos para o benefício dos pacientes. Isso é valioso. Como líderes, devemos ter consciência e orgulho do nosso poder de impacto na gestão da saúde no Brasil. De desenvolver o mercado, antecipando necessidades e soluções. Queremos ampliar ainda mais nossas condições de produzir informações relevantes e seguras, viabilizando melhores decisões clínicas, para que as pessoas vivam mais e de maneira mais saudável. É isso que nos move. Possibilitar cada vez mais acesso à melhor medicina de precisão para o maior número de brasileiros.
Seja qual for o seu caminho profissional, o Senac tem um curso para você aprender fazendo. Você pode começar uma profissão do zero ou seguir nossa trilha de desenvolvimento e se aprimorar cada vez mais na sua carreira. Aprender fazendo é a metodologia exclusiva do Senac, que tem foco na prática e faz toda a diferença na formação dos nossos alunos. Saiba mais sobre ela aqui no site. Depois, continue navegando para escolher seu curso e garantir sua matrícula. Senac. Todas as formas de aprender fazendo.
Developed Protector, Environmental Infection Control. Based on international best practices, so we can assure a clean and safe hospital environment, the Protector Advantage is about people, process, and technology. Through education and management, it achieves expertly trained and motivated frontline cleaning staff committed to their vital role in eradicating hospital-acquired infections. Standard processes detail who is responsible for cleaning which items and areas and what products and techniques to use. Protector incorporates the latest, most effective, clinically proven cleaning and decontamination innovations from across the planet. And from assessment to auditing to analysis, it works with you to drive additional value from under-pressure financial resources, ensuring patients are kept free from harm so they can go home when they should. Protector, environmental infection control from Sodexo. Your advantage in the fight against hospital-acquired infections.
Você está na FIS Week. Aqui você encontra as versões imersivas do nosso evento, que vou explicar mais tarde. Você pode escolher o idioma aqui. Aqui você encontra todas as áreas da FIS Week representadas por monumentos históricos. Na pirâmide, você pode acessar o FIS e ainda conhecer mais sobre a história da construção. Aqui você poderá assistir aos painéis do FIS 21, participar da discussão através do chat, enviando perguntas e comentários, além de conferir informações sobre o painel e os participantes. O mesmo vale para o Simetria e o Commits. Clique nos monumentos para acessar os eventos. Você também pode acessar a Meeting Zone no nosso Mercado Central. Lá você pode agendar um meeting com os nossos parceiros e encontrar outras pessoas que estão participando da FIS Week. E você também pode conferir a programação, os palestrantes, relaxar ouvindo música no nosso Oasis e muito, muito mais. Aproveite a FIS Week e faça parte da maior experiência da saúde na América Latina.
Transformar o cuidado, criando soluções acessíveis, proporcionando excelência em cada detalhe, somando expertises e multiplicando as capacidades assistenciais. É para isso que o Américas existe. Composto por 18 hospitais e 37 centros médicos e centros de excelência, distribuídos em 5 estados brasileiros e no Distrito Federal, o Américas promove o cuidado em mais de 60 especialidades médicas. Juntas, nossas marcas formam um sistema integrado de serviços de saúde, garantindo acesso a um atendimento diferenciado em todas as fases da vida, com excelência no acolhimento, humanização e alta performance. É assim, unindo estrutura, solidez, experiência e paixão pela medicina, que cumprimos a cada dia a nossa missão de ajudar as pessoas a viver de forma mais saudável e contribuir para que o sistema de saúde funcione melhor para todos. Onde tem Américas, tem saúde.
Just trying to find my way. Every day, just trying to find my way. Every day.
É muito nova pra ficar tomando remédio pra louco. Essa geração é cheia de história.
I'm gonna break through.
Saúde mental é real. E quando alguém minimiza esse assunto, só aumenta o problema. Se você está passando por isso ou quer entender mais, a Amil pode ajudar. Saiba mais em amilsaudemental.com.br.
This is for scientists and those who believe in the potential of science. It starts with curiosity. A surprise in the pattern, an obstacle that can't be explained. Step by step by step, they challenge, explore, and unlock the unknown, fueled by imagination, alone and with others, repeating an experiment 1,000 times to have the chance to get it right, once, but for forever. Making brave choices, choosing to push the boundaries, and choosing again and again to be led by science. In everyday decisions, everyday interactions, no matter where they are. Because putting science at the center of everything is the best way to understand and transform disease. The best way to change people's lives. This is why we believe in what science can do.
O Rio tem um laboratório que se importa com você, certificado e acreditado. Não paramos um minuto sequer na pandemia, realizando mais de 1 milhão de exames por mês. Conheça mais. Laboratório Blessing, de mãos dadas com a saúde e com você.
Em meio a tantas mudanças, temos uma certeza: a saúde continua sendo um fator decisivo na vida das pessoas. 1 a cada 4 brasileiros busca um plano de saúde para ter atendimento de qualidade. São pessoas que se preocupam com uma boa assistência médica e odontológica, inclusive na hora de escolher um emprego. Além de oferecer saúde e melhorar o dia a dia das famílias brasileiras, os planos privados salvam vidas. Nós, da Fena Saúde, temos o compromisso de promover bem-estar e transformar a vida dos cerca de 50 milhões de beneficiários de planos médico-hospitalares e dos quase 30 milhões de brasileiros com planos odontológicos. Proporcionando assistência 24 horas por dia. Criamos mais de 3 milhões de empregos. Realizamos mais de 1,5 bilhão de procedimentos médicos e odontológicos por ano. E movimentamos mais de 3% do PIB. Nosso desafio é garantir que a saúde suplementar acompanhe as transformações do mundo, priorizando a satisfação dos beneficiários. Nossa missão é oferecer saúde, cuidado e qualidade de vida para mais e mais brasileiros todos os dias, garantindo tranquilidade em tempos de tantas incertezas.
Fazer com que as pessoas façam mais, sintam-se melhor e vivam mais. Essa é a nossa missão na GSK. Somos uma empresa de saúde global com foco em ciência. Contamos com 3 negócios globais que atuam na pesquisa, desenvolvimento e fabricação de medicamentos, vacinas e produtos de consumo. Há mais de 110 anos, estamos transformando a saúde dos brasileiros. Somos líderes em soluções para a saúde em diversas áreas, como vacinas, HIV e respiratória. Nossos valores e expectativas guiam tudo o que fazemos na GSK e nos apoiam em nossa missão de ajudar as pessoas a fazer mais, sentir-se melhor e viver mais.
Microsoft Cloud for Healthcare brings together trusted capabilities to healthcare organizations and partners that enhances patient engagement, empowers health team collaboration, improves clinical and operational data insights, and protects sensitive health data. This integrated solution enables your organization to quickly access a portfolio of released and new healthcare capabilities tailored to the unique requirements of health data in the cloud. It unlocks the power of Microsoft 365, Azure, Dynamics 365, Power Platform, and our extensive partner ecosystem to create trusted end-to-end healthcare solutions. Together, it makes it faster and easier to provide more efficient care and helps support the end-to-end security, compliance, accessibility, and interoperability of health data. Microsoft Cloud for Healthcare empowers your organization to engage in more proactive ways with patients and gives caregivers tools to improve workflow efficiency, streamline collaboration, and connect data across existing sources to turn insight into action. Its connected cloud is designed to address your most pressing issues. enabling you with the speed and agility to adjust to change and build resiliency to help you weather today's challenges so you can begin to reimagine tomorrow. Microsoft Cloud for Healthcare, empowering health organizations to deliver better experiences, better insights, and better care. Learn more at aka.ms/cloud-for-healthcare.
A Pronep Lifecare, uma marca do grupo Sodexo, é uma das empresas pioneiras na atenção domiciliar no Brasil. Desde sua fundação, a Pronep Lifecare já cuidou de mais de 35 mil vidas e atende em todo o país mais de 2.000 pacientes por dia, atuando no cuidado e atenção às mais variadas necessidades. Tudo feito por uma equipe altamente qualificada e especializada na casa do paciente, de acordo com suas necessidades individuais e com acolhimento e cuidado. A qualidade do nosso atendimento garantiu o reconhecimento da Joint Commission International, JCI, que nos certificou com um selo respeitado mundialmente. Tudo isso para levar ao paciente e sua família qualidade de vida e conforto, sem abrir mão de cuidados médicos de excelência.
A Pronep não deixa faltar nada para minha filha. Eu sou muito bem tratada por eles. A equipe é muito boa, é tudo muito bem engrenadinho. É mais vida para o paciente, mais vida para você.
Pronep, movidos pela vontade de fazer o bem.
Nestes mais de 120 anos de história, entendemos o poder de um diagnóstico preciso e rápido na qualidade dos cuidados com a saúde. Quanto mais conhecimento, melhores são as decisões. E maiores as chances de superar desafios para vidas mais longas e com mais saúde. Por isso que na Roche Diagnóstica, investimos tanto em pesquisa para o desenvolvimento de soluções e equipamentos. Em pessoas que podem inovar e melhorar processos e serviços. E no compartilhamento deste conhecimento que produzimos para o benefício dos pacientes. Isso é valioso. Como líderes, devemos ter consciência e orgulho do nosso poder de impacto na gestão da saúde no Brasil. De desenvolver o mercado, antecipando necessidades e soluções. Queremos ampliar ainda mais nossas condições de produzir informações relevantes e seguras, viabilizando melhores decisões clínicas, para que as pessoas vivam mais e de maneira mais saudável. É isso que nos move. Possibilitar cada vez mais acesso à melhor medicina de precisão para o maior número de brasileiros.
Seja qual for o seu caminho profissional, o Senac tem um curso para você aprender fazendo. Você pode começar uma profissão do zero ou seguir nossa trilha de desenvolvimento e se aprimorar cada vez mais na sua carreira. Aprender fazendo é a metodologia exclusiva do Senac, que tem foco na prática e faz toda a diferença na formação dos nossos alunos. Saiba mais sobre ela aqui no site. Depois, continue navegando para escolher seu curso e garantir sua matrícula. Senac. Todas as formas de aprender fazendo.
Developed Protector, Environmental Infection Control. Based on international best practices, so we can assure a clean and safe hospital environment, the Protector Advantage is about people, process, and technology. Through education and management, it achieves expertly trained and motivated frontline cleaning staff committed to their vital role in eradicating hospital-acquired infections. Standard processes detail who is responsible for cleaning which items and areas and what products and techniques to use. Protector incorporates the latest, most effective, clinically proven cleaning and decontamination innovations from across the planet. And from assessment to auditing to analysis, it works with you to drive additional value from under-pressure financial resources, ensuring patients are kept free from harm so they can go home when they should. Protector, environmental infection control from Sodexo. Your advantage in the fight against hospital-acquired infections.
Você está na FIS Week. Aqui você encontra as versões imersivas do nosso evento, que vou explicar mais tarde. Você pode escolher o idioma aqui. Aqui você encontra todas as áreas da FIS Week representadas por monumentos históricos. Na pirâmide, você pode acessar o FIS e ainda conhecer mais sobre a história da construção. Aqui você poderá assistir aos painéis do FIS 21, participar da discussão através do chat, enviando perguntas e comentários, além de conferir informações sobre o painel e os participantes. O mesmo vale para o Simetria e o Comets. Clique nos monumentos para acessar os eventos. Você também pode acessar a Meeting Zone no nosso Mercado Central. Lá você pode agendar um meeting com os nossos parceiros e encontrar outras pessoas que estão participando da FIS Week. E você também pode conferir a programação, os palestrantes, relaxar ouvindo música no nosso Oasis e muito, muito mais. Aproveite a FIS Week e faça parte da maior experiência da saúde na América Latina.
Transformar o cuidado, criando soluções acessíveis, proporcionando excelência em cada detalhe, somando expertises e multiplicando as capacidades assistenciais. É para isso que o Américas existe. Composto por 18 hospitais e 37 centros médicos e centros de excelência, distribuídos em 5 estados brasileiros e no Distrito Federal, o Américas promove o cuidado em mais de 60 especialidades médicas. Juntas, nossas marcas formam um sistema integrado de serviços de saúde, garantindo acesso a um atendimento diferenciado em todas as fases da vida, com excelência no acolhimento, humanização e alta performance. É assim, unindo estrutura, solidez, experiência e paixão pela medicina, que cumprimos a cada dia a nossa missão de ajudar as pessoas a viver de forma mais saudável e contribuir para que o sistema de saúde funcione melhor para todos. Onde tem Américas, tem saúde.
Just trying to find my way. Every day, just trying to find my way. Every day.
É muito nova pra ficar tomando remédio pra louco. Essa geração é cheia de história.
I'm gonna break through.
Saúde mental é real. E quando alguém minimiza esse assunto, só aumenta o problema. Se você está passando por isso ou quer entender mais, a Amil pode ajudar. Saiba mais em amilsaudemental.com.br.
This is for scientists and those who believe in the potential of science. It starts with curiosity. A surprise in the pattern, an obstacle that can't be explained. Step by step by step, they challenge, explore, and unlock the unknown, fueled by imagination, alone and with others, repeating an experiment 1,000 times to have the chance to get it right, once, but for forever. Making brave choices, choosing to push the boundaries, and choosing again and again to be led by science. In everyday decisions, everyday interactions, no matter where they are. Because putting science at the center of everything is the best way to understand and transform disease. The best way to change people's lives. This is why we believe in what science can do.
O Rio tem um laboratório que se importa com você, certificado e acreditado. Não paramos um minuto sequer na pandemia, realizando mais de 1 milhão de exames por mês. Conheça mais. Laboratório Blessing, de mãos dadas com a saúde e com você.
Em meio a tantas mudanças, temos uma certeza: a saúde continua sendo um fator decisivo na vida das pessoas. 1 a cada 4 brasileiros busca um plano de saúde para ter atendimento de qualidade. São pessoas que se preocupam com uma boa assistência médica e odontológica, inclusive na hora de escolher um emprego. Além de oferecer saúde e melhorar o dia a dia das famílias brasileiras, os planos privados salvam vidas. Nós, da Fena Saúde, temos o compromisso de promover bem-estar e transformar a vida dos cerca de 50 milhões de beneficiários de planos médico-hospitalares e dos quase 30 milhões de brasileiros com planos odontológicos. Proporcionando assistência 24 horas por dia. Criamos mais de 3 milhões de empregos. Realizamos mais de 1,5 bilhão de procedimentos médicos e odontológicos por ano. E movimentamos mais de 3% do PIB. Nosso desafio é garantir que a saúde suplementar acompanhe as transformações do mundo, priorizando a satisfação dos beneficiários. Nossa missão é oferecer saúde, cuidado e qualidade de vida para mais e mais brasileiros todos os dias, garantindo tranquilidade em tempos de tantas incertezas.
Fazer com que as pessoas façam mais, sintam-se melhor e vivam mais. Essa é a nossa missão na GSK. Somos uma empresa de saúde global com foco em ciência. Contamos com 3 negócios globais que atuam na pesquisa, desenvolvimento e fabricação de medicamentos, vacinas e produtos de consumo. Há mais de 110 anos, estamos transformando a saúde dos brasileiros. Somos líderes em soluções para a saúde em diversas áreas, como vacinas, HIV e respiratória. Nossos valores e expectativas guiam tudo o que fazemos na GSK e nos apoiam em nossa missão de ajudar as pessoas a fazer mais, sentir-se melhor e viver mais.
Microsoft Cloud for Healthcare brings together trusted capabilities to healthcare organizations and partners that enhances patient engagement, empowers health team collaboration, improves clinical and operational data insights, and protects sensitive health data. This integrated solution enables your organization to quickly access a portfolio of released and new healthcare capabilities tailored to the unique requirements of health data in the cloud. It unlocks the power of Microsoft 365, Azure, Dynamics 365, Power Platform, and our extensive partner ecosystem to create trusted end-to-end healthcare solutions. Together, it makes it faster and easier to provide more efficient care and helps support the end-to-end security, compliance, accessibility, and interoperability of health data. Microsoft Cloud for Healthcare empowers your organization to engage in more proactive ways with patients and gives caregivers tools to improve workflow efficiency, streamline collaboration, and connect data across existing sources to turn insight into action. Its connected cloud is designed to address your most pressing issues. enabling you with the speed and agility to adjust to change and build resiliency to help you weather today's challenges so you can begin to reimagine tomorrow. Microsoft Cloud for Healthcare, empowering health organizations to deliver better experiences, better insights, and better care. Learn more at aka.ms/cloud for healthcare.
A Pronep Lifecare, uma marca do grupo Sodexo, é uma das empresas pioneiras na atenção domiciliar no Brasil. Desde sua fundação, a Pronep Lifecare já cuidou de mais de 35 mil vidas e atende em todo o país mais de 2 mil pacientes por dia, atuando no cuidado e atenção às mais variadas necessidades. Tudo feito por uma equipe altamente qualificada e especializada na casa do paciente, de acordo com suas necessidades individuais e com acolhimento e cuidado. A qualidade do nosso atendimento garantiu o reconhecimento da Joint Commission International, JCI, que nos certificou com um selo respeitado mundialmente. Tudo isso para levar ao paciente e sua família qualidade de vida e conforto, sem abrir mão de cuidados médicos de excelência.
A Pronep não deixa faltar nada para minha filha. Eu sou muito bem tratada por eles. A equipe é muito boa, é tudo muito bem engrenadinho. É mais vida para o paciente, mais vida para você.
Pronep, movidos pela vontade de fazer o bem.
Nestes mais de 120 anos de história, entendemos o poder de um diagnóstico preciso e rápido na qualidade dos cuidados com a saúde. Quanto mais conhecimento, melhores são as decisões. E maiores as chances de superar desafios para vidas mais longas e com mais saúde. Por isso que na Roche Diagnóstica investimos tanto em pesquisa para o desenvolvimento de soluções e equipamentos. Em pessoas que podem inovar e melhorar processos e serviços. E no compartilhamento deste conhecimento que produzimos para o benefício dos pacientes. Isso é valioso. Como líderes, devemos ter consciência e orgulho do nosso poder de impacto na gestão da saúde no Brasil. De desenvolver o mercado, antecipando necessidades e soluções. Queremos ampliar ainda mais nossas condições de produzir informações relevantes e seguras, viabilizando melhores decisões clínicas, para que as pessoas vivam mais e de maneira mais saudável. É isso que nos move. Possibilitar cada vez mais acesso à melhor medicina de precisão para o maior número de brasileiros.
On our website and in our apps, you can schedule meetings with our partners. You have to access the meetings zone on the website and get connected. I must confess that I'm eager to see our next panel. Well, that's true. It's a very current subject for us. We'll talk about the responsibility of healthcare influencers. Andre Balalayo, one of the presenters of the FIS Initiative podcast and market director, Carlos Brandão, co-founder of the Sentizando Profile, and a biomedicine student, Luis Fernando Correa, a physician and healthcare commentator for Global CBN International Radio. Melanie Fontes, coordinator of the COVID-19 network, and Natalia Cominali, content director and CEO for the Future of Health. And we should not forget, please influence your friends and tag us on our social media and use the FIS Week hashtag. Enjoy. The responsibility of influencers in the healthcare sector. Good morning. Good morning, Carlos, Fernando, Melanie, Natalia. First, I want to greet our audience. Thanks for your time. I'd like to thank the FIS initiative for putting together such a huge event and such a great event. And also thank you, our panelists, for this extremely different discussion. It's not a technical subject, but it is very relevant about the responsibility of influencers. And in this panel, what's nice about it is that each of you comes from a specific and different background, from different communication channels. And our intention is to have a conversation with our guests. So I'll start with the ladies, and I'll start with you, Natalia. A very straightforward question. What was the difference between communication in the healthcare industry before the pandemic and during the pandemic, since it's not yet over? Good morning, Andre, and good morning to our audience. I want to thank the FIS initiative for the invitation. So your question is about the communication in the pre and post-pandemic scenario. I'll quickly introduce myself. I've always covered health-related matters. A journalist specializing in health. And before COVID, I covered other pandemics, epidemics, the Zika virus and others. And we'll have a lot of time to discuss this, but I think the most important thing that changed was the way the internet gives voice to everyone, especially during the pandemic, when people had to stay locked in due to the situation that we were going through, and they were hungry for information and as quickly as possible. We ended up using social media and influencers as a way to consume content. That did not happen to the extent that we're now seeing. In the past, the social networks were a certain source of information. We have Drauzio Varela as a healthcare influencer, but he's a very specific voice. We did have some physicians that talked about health, and the fitness bloggers that talked about healthy eating habits, patients talking about their stories, cancer patients and whatnot. So there were these very specific things, but with the pandemic, that changed a lot. Now we have a huge diversity. It is a more specialized type of communication. We have scientific communicators that do make a difference in terms of spreading and sharing data and information. And we had to educate the audience in terms of what content they can and should consume, who's reliable. When you disseminate information from several different sources, who are you going to trust? So I think the biggest difference is in the way the message is amplified. Thank you. And Dr. Fernando, your commentator in a very formal communication and media. What did you feel? Was there a bigger pressure on your opinions? People all of a sudden found out what clinical tests were and other terms as well. So what's different? You're on mute. We can't hear you. So as we get his audio fixed, I'll ask you, Melanie, you have an important participation in that you're in a network that works directly with COVID-related scientific information. So how did you start? How did you feel? Or when did you feel that this type of communication has a good penetration? What was it like for you? Well, I started to create the network back in February 2020 with some friends. Initially, our intention was to create a forum for healthcare professionals to discuss scientific data from other countries and articles to be better prepared about what to do in face of the COVID pandemic. That was our initial intention, but then we saw the need for a closer contact with the general public, disseminating information in a more accessible and playful manner, making it more interesting so that people in general could use that information to make their decisions. And it was based on that our network structured itself and started making connections with other pre-existing groups so that we could keep in touch about pandemic-related data and exchange those data with the population. And that's what we ended up doing, both in terms of the network and in terms of my personal profile. Thank you. Dr. Luis Fernando, I think you're back, right? We can hear you. Good morning, Andrea. Good morning, everyone. It's a pleasure to be here. And it's a pleasure to meet you in person, as it were, because we only see our tweets. Well, I'm a physician for 20 years. I have a bulletin on CBN every day. And well, during the pandemic, we had to do two things. First, we had to inform the population, and we had to find a way to fight misinformation. And I think that was the biggest challenge. With Betty Zanji and Carlos and other scientists who have a fundamental role in the fight against misinformation. But this is still a huge struggle. The entire programming grid of the radio CBN changed at the time, and we doubled down on the time that we spent giving health-related information. So there were lots of changes. But I think that what we should do now, Danielle, is to think about how to leverage everything that we went through and this willingness to learn by the population, even in the face of misinformation, how we can leverage all that and continue to deliver knowledge. Of course, we became monothematic. We only talked about the pandemic and COVID and that kind of stuff, but we have to expand our possibilities. The biggest problem in Brazil and maybe in the world, is what we call healthcare mindset, which is something we don't have. The knowledge level of the population about health is really low. We're living in our bubbles, and there are many people who are interested in health within our bubbles, but we have to expand that. That's very interesting. I think that one of my first lives during the pandemic was with Natalia. I don't know if I'm wrong, right? Yes, the first of many lives we had during the pandemic, right? Yes, that's right. You mentioned something really interesting, Doctor, about misinformation. I participated in a discussion at UNESCO, and they were talking on the one hand about this huge amount of information, but on the other hand, health is shared knowledge. And at UNESCO, people are saying that misinformation is as bad as good information with good intentions behind it. And the population is not educated to analyze that, and probably never will be. So we have the role of training the trainers and educating the sources of information, as it were. So the work that you do, you disseminate a lot of content very broadly, and you have a huge responsibility on your shoulders in terms of making it work. Hi, good morning. It's a pleasure to be with you. The webpage, when we created it, we had no intention of disseminating scientific information to the population. We were joining the biomedicine course, and we wanted to establish a channel of communication with other students. At the University of Pernambuco, we have this adopter mindset. As soon as you join a university, a more experienced student will start guiding you, as it were, and giving you tips. And that's what we wanted to do, to create a means of communicating with this type of person. So we started discussing scientific articles and Congress, but we started adopting a simpler terminology. And with that, we started attracting the general population. And that was something we didn't expect. So we started thinking, well, let's talk about some fun facts like caffeine, because it's interesting, or a certain molecule, or why do kittens purr, or let's talk about healthcare in general, or the importance of vaccines, where the vaccines came from. So after that, we started talking about science in general, not only healthcare, but of course, healthcare is the most important subject we talk about, because it's the center, the main focus of our studies, our course. Sure. And there's another thing. I felt that people started approaching me to ask me about things, and to tell me that, well, now I know what you do. So public health policies, there was something that was just written somewhere and kept in a jar, and now it's not anymore. So Natalia, my parents are physicians, and well, on several different occasions, I felt fed up of talking about COVID, but we have to go on talking about it. So how do you see, I know that COVID is 90% of what you discuss, but how do you see the possibility of attracting people to discuss other subjects in addition to COVID? Well, that's a great question. I think we cannot miss that opportunity. Now, everybody is looking at the healthcare industry, and people got curious about it, and they're interested, and we cannot miss the opportunity of trying to engage people in other subjects. Of course, COVID is still an essential subject because the pandemic is not over. The vaccination is still ongoing. We have to be careful. We all know that. So I don't think it's something that we're going to forget anytime soon during the next months or years. it's still a relevant subject, and there are still many questions around it. And it's not like the subject is over. The questions are now different because Christmas and New Year are just around the corner. So should I take a second shot or a third one, or get tested? So we have to work on that. But how can we attract people towards other subjects? I think we have to adopt the same methodology as we did with COVID. If you want to talk about public health, no one in the past was aware of the importance of the Brazilian public healthcare system. But now, because of the vaccine, people are now posting hashtags. Long live the Brazilian public healthcare system on social media. So I think we should do a campaign about the importance of vaccinating children, adolescents, the importance of providing funding to other diseases. What happened to cancer patients that did not do their screening tests, such as mammograms and so forth. So I think that we could expand this subject by bringing in necessary information to the table. And there are several different groups that we can break the population down into. There's the general public that wants to know what to do about the vaccine and if they can go to parties or not. There's a more segmented audience that really likes the healthcare subject, and this group is having lots of discussions about the transformation of the sector. There are many panels in this event talking about what's going to happen moving forward with healthcare, sustainability, and so forth. So all these subjects are joined together, and I think that we can discuss them in a closer manner. I think we should leverage this opportunity and talk to people in a way that they can understand us. Well, that's really nice. I'm in the US. I live in New York, and I have many friends from the UK. And back in the beginning, I would check my Instagram feed, and there were lots of Save the NHS hashtags. And I was wondering, well, will that ever happen with the Brazilian public healthcare system? I think maybe one of the only positive legacies that we have from this pandemic was, like you said, people rediscovered, even though the Brazilian public healthcare system has many challenges, and in the US we do not have a public healthcare system, and it's more or less like that. The government itself was funding vaccines free of charge for everyone, and kind of mimicking the Brazilian healthcare system. And Dr. Luis Fernando, picking up on that, maybe on your end, there's an even more important role, because being inside CBN radio, several other commentators will talk about health, because of course it's at the top of our list, but other commentators, which are not from the healthcare industry, well, what's it like for them? I mean, your role is also one of educating them and giving them guidance. So what's your routine like to make sure that information that's passed on to your colleagues is accurate? Well, that's interesting, because even though I've been at CBN Radio for 20 years, I think that since when we started the show, it was the cassette tape days. I'm sure that Carlos has never even heard about that. So the show started being recorded in a cassette tape, and then we started adopting new technologies. And I also went through the same experience on TV. When I went to Global TV, I think I was the first physician inside a TV newsroom. And Drauzio, he's in a newscast, but he only shoots certain specific parts of the show. And I used to tell that an analyst has a lot of knowledge, a sea of knowledge that's only 10 inches deep. And Of course, we have to face some prejudices and biases that the population has, and journalists that are not specialized, do not specialize in healthcare, they'll have the same prejudices as anybody else. And we apologize, he's breaking up. So we have to use WhatsApp and text messages and tell people off and monitor people. The translation booth apologizes, the speaker is breaking up.
That's very nice. People ask me, why don't you give your opinion about this vaccine or that vaccine? That's not right. That's not the right thing to do. Experts usually are the last people to speak. Anyway, but there's something that is very nice about it. What Carlos and Melanie said. There will be a new generation of young people that will be able to communicate, to talk about health-related issues. And they had to learn on the spot. What's your take on this responsibility? There's no course on responsibility. It's very fragmented. Is that some sort of media training? How do you look for that kind of information? How do you approach that communication? Because you know you end up influencing a lot of people. Yes, there are courses on scientific communication. There are many prestigious institutions. The AMERAC task force, actually there are several courses available, even remote ones, to learn about how to communicate scientific information, how to be responsible, evidence-based manuals, just like José Alencar published at Sanar recently. In other words, there's a lot of content if you want to learn more about evidence-based science that is applied to health, but how to apply this type of content responsibly, providing information, not oversimplifying it. This is something that has to be done. It's being encouraged as we speak. Our network aims at being this reference so that people can resort to that kind of information to have curated scientific information. When I started that communication course back in 2015, and especially during the pandemic, I didn't have the chance to take that course. So it was trial and error. More successes than failures, because any minor failure could have had very detrimental effects. So I was extra careful so that there wouldn't be any negative repercussions, especially during the critical times. We ended up filling that gap of information over social media. That was a very critical point in time, and information had to be double-checked. Yes, thank you for bringing that up. These programs were very restricted. I was once asked about the Cochrane, so almost nobody asked me about it. But again, it's becoming more and more accessible to whomever is looking for that kind of information in course. Back to you now, Carlos. Let's take a step back. Before they look for that training, quote unquote, in health education, they must first be aware that they need it. You talk to young people they're just starting out. How do you communicate that? How do you instill that notion that they have to be responsible? Well, the first contact was through extension programs. We go away from the university campus to reach out. People often ask me how much the tuition is, and I'll tell them, oh, this is a public, it's free of charge. So many people know where the campus is, but they have no idea what goes on in here. So we came up with analogies. Okay, you like serious? Okay, let's come up with a post making that analogy between friends and parts of the body, LAC and COVID, ER and transplants. I mean, we try to come up with content that is not scientifically related per se, and trying to connect to something they already know. let's come up with an Instagram post. So let's try to make that as visual as possible. It's social media. People want to have fun and relax. No one is willing to read that long text. So we came up with something that is visual, which is pleasant, trying to come up with an analogy and, of course, convey the essence of the message. Health is interesting overall when we compare to, of course, the pandemic brought that to the surface at a much larger scale, but has always been an attractive subject. But just like you're coming up with this new format, Natalia, you have a communications channel way beyond communication per se. Anyway, there's a boom out there. So many people wanting to analyze data. I say, oh, I came up with a database, and from the health public system, I say, oh, that's fine. We've been doing this since 2011. So how do you see yourself next year? What are we going to be talking about? What will our role be in the post-pandemic world? Well, that requires a lot of reflection. Let me think about that. Before I do that, let me make 3 comments. Dr. Luis Fernando says that Natalia is sometimes upset. No, I don't get upset. I think that we have to talk about the importance of how training is important when you talk about health. Of course, there are journalists that are not health specialists. The reality of a newsroom is different from what one would expect, different from the ideal world. So it's difficult to specialize in something when you have to address so many different topics. So you have to be a good communicator. You have to think about scientific communication. And then Andrea mentioned it. We have a lot of information available, more structured courses. That was not as accessible pre-pandemic. There's so many online courses available, renowned people coming up with new content, and we didn't have that before. Our training was taking specific mini courses at one hospital or at a clinic. So I'm very pleased to find out that this is here to stay. And now let me address your question about the post-pandemic world. In that sense, health-related communication will be stronger. I see more colleagues studying and getting ready. I want to see more people bringing in good quality information to being able to analyze databases and being humble enough to know what their limitations are. You won't be able to address these things in just 1 hour. Okay, let's try to interview those that have been doing this for a decade or so. So we're coming up with that awareness amongst communicators. What will Natalia be, or what will I do after the pandemic? I have this content hub. That's my goal, to have a channel for social media, podcast, text. That's my mission. That's my goal. I truly believe that I have to convey a message to people in a way that is simple. They can actually understand the message that is being conveyed, not only for the general public, but within the industry. Journalists that have to talk about different subjects, and they may not be as familiar with those things as one would expect. And you can only change your reality once you understand it. You can only engage people when they truly understand that you have to get vaccinated. There's no point in just saying, go get a vaccine. So in the future, that message will be more embedded, and we can take that to other types of content. I believe that the audience will be more engaged than it is today. I don't know whether I answered your question. No, I loved your answer. Perfect. There's something else, Dr. Luis Fernando, back to you. I've been working on evidence-based medicine and any other fancy jargon. I've been doing this for over 10 years. And one of the most important things is to curate data. We have a Coursera generation that have learned to come up with a model without the necessary context, not knowing whether the data was correct or not, whether there's any selection bias or information collection bias. And also in the world of communications, we have to take into account as to how to curate that kind of information too. Oftentimes you hear an expert's opinion from Harvard, and you never know whether that's true or not. What's your opinion as to how can we trust information? What kind of mechanism can we use to help the population to tell what's true and what's not? I think we'll have to learn to respect information. I've been working with hospitals, trying to look for information in different databases. I'm sorry, but it's breaking up. We cannot interpret.
ciência dentro das universidades para os cientistas. Até a pandemia era tudo que era isso. O cientista fazia trabalho para publicar na revista e falar no congresso, né? O médico também fazia isso. Então, mas os cientistas principalmente a gente conseguiu ver o tamanho vamos dizer assim, o horizonte tão largo que é assim. Enquanto na área da saúde ficava muito restrito ali no médico, no hospital, no máximo a gente ia até o laboratório de coisa básica, aparecia alguma coisa muito nova, mas a gente agora de coisas que a gente via que existia. Eu acho que trazer esses divulgadores científicos para dentro, entre aspas, ou para dentro desses hubs de divulgação e de comunicação que vão surgir. Vocês vão ver, provavelmente vendo, né? O Átila é um exemplo disso, um cientista que virou, né? Por quê? Porque a própria indústria também fica olhando. Eles estão olhando e vendo. Melhor ter esse cara aqui no meu time. Contrata. Então isso vai acontecer. Eu acho que o futuro é esse. Eu fico preocupado com uma coisa. Eu não sei respondendo. Eu acho que ainda tem um pouco de rio de como será 2022. A gente olhar para a Europa de hoje, entendeu? Esse foi o pior acho que esse é o pior da história, né? Divulgação científica é porque você fala de ficção científica. Agora o chato aqui é o Luiz Fernando, que tem falado todo dia dizer para continuar usando máscara, entendeu? O povo não quer. Eu digo ali na TV que acabou a pandemia, mas não. E eu acho que talvez ainda não é o papo de 22, mas 23 eu não sei. A gente tem que trazer cada um desses garotos para junto da gente.
Muito bom. Eu jogo no time dos otimistas cautelosos. Por isso eu falo 22. Mas certamente.
I am a cautious optimistic, as I used to say. Sometimes it's like, the newspaper said that the pandemic is over, but it's really something gradual, and that you go through a very strong spike, and then you have to gradually come down from there. And Melanie, we as researchers, we live in our own ecosystems, as it were. And as Dr. Luis Fernando said, each bubble has its own congress. And in a certain way, the pandemic, I think that the COVID network that you lead is all about that, about bringing together people from different backgrounds. Obviously, that used to happen, but it was not super scalable. So what's it like for you? Or what are the difficulties that you're facing in terms of bringing people from the academia to communicate to people that are not from the academia? Well, it's really nice to see that people are really interested in breaking these barriers that we often create. We stay away from the academia and the environment of scholars because we usually think that it's more comfortable to talk among ourselves because we use the same terminology, the same scientific language. But what I think is that this sense of social responsibility has hit us at the same time after the pandemic. And many people started having this idea of moving forward with this initiative. And this is where our initiative came from. We wanted it to be perpetuated after the pandemic. And that's not an idea that came just from myself or any other coordinators. This is actually by request of almost 50 or 60 members that the network currently has, and that they wanted to help people who want to tread an easier path than we did in the beginning. So I think it's about that. I think it's about optimizing the path forward and paving the path for other people to tread. And the fact that we have people from different industries, that's what it's about. We want to communicate among ourselves and establish this conversation in a fully virtual environment and transform that into a communication that will reach out to other audiences outside of the network. So, of course, each of us has its own way of trying to understand how to best communicate the subject that they specialize in. But I think that we also find subjects in common, because we never, ever write our articles only from the perspective of physicists or biologists, or no, you have somebody from risk management who works for a business, a private company that is talking about social distancing and vaccines with a biomedic. So there's this crisscrossing across several sectors that initially may apparently not converse, but I think that it makes less and less sense now to do science from one single perspective only. What really makes sense now is to bring this knowledge that may be initially highly focused on that specific sector, and we should disseminate it across a different sector. And I think that in spite of the problems with peer reviews and other challenges, it was a tool that let several different people from different backgrounds discuss those subjects before the article was published. And what I saw was that lots of aspects from that discussion were incorporated, making the article much better. So I think this is a very nice initiative, and hopefully not only scientific communication will continue to be broad and encompassing in that regard, but I also, hopefully, that will be brought into the academia, because, of course, this benefits everybody. I also had this feeling that the academia is learning now to better explore other tools apart from the final article. There was this occasion when a friend of mine said, well, I read one of your articles and I was able to understand it, and was like, wow, that's good. I'm a chemical engineer, but I work in the health sector. But well, anyway, that's just a fun fact. We're moving towards the end of our panel. So I'd like to ask you to please say one or two words about what you think your role is in this regard. So I'd like to start with you, Carlos. How do you see yourself and your role moving forward? As Dr. Lewis and Melanie said, we from the younger generation were really upset by the fact that society lost contact with science. Everything was well, and then came the pandemic. So the scientists started telling everyone to stay home and do social distancing and wear masks. But that was a person that didn't have contact with the society before the pandemic. And now that's a person that wants to set rules and tell you how to behave. People didn't accept that. So we think it's really positive that this contact has now been established, and we wish to maintain it. There's this OASE page that we really like, because it involves people that want to talk to scientists, but they have no idea how to do that. They don't know how a public university works or how research works, and they're really interested. But we see that the university does not open its doors, and we, from the younger generation, we want to create this connection. Great, thank you. Natalia, what are your final comments? Well, I want to thank you for the excellent discussion. This is something that we need to have more of, sit together and discuss. Like everybody said, Melanie, Carlos, Luis, and you, Andre, Each one of us has a very important role in health communications and in the difference that it makes for society. And that's why this type of event is so important. Well, I hope that communication continues to be strengthened, that this is not only a fashion that people are all of a sudden interested in, and then this interest dies as soon as it appeared. And I think that, well, more than that, and I think that that's clear for the population in general and for people who consume this content. The content that we write is difficult. It's not that simple to simply pass on information to people, because like Melanie said during her speech, she preferred to overdo things in the beginning. That's what we all do. We are excessively careful. We do a lot of research. We know about the importance of preprints and other stages of a publication, but it's not only about just saying something off the top of your head. So hopefully people will understand how complex information is. And I think that we have a long way ahead of us being able to explain and being credible on camera, on YouTube, anywhere. That does not mean that you're passing on accurate information. And I think that that's something that is still present in everyone's subconscious. Even though we focused heavily on the positive aspects during our conversation, I think that we still have to try to combat the super dangerous influencers. They might be micro or huge influencers, but the thing is, they are good at speaking and they're deceitful. So hopefully, what I expect is that we'll do our jobs helping fight misinformation that is so widely spread nowadays. Thank you very much. Thank you. That was a great comment. And Melanie, for your last words, and Dr. Luis Fernando. Well, first and foremost, I want to thank you for the opportunity to be here with such respectful and inspiring people in everything they do. And I also want to invite our audience, and I would like to be invited to do this back in the past, invite anybody to disseminate scientific information. You don't have to be a scientist to do that. And it's important to highlight that, because many people end up feeling prevented from doing something that they would genuinely like to do and would do well, because they are not from that industry. And I saw several people from outside the academia that are extremely good at disseminating scientific facts, because they're good at studying, doing research, and being as accurate as possible. And with that, that person has created a connection with science, and that connection will probably never be broken. When you become closer to science, you also bring society closer to science as a whole. If we can all do that, we'll be talking about a solid team that moving forward, we'll be talking more and more about science and looking for scientific facts before making any decisions, because science is truly an ally to society. And the anti-vax movements and others will start losing strength. So my invitation to all of you is, if you feel like disseminating scientific information, please do so by all means. We need more voices and people willing to do that. And if that's an entry door into the scientific world, and after that, if you feel like becoming a scientist, well, that's even better. It will be a pleasure to have you as a colleague and an activist. Thank you. That's great, Melanie. Dr. Luis Fernando. Well, thank you, everyone. It was truly a pleasure to meet you, albeit virtually. Like Melanie said, we only see each other on Twitter. I just met Carlos. I'll start following them. And I will also have to add my 2 cents to this story, which is all bells and whistles. But we have to say that the power of the negative side is really strong, and they have a lot of money. And at the end of the day, we must understand that there's probably one key aspect missing from all that. Science needs to understand that it will not get accepted just because it's right. We have to learn that by demonstration, but we have to organize ourselves to really work towards that. Because these criminals, and that's what they are, they're really organized and they make a lot of money. And they use that money to kill people like they did during the pandemic. And my words may sound harsh, but that's true. And we have to bring more people into the conversation, talk more about science and health, but we have to be organized and fight these movements, these criminal initiatives. We cannot think that simply because we're doing good, that we'll be winners. We'll only win if we are organized in what we do. We will not win against the anti-vaxxer movement or denialism just because we're saying accurate things. We have to play the game, not from a negative perspective, but we have to play the game. We have to be able to work with the algorithms of each platform, each social media. We have to be able to work with the all of the mechanisms, because otherwise we'll be swimming against the tide. And of course, the tide is huge. And that's something that we only feel when things happen. But the anti-vax movement has been there for how long? I can't even tell. One of the most important senators in the US lives off of votes for the anti-vax movement. And there's this guy, Dr. Mercolo, with this horrible name, and he actually makes money by being a con. And we can't relax. We have to work against that. We have to attract youths and disseminate scientific facts. Of course, everything that we mentioned here is nice and is good, but we have to use that to fight these people. Otherwise, we will continue to fight and not reach anywhere. I'm sorry. I've been the bearer of bad news, but it's actually not bad news. I just want to draw your attention to that, to the fact that we have to be able to organize ourselves and deal with bots and et cetera and whatnot, the algorithms. We have to play the game. Well, that was a really nice speech, Doctor. And I think they really summarize our roles and responsibilities. I think that in addition to our responsibilities, which is the basic, knowing what your responsibility, what your role is, I think 2 things have to be made very clear, especially if you're beginning on this path, which is a relevance and consistency. Doing something right one day is easy, and doing something right every day is not as easy. So picking up on what you said, Doctor, it's all about consistency. It's about speaking the truth every day, day after day. And I think that is the way forward. And relevance, well, it's really important to say that the academia will give us that. It's not enough to do an analysis and publish the results of your analysis. You have to ask the right questions. You have to answer the right questions. And during the pandemic, we're doing that very well. We're answering the right questions, but we should continue doing that, continue to answer the right questions and not simply analyze data just for the sake of doing so. So this is the end of our conversation. It was actually much better than I expected. Thank you for your time. I want to thank our audience, our viewers, and I'd like to remind you that our panelists, they all have a very, they're on social media. Please follow them. Follow our podcast. I'm with Manu, and we have one episode every 15 days. And thank you. See you soon.
A Abrange completa seus 55 anos de caminhada com o propósito de democratizar o acesso ao sistema privado de saúde, de eficiência e qualidade. Enxergamos o futuro com bons olhos, mas sempre priorizando o presente. Abrange 55 anos. Nossa origem, nossas histórias e nossas conquistas.
Desde que a Covid-19 chegou ao Brasil, uma força-tarefa de proporção histórica entrou em ação, ampliando a parceria entre os setores de saúde privado e público. Um conceito central para nós ganhou ainda mais força: a saúde brasileira é uma só. É um orgulho fazer parte dessa corrente. ANAP, Associação Nacional de Hospitais Privados, unidos pela saúde.
O conhecimento transforma. A transformação te carrega para o futuro. Onde você quer estar daqui a alguns anos? Qual habilidade você quer aprimorar? Que profissional de saúde você deseja ser? Como caminhar de mãos dadas com o seu futuro? As respostas de todas estas perguntas não se alcança sozinho. Ask Mind, porque nós somos incansáveis por conhecimento. E você?
A Bradesco Saúde desenvolveu uma série de iniciativas que promovem orientação e cuidado em meio à pandemia de Covid-19. É o Saúde Digital. Com ele, quem tem Bradesco Saúde pode realizar consultas médicas por videochamada sem sair de casa. Veja como funciona. Para dúvidas e sintomas de Covid-19 ou outras questões de saúde, você deverá acessar o app Bradesco Saúde. Se você ainda não tem instalado, faça o download gratuito na App Store ou no Google Play. Para consultas médicas regulares com médicos referenciados, acesse o site bradescosaude.com.br. Confira as especialidades disponíveis para atendimento por videochamada e como agendar sua consulta. Bradesco Saúde, ao seu lado contra o coronavírus.
É pra ficar junto.
Inspira.
É pra saber sua história. É pro seu estilo de vida. É pra olhar nos olhos. É pra cada fase da vida. A DASA é uma rede de saúde integrada que acompanha as pessoas ao longo da vida. DASA é pra toda a vida.
Para ser referência em medicina, é preciso ir além. É preciso ciência, método de pesquisa, fomentar conhecimento, compartilhar e formar talentos. Ao longo do tempo, investimos para termos o melhor corpo médico, as melhores instalações, a melhor equipe assistencial, a tecnologia mais avançada. É nisso que acreditamos. É isso que buscamos. Somos o Hospital Moinhos de Vento. Referência em medicina, referência em saúde.
The body is an amazing organism, designed to run marathons, think of ideas, and see a beautiful world. It's capable of complex tasks. But when the body is compromised by disease or disorders, disabled by trauma or wounds, it needs help getting better. And that's why we're here, to create medical technology that saves lives and changes lives. For the heart, the soul, the ambitions, and the dreams of every person we touch, we are here to innovate, to look at challenges from all angles, to follow patients beyond diagnosis, through treatment and recovery, to get them back to their best body, living their best lives, and being their best selves. Our ambitions are big. We are working to give people surgery without incisions, contact lenses that treat allergies, implants that monitor themselves, real-time maps of the heart. We are redefining what the body can accomplish. And even though we are a diverse group of businesses, we share a common goal: save lives and ignite all that's possible in every body.
Super-heróis são seres com poderes mágicos que voam, que enxergam o que ninguém enxerga. Hoje, fica claro que vivemos rodeados de super-heróis, dirigindo, acolhendo, cuidando, que tem feito da proteção do outro sua missão. Eles sempre estiveram aqui, só estavam disfarçados. Homenagem a quem tem feito mais do que o seu trabalho para mais gente ficar bem. Mater Dei 40 anos.
Em 2021, o prontuário eletrônico do paciente do SOMV
Solução da empresa para o setor hospitalar ganhou pela 6ª vez consecutiva o reconhecimento de melhor da América Latina, de acordo com o Instituto Norte-Americano CLES. Uma vitória que é nossa, de cada um que trabalha na MV. Quem faz o PEP sabe que por trás da solução tem muito esforço, dedicação e comprometimento. É por isso que esta conquista não é apenas da MV, é do Brasil, é nossa.
Nós nascemos na saúde e nos movemos pela saúde. Impulsionados por essa paixão, nos tornamos uma das maiores empresas de tecnologia para a saúde do Brasil. Nosso caminho é trilhado por 400 colaboradores e mais de 6.000 clientes. Somos tecnologia que evolui todos os dias. Somos Fixion.
Inspirar pessoas a cuidar de pessoas. Isso está conectado no olhar e no sorriso de quem é Sabin. De norte a sul do país, o jeito Sabin conecta você ao que existe de melhor em saúde integrada. Construímos pontes e histórias para contribuir com a comunidade, o meio ambiente e com um ecossistema empresarial mais humano, diverso e inclusivo. Seja aqui na sua casa ou na nossa casa, estamos de mãos dadas com a inovação e tecnologia para que a sua jornada de saúde seja completa. Grupo Sabin, presente e futuro conectados com a sua saúde.
Nascemos com o desafio de mudar o olhar para a saúde de cada pessoa, transformando informação em conhecimento. Tudo em um mesmo lugar, dados e serviços juntos para permitir pela primeira vez que cada um tenha a visão completa sobre sua saúde. Todos reunidos em uma plataforma, unindo forças para criar soluções extraordinárias e oferecer todo o cuidado que cada pessoa merece e precisa, de maneira coordenada e digital. Afinal, acreditamos que usar a tecnologia de forma inteligente e integrada é o primeiro passo para preservar o maior ativo de nossas vidas, a saúde. ID. Toda saúde é única.
A THB é uma das maiores consultorias em saúde, benefícios, seguros, resseguros e affinity. Com foco em inovação e proximidade com o cliente, a THB tem uma equipe multidisciplinar, com consultores especialistas na estruturação e administração de programas customizados. Fundada em 1978, faz parte do grupo MODELOS, o maior wholesale broker dos Estados Unidos, e está presente em todo o Brasil. THB, soluções que vão além do seguro.
Você está na FIS Week. Aqui você encontra as versões imersivas do nosso evento, que vou explicar mais tarde. Você pode escolher o idioma aqui. Aqui você encontra todas as áreas da FIS Week representadas por monumentos históricos. Na pirâmide, você pode acessar o FIS e ainda conhecer mais sobre a história da construção. Aqui você poderá assistir aos painéis do FIS 21, participar da discussão através do chat, enviando perguntas e comentários, além de conferir informações sobre o painel e os participantes. O mesmo vale para o Simetria e o Comets. Clique nos monumentos para acessar os eventos. Você também pode acessar a Meeting Zone no nosso mercado central. Lá você pode agendar um meeting com os nossos parceiros e encontrar outras pessoas que estão participando da FIS Week. E você também pode conferir a programação, os palestrantes, relaxar ouvindo música no nosso oásis e muito, muito mais. Aproveite a FIS Week e faça parte da maior experiência da saúde na América Latina.
A Abrange completa seus 55 anos de caminhada com o propósito de democratizar o acesso ao sistema privado de saúde, de eficiência e qualidade. Enxergamos o futuro com bons olhos, mas sempre priorizando o presente. Abrange 55 anos. Nossa origem, nossas histórias e nossas conquistas.
Desde que a
Have you checked our AR, ER? You can schedule a meeting, connect with other participants of this event, listen to good music, and enjoy all our panels. Okay, let's move on to the next one. The use of genetics in the prevention and customized treatment. Vitor Muniz, Innovation Director of Roche Diagnostics Brazil. Victor Andrade, AC Camargo General Director. Wagner Simões, Senior Director of Illumina Brazil. And Martha Oliveira, Director of Design Saúde. She'll be our moderator. Help us transform health. Point your camera to the QR code and answer our survey, please. Let's go to the next one. Hello, good afternoon. Victor, and Wagner. Thank you for being here. This is a very important topic for the future. The future that we always think it's just way too far into the distance, but it's just around the corner. Genetics is a good predictor of what's next. We're here to hear whatever you have to say about your experience. But this is how I see this panel. Just a frame so that we can discuss these things. How can we transition from an industry that is disease focused or something that is focused on the diagnostics per se, an industry that is looking for diseases rather than health? When we talk about genetics, prediction, sensors, and we think about a different health system, something that will happen before the disease comes, if it comes at all. So what's your take on this major change? It's not a matter of a new technology. It's to change the rationale behind the health system. This is very important. And there's something else. Whenever we talk about genetics, it's not a matter of having a test and have a result. We need people that know about the subject to provide that feedback to patients. I think it has to do with communications, both on prevention, which is the topic, and also the individualized treatment. And the third aspect I would like to touch upon during our conversation is how we're going to interpret all this new technology. We look at technology today, making comparisons, making head-to-head comparisons, taking something we know and then compare it with something new. But when we talk about populations, these are going to be more and more personalized interpretation. Treatments will be customized. How are we going to make that kind of transition as well? And I would like to use your own experience, your own backgrounds. I'll give you 10, 15 minutes each, and then we can move on to the Q&A session, to the debate portion of our conversation. So Wagner Simones is first. Welcome, Wagner. You have the floor. Thank you, Marta. Good afternoon. I think questions are very important. You talked about disease, treatment, genetics, counseling, giving patients some feedback. And when we talk about individualized treatment, we are touching upon a concept that has been discussed, which is precision medicine. I don't like the term because you can be very precise and still make a mistake. Precision is different from correctness. Precision can be very precise, very repeatable, but reaching the wrong spot. So I'd rather use the expression personalized medicine, which is focusing on the individual and their own personal characteristics. This is nothing new. Socrates used to say, when he talked about idiosyncrasies, individuals are unique and will respond to stimuli differently. It's an old concept, but we have been resorted to it time and time again. When we talk about personalizing and when we talk about specific characteristics, that involves genetics. It's our genome that carries that recipe, quote unquote, that makes us who we are. And we respond differently depending on the disease. They can have an early onset or a late onset of a given disease. So that's the initial step. Many diseases have their genetics mechanisms, just like cancer. Cancer is a good example when we talk about personalized medicine or precision medicine. Our cells can no longer program themselves due to a genetic mutation, and they begin to reproduce uncontrollably. In order to fix something, you have to know what's wrong, what's broken, so that you can fix it. So again, understanding the genetics of a disease, our genome, and how we are going to respond to any given stimulus, that is indeed very important. The cancer is not the only example, albeit it's the best, in my opinion. There are other diseases with genetic components. There are some rare diseases that fall into that type. Cancer, given the type of tissue, lung cancer, so we classify them based on their tissue origin: prostate cancer, breast cancer, lung cancer, etc. That may have one classification, but they are different because there's that genetic component. So two cancers are rarely alike because the alterations may be slightly different. You may be born with that kind of mutation, and that's what we call genetic or inherited cancer. That's Angelina Jolie's case, which is well known. Some mutations were detected that would increase the likelihood of developing breast cancer. So she resorted to a mastectomy to prevent her from developing that kind of cancer. So these different mutations can be inherited, and there are other mutations that can take place throughout life, because our genetics is part of what we are, of who we are, but they're subjected to the environment, whether we smoke, whether we exercise, our diet, and even our own microbiome. These are called acquired mutations that can lead to cancer. These are somatic mutations. So these are particular characteristics that you have to look into an individual, because responses will be different. People will react differently. And when you talked about how can we change the focus of our system, because today we're focused on treating the disease, but the best treatment is prevention. We all know that, but our genome can tell us a lot about predispositions. And Victor will give you a very good example when we talk about predisposition. When there's that genetic factor, hemoglobin, that can increase the likelihood of developing a tumor, we can change our lifestyle to adopt healthier habits, trying to minimize that risk. That's prevention in a nutshell. How the healthcare system can help? Will it increase costs? Yeah, it may even increase costs initially. Genetics and genetic tests are still relatively expensive, despite the fact that these costs have been coming down. However, the treatment is much more precise, and you prevent unnecessary expenses from happening. Long term, it will be way more cost effective for the health system than treating the disease itself. We do have a lot of information that can be extracted from our genome. We're just scratching the surface. Yeah, we still have a long way to go. Artificial intelligence, machine learning, big data will help dramatically. Genomics is a data science. We need data in order to come up with conclusions. Today, we do have technical capacity to generate a lot of data. We need bioinformatics, computer science that will analyze data based on phenotype and phenotypical characteristics, so that the geneticist can actually analyze that data and give patients some feedback, so the patients can improve their habits, trying to adopt healthier lifestyles to reduce the risk of diseases. I think I've spoken way too much, but anyway, that's what I think. Oh, that was just great. That was brilliant. I remember when that story of Angelina Jolie came up, I was right there at the ANSIA in charge of coverage. The day after was just crazy. Mondays used to be very exciting. The same thing happened with that case. Our discussion revolved around cultural aspects. When you discuss a prophylactic mastectomy in Japan, it's way more complicated here in Brazil. There's that medical aspect, but there's also a cultural aspect that revolves around genetic counseling. That was another concern on our part. How can I explain that you have these X% amount of likelihood of developing that disease, but it may never happen in the future? So you have to make a decision taking these things into account. So when we talk about genetics, maybe Victor will address that. Maybe he has discussed that to a certain extent. Let me turn over to Victor Andrade. It's so good to see you. I miss you. I think Victor can provide us with real life data because I believe you have been using it for quite some time. Thank you, Wagner, Victor Muniz. Thank you, Martha. I would like to thank FIS for inviting me. We need genetics. I graduated in 1998, and I was privileged to see genetics transform the medical professions. I was trained in the 1990s to recognize tumors by sight, and I had to learn for 15 years as a pathologist to add last names from genetics to these tumors. We used to say lung cancer. That was enough. It was not that easy to separate different types of lung cancer. There was no different treatment. Many things have changed. You have to determine what the morphologic subtype is or the genetic mutations in there, because treatments are different. It's very nice to know more about stuff. Genetics came and gave us the answers. Why is this tumor more aggressive than the next? It all started with the human genome study in the 90s, and then the genomic atlases for cancer starting in 2000. CDC, these are international consortia to better understand cancer at a much deeper level. When you know these things in detail, you can personalize the treatment. If you do not know that in detail, be doing the same for everyone. We have to find ways to be cost effective. Genetics can find that sweet spot because genetics can be cost effective in some niches. Pediatric cancer is rare. It's not preventable because there are no bad habits in children. It's usually a family tragedy. More often than not, pediatric cancer is hereditary in nature. So to resort to genetics in all pediatric cancers, it makes more sense. So when you look the niches where to apply genetics first, you learn how to use it and use it well, with intent, with wisdom. It's much cheaper to resort to genomic tests. When you compare the costs of the entire genome some decades ago, it's just 1,000th of the cost, a fraction of the cost. It's still expensive when compared to the health system we have in place and its economic power. Genetics is yet another piece of information in everyone's lives. But for some individuals, that's the most important information. For 5% of individuals that do have cancer, that cancer can be explained by the mutation of a single gene. A classic example is the ocular tumor, the eye tumor. The likelihood is very high. There's no point in talking about lifestyles and healthy habits. However, they have an important decision to make. There are so many other tumors that are not hereditary. They have a familiar or a family-related behavior. There's a predisposition there, but I cannot pinpoint one gene. It's a set of changes that will make that family more risk-prone. Each gene separately would contribute a little less. But when you add it all up,
I think Victor's connection froze. Did that happen to you as well? I'm back. Oh, you're back. Yes, go ahead. So you're saying that? Yes, 40% of tumors could be avoided through changes in lifestyle by avoiding obesity, smoking, alcohol consumption, and getting vaccinated. You could avoid up to 40% of all tumors, but obviously not every tumor can be avoided because there's an important genetic component to some tumors. I agree with Wagner in that genetics can be supported by deep learning, and they can help select the populations at a higher risk. I'll give you an example. There's this Canadian algorithm by McGill with an excellent performance in identifying which children should be tested. And it gets almost everyone right. And they're able to pinpoint the children that need the test and a treatment. We have recent publications regarding that. We studied, for instance, breast cancer and stomach cancer. We scanned the slide of the pathology, and we used deep learning to identify histological characteristics of tumor that predict mutations. And we found the homologous recombination features in case of breast cancer, BRCA1, 2, and in case of the stomach cancer, instability of microsatellite. So you can use the tests more accurately only in the people who it makes sense to use. And with that, you're able to reach a better cost effectiveness for that test. In some other niches, if you expand the analysis to a population and not only to a family, you can use the argument of cost effectiveness. I've seen articles advocating that you should test every woman for breast cancer because the lives saved of the price of that would cost more than the price of the test. So Martha's question is how to bring that into a prevention setting. Everything we do in terms of oncogenetic prevention, I think the biggest challenge of prevention today is that we design protocols for the average individual. Mammogram annually, that's for the average individual. Colonoscopy, that's for the average risk of the population in general. If we start identifying risks, and for sure, a woman that's never had a history of breast cancer in the family, and she's thin, active, does not smoke, does not drink, has breastfed twice in her life, her risk is much lower than a patient with several cases of cancer in the family who's obese, sedentary, and has never breastfed. So if we add it all up and genetics, we'll be able to better define the calendar of tests for the entire population. We could create some algorithms to personalize the agenda for each person and maybe save resources. And that is a relevant subject that we could work on. The expertise of doing the test and interpreting it cannot be underestimated. You talked about interpretation, and since we have a lab here, and I also see what happens outside, I would add also the knowledge of running this test. It's not a trivial thing. Doing a genomics test, it's not enough just to insert something into a machine and get a report from that. It's not like that. There's quality control. There's important and elaborate steps involved in that process, because people frequently ask, is there a BRCA mutation? And instead of ordering a BRCA mutation, they order a complete genome, and they get a lot of things back. And that's probably too much information. And what do you do with the surplus of information? There's lots of things moving that way in the world. There are some polymorphisms that are associated with quality of life. People that are more prone to smoking, to sedentarism, or whatnot, because of genetics. We don't know if genetics can account for it all, but there's a lot still to come. The sheer amount of information is so huge that if you do not have a question before the test, you can get lost. And deep learning can help us identify the interpretation of these data that come from a complete genome test, which is something that very few people can do. And fortunately, at our lab, we can do that. To summarize, I would say that what we have in terms of prevention is insufficient. We cannot prevent everyone, and it's expensive and not effective. Genomics is helping us in that regard, but it has to find cost effectiveness niches. And in the future, I hope that data analysis and deep learning will help us further refine and make the environment of genetics more effective, pre-identifying where genomics can fit in, so that we can use these resources in the right way with the right people and really benefit them. I believe in the financial balance of the system with genomics, Martha. The new technologies will be more expensive because they'll be applied to smaller populations, but they'll have much fewer side effects, and they'll keep individuals alive and productive in society. So if we do the math, from a wider perspective, I think that I'm hopeful that that will happen. I was jotting down many things that you were saying, but what you said about the niches, I think that we have to focus on that in the healthcare system, how to distribute resources across the niches. Artificial intelligence that you mentioned, and being able to redirect and reallocate resources, that was interesting. And also, when you spoke about the speed of knowledge, we got a certain amount of knowledge, and then it took us decades to double down on that. And now it takes us weeks or even years to reach a higher level of knowledge. And I think that things are getting faster and faster because we learn from our own learning, and things just grow from there. I don't think we could predict the speed of this growth, even if we wanted or could. And some things stood out that probably we're not concerned about today, about diet and several different things. So we have accumulated knowledge where we want recommendations about other things, but now we get that at home through a letter that you simply open and read. So I think that we still have a lot to not only about the best way to do things, about how to test and to examine, but also in terms of what we've been thinking about and what we've been doing, because this could have lots of other interferences that are not even on our radar. Now, Victor Muniz from Roche Diagnosis Brazil, you have the floor. Good afternoon. It's an honor to be with you, Dr. Martha Wagner and Dr. Victor. I will base my conversation on two aspects. One is professional and the other is personal. And I have three important messages that I'll be elaborating on and go back to them in the end to provide more context. The first one is that we've been focusing on integrated diagnosis, prevention, and from diagnosis to treatment. That's my first message. And the second is we're always looking for the right treatment for the right patient in the right moment. And the third, and that's from my personal experience, we used to say that genetics is not equivalent to destiny. And that's a very important aspect, but genetic diagnosis could change your destiny. So I want to leave you with these three first comments to start elaborating my message. In terms of the genetic diagnosis, a lot of what we've been doing when it comes to companion diagnostics, it ranges from NGS, which is very well developed by our partners, but it also involves the diagnosis of molecular biology with a PCR. A lot can be learned from an EGFR, KRAS, MRAS test, the diagnosis of HPV for cervical cancer. That is something that we've been working on in terms of giving women access to the HPV test because it's much more precise and you're able to prevent cancer in patients. And we also work, and Dr. Victor is very experienced in immunohistochemical processes. With PD-L1, we have a targeted therapy that will provide a better response for breast cancer or ALK. So we do all that as a company, but always in line with prevention and treatment. And in that regard, we've also been working on developing a more ecosystemic perspective, and not only in terms of the lab, but we also work with providers, the Siga Hospital, and we've been making this connection to bring down the total costs of health and improve patient outcomes. So we've been working on this integration, and Roche made the decision as it's the only company in the world that operates in the with diagnosis and advanced pharmaceutics. The other thing that I want to tell you about is about our genetic panels for hereditary cancer. And I want to tell you a personal story, which is very important. In my family, my father died from cancer. My grandmother, my uncles, I have 5 uncles who died from cancer. And being at Roche, I talked to some colleagues and they said that it would be interesting if we could, if I could look for a geneticist at a hospital and do the test. And I talked to the geneticist and I scheduled a visit. And I did it because it was really important for me. And much to my surprise, we did the genetic tests, and one of the changes there was this MSH2 alteration, which is connected to a syndrome. Last year, I was weighing 107 kilos, and the doctor told me that I had to immediately lose weight, and I had to do an annual colonoscopy, endoscopy. and that's when I started a diet with medical guidance, and I lost 15 kilos. And that was transformative. And how we work on access and how to select the best person according to family history and in the public system to expand that access. So all that, I think, we focus a lot on the 4P medicine, preventative, predictive, personalized, and participative. So that is my general experience. Well, Martha, in his case, having an annual endoscopy is cost effective and it should be covered. However, other individuals without that alteration, that could be a waste undergoing annual endoscopy. So we have to make progress in that regard and see where genetics can help us make better decisions. And going back to what I mentioned, how to integrate the best diagnosis for the right patient at the right moment. Of course, genetics is not equivalent to destiny, but genetic diagnosis can change your fate. That's my take-home message. Great, Victor. I think you gave me the courage because I have a recommendation, but I'm trying to push it forward. And I'll talk to you, Victor, later on. But I think that we also have to think about the consequences, right? You have to be willing to face the consequences, and you were willing to do that. You lost weight, and you did what had to be done. Anyway, I took note of several things. I think the three things that Mooney's talked about are very important. And anyway, now we'll take questions. So I'll leave you with 2 questions for you to discuss and in these next 10 minutes. The first one is one thing that we've always discussed in the healthcare system. I'm not a geneticist, and I think that that's my perspective about the health system. And for genetics, we've always talked about reference centers. It will never make sense for you to have everything available everywhere. And these reference centers, they're usually not, they don't even have to be in the country where you live. They can be anywhere in the world with a view to optimizing your treatment. And as Victor said, doing things correctly. You do not necessarily have to do everything everywhere. So I think I'd like to hear your perspective on this rationale. What's the rationale that we should adopt to allow and to enable everything to be offered within this perspective, which is something that we've always discussed for genetics. And the second thing is, how can we prioritize? I mean, you mentioned something in the end that stood out for me. For us to have not only the perspective of who is going to use it, who is the best patient, where can I locate the correct patients, like Victor said, but as a consequence of that, I also have to have personalized protocols based on that result. And one such example was Victor. He took the test and he was tested, and then as a consequence, he got a personalized protocol. With cancer, we still have that in a very clear-cut manner. It is the specialty that makes the most use of protocols. But as for the rest, we're quite flawed in terms of the use of protocols in Brazil. And I think my question is, how can we start, since we're talking about something that is about to arrive very strongly, we already think about how to treat before and how to treat after. You have a tool here in the middle, but there's a moment before that that is connected to the diagnosis and so forth. And there's something later, something after that. So I'd like to hear your take on these two comments, and we can follow the same order, starting with Wagner, if you agree. Well, actually, Martha, I think these two comments are connected because if you talk about reference centers, I agree. You have specialized people who, over the course of their career, they had a lot of contact with that specific type of disease that you want to treat. In addition to that, a reference center, and it's very important when it comes to genomics, it offers a database, because over the course of its existence, it starts accumulating a number of cases connecting a genotype and phenotype, and that makes it easier for algorithms to analyze and determine certain genetic variables. And I think that the main aspect about centers of reference is that they have a highly specialized experts and a database that it amasses over time, which is extremely important for genetics. And to me, these are the two factors that stand out. Of course, that there are other factors that are important, but it's very important for us to have reference centers if you're able to identify that certain diseases have to be referred to a specific center. And that goes back to the aspect that you mentioned about who is the best candidate for a better for a certain test or for a certain treatment type. And I think that takes us back to primary care. And that's something that we still see in genetics, which is education. And we have a shortage of education in genetics. Dr. Victor had the privilege of having a lot of contact with genetics, but many doctors that are also experienced have not had contact with genetics because it's a relatively new science. So we need to work not only with medical school students, but also people who work with primary care at different levels, nurses or whoever it is, so that they are trained to identify a possible candidate and refer them to the right reference center at the right time. And that's something that we see a lot in rare diseases. For rare diseases, it's hard to diagnose or telling a child who is in the autistic spectrum apart from a child with an intellectual impairment. If the primary care is not prepared to identify that child, the journey towards diagnosing that takes too long, because the first symptoms will only start showing up when, in theory, that child was supposed to be starting to talk and walk and so forth. And I have children with kids who have not been diagnosed yet, and they're 6 years old because they did not do a complete exome. And our public health system approved the use of a complete exome test for intellectual impairment. But we have to work on primary care and on educating and training professionals that are skilled and to identify these possible disabilities, so that we identify the right patient for the right treatment and for the right tests for a more accurate diagnosis and consequently the treatment.
Martha, as to the logic of centralizing or not, I see it as a continuum. Genomics has evolved so quickly. We're coming up with new tests, and you have a bigger and bigger menu of alternatives. It's not the gene we're looking for, but how you look for it. That has changed too. The speed at which these things happen. We won't be able to develop that in any lab separately. There will be some degree of centralization. And then we can standardize, we can test it, we can make sure it's right. And once everything is perfect, we can teach others how to do it. But genetics play a different role. The role of generating knowledge. And once I have that knowledge, I don't have to resort to a genomic test. Immunohistochemistry can help me now, or maybe CPR. So you have those rings of information, those rings of knowledge. What is complex remains in the same place. It's up to a reference center. We're a good example of that here. And then we simplify the methodology, and it will then be used in other places that will be able to replicate methodologies, but not with the necessary conditions to create new protocols. So the speed at which the discipline evolves gets in the way of having that happen in many different places at the same time. So there should be some centralization so that tests can be somewhat standardized. As to personalized protocols, I have very interesting data. Oncogenetics is huge. We monitor over 40,000 families, some families with 80 individuals, but we keep track of every hereditary syndrome. We have come up with the protocols. They're not that complicated. We have to come up with a cost-effective system. But by and large, people that are monitored by oncogenetics, they don't die of cancers because they have that early diagnostic. By adopting those measures that, just like Victor did, they'll take action. So we'll manage the problem. We're not going to be run over by it. For some tumors that may require a full body MRI to determine pancreas mass, soft mass, for those that make sense. But the protocol may be different for other people. So we'll come up to protocols for every hereditary syndrome. And then, we're talking about highly specialized cases. We need the knowledge to be disseminated so that everyone can resort to this kind of information. I'm fearful as to the way things happen in Brazil. Everything we do here, we end up moving away from the good use. And we use that methodology that will end up harming patients. Genetics is a huge subject. We must focus on training. Training for the entire system, not only one professional, one operator. You have to train the entire system, all the way from primary to tertiary care. That's part of our mission, AC Camargo, to train people. This is in our DNA. We've been doing this from the very foundation of the organization. This is what makes us happy. This is a very complex topic. The speed with which knowledge is discovered. If you stop studying 3 years ago, you're no longer up to date. Things change dramatically very quickly. You have to go back to the university. You have to go to an internship program. The carriers, the providers, the auditors, that information has to move around. Exactly, Victor, you're right. today we perform a checklist-oriented audit, and we're moving towards a world in which a checklist audit will no longer exist. I'll be talking about prediction, different models for healthcare, a personalized segment. So there are several things then which there will be that breakthrough. There will be that disruption will take place. That's how we evolve. This is how we move ahead. Friction is what moves progress, what makes things happen. Victor Muniz, over to you. As to having that reference center, I had a personal experience with my dad. My doctor, or his doctor said his case was very complicated. He had there was a board actually of doctors, ended up working for Roche. We have a solution called Tumor Board. It helps doctors to consolidate several cases, genetic test results, image results, and you can organize the material to come up with that decision. A reference center is important because a doctor may have seen similar cases, and they'll have a joint decision that is evidence-based, and there will be that critical mass, just like Dr. Victor said. You had 80 family members. You can come up with more appropriate treatments because you know them better. So there are huge advantages to any reference center. I had something in my nose, and then I go to Dr. Ivan. I want to find out whether they have that experience, because they know how to treat that problem once they have that experience. You, as a patient, can feel comfortable that that subject or that provider does have some knowledge, some experience about that subject. Okay, it's in terms of diagnostics, you get a result, for example, but you have to go back to the doctors, get that information, get that orders or whatever the prescription is, any test or colonoscopy or chemical series, and you have to go to other specialists. How can I lose weight? You just can't check a website. It's important to connect all the elements together. The genetic diagnostics with the geneticist and endocrinologist. So it goes beyond oncology. It's important to connect all these elements together. Health institutions or health providers are looking for that integration. You can no longer have disconnected things. Okay, I run this test, but how can I connect that to the entire patient journey? I like this trend, managing health rather than managing disease. Some healthcare providers will keep track, will monitor your life. That will change the system, because we usually resort to a doctor whenever there's a problem. You have to do that before. You have to have that yearly checkup, that routine. You can run regular tests, but if you have a track record, you have to resort to a genetic test, for example. All this can be conceived, can be set up if all players are willing to contribute, to co-create. That's a challenge too, right? How do you integrate all these players? Because in the end, we want the best for the health system and, of course, ultimately for the patient. I know, Martha, we are running out of time, but there's something we haven't touched upon, but it's very important indeed. Patients with the same tumor would get the same drug and will respond differently. The answer may be in the way each individual will metabolize drugs. And the studies we conduct here, some women may need higher or smaller doses depending on how they metabolize the drug to reach the same response. One patient may need one dose, another patient may need twice as much, because the way I metabolize will vary. Genetics can explain that too. Just like alcohol metabolism, how you metabolize alcohol. I think we are right in the middle of a phase in which we are acquiring knowledge at lightning speed, but there's still a long way to go, the way I see it. In the years to come, I truly believe when you combine genetics, biosensoring, and predictions or predictors, we're going to have a major breakthrough in the health system. We may end up having a much different system. We couldn't even conceive it some years back. Now we can. What would a health system look like? I am monitored all the time. Every signal generates new information that will be combined with my genetic data and my consumption data. Everything connected, whether I exercise or not, how I respond, and then I can predict the likelihood of having something in 3 years' time. So we couldn't conceive this new system. We have just received word that our time is up. What if you were the organizers, the managers of this new health system? What would be your first step? We won't be able to build everything from scratch. What be step one towards this new system? When technology makes sense, it will be there. Rest assured, it will come. There's no regulation to get in the way. Nothing can get in the way. So, okay, we're there. Technology is there. What would you do to better include that in our system? And you can also add that to your closing remarks, please. When I think about the future, I tend to get very creative. When babies are born, you have a complete genome. You know what the likelihoods are. So a drop of blood is enough to detect early signs of cells that have just started mutating. You know what the tissue is. It's cheap. It's a cheap test. This is going to be a very simple test. Very, very cheap. You can do them very often. Of course, we're still a long way from it. We need data to contribute. That's one of the those risk score diseases. It's a multi-gene disease or multi-gene dependent disease. And you'll be able to come up with a score to predict the likelihood. We've been talking about CRISPR genes, gene sequencing or editing. The important thing is how to be cost effective when we apply these to our reality. And ethics getting added to the mix as well. In sum, the future is very promising. It involves genomics. All we have to do is wait. I think we'll be able to see the future. We'll see many practical things in the near future. Thank you for having me. Thank you. Very pragmatically, I'd say that there will be three parts in this future. We already identified where genomics is cost effective. We must define what the tests are, what we do with them, and how to make them feasible. How do we make them practical to prevent diseases and suffering? A second topic would be learning more and finding new tools. And maybe a third phase further into the future. These studies, these methodologies will be much cheaper and we'll be able to have a large scale. Bringing in information, algorithm, a test we develop here, a test that takes 15 seconds. The difference is that it may be 1 or 600, a machine can run all of them at the same time for the same cost. I can predict that for many people. This will revolutionize the way we work, but the ecosystem has to follow along. Whatever is effective, good for patients, we'll have to come up with a way to offer them to them. That's it, Victor. I have two things to say. Number one, how to manage populational health immediately, how to be brave enough to act preventively, managing health, but also managing disease. We can only reach that goal once you break down the populations by groups. And number two, you have to re-evaluate diagnostics. You have less than 2% of investments in health all over the world, and it can influence all the way up to 70% in doctors' decisions. How do you shift that kind of investment in diagnostics to help put more focus on prevention and personalized and a more participative kind of medicine? Thank you, Martha, Wagner, and Dr. Victor. Thank you very much. This has been way too long. I learned a lot from you. Thank you. Thank you. Thank you very much. I think this was a very interesting panel that will help us understand the future. Thank you. That concludes this panel. Thank you.
Transformar o cuidado, criando soluções acessíveis, proporcionando excelência em cada detalhe, somando expertises e multiplicando as capacidades assistenciais. É para isso que o Américas existe. composto por 18 hospitais e 37 centros médicos e centros de excelência, distribuídos em 5 estados brasileiros e no Distrito Federal, o Américas promove o cuidado em mais de 60 especialidades médicas. Juntas, nossas marcas formam um sistema integrado de serviços de saúde, garantindo acesso a um atendimento diferenciado em todas as fases da vida, com excelência no acolhimento, humanização e alta performance. É assim, unindo estrutura, solidez, experiência e paixão pela medicina, que cumprimos a cada dia a nossa missão de ajudar as pessoas a viver de forma mais saudável e contribuir para que o sistema de saúde funcione melhor para todos. Onde tem Américas, tem saúde.
Trying to find my way. Every day, just trying to find my way. Every day.
É muito nova pra ficar tomando remédio pra louco. Essa geração é cheia de história.
I'm gonna break through.
Saúde mental é real. E quando alguém minimiza esse assunto, só aumenta o problema. Se você está passando por isso ou quer entender mais, a Amil pode ajudar. Saiba mais em amilsaudemental.com.br.
This is for scientists and those who believe in the potential of science. It starts with curiosity. A surprise in the pattern, an obstacle that can't be explained. Step by step by step, they challenge, explore, and unlock the unknown, fueled by imagination, alone and with others, repeating an experiment 1,000 times to have the chance to get it right, once, but for forever. Making brave choices, choosing to push the boundaries, and choosing again and again to be led by science in everyday decisions, everyday interactions, no matter where they are. Because putting science at the center of everything is the best way to understand and transform disease, the best way to change people's lives. This is why we believe in what science can do.
O Rio tem um laboratório que se importa com você, certificado e acreditado. Não paramos um minuto sequer na pandemia, realizando mais de 1 milhão de exames por mês. Conheça mais. Laboratório Blessing, de mãos dadas com a saúde e com você.
Em meio a tantas mudanças, temos uma certeza: a saúde continua sendo um fator decisivo na vida das pessoas. 1 a cada 4 brasileiros busca um plano de saúde para ter atendimento de qualidade. São pessoas que se preocupam com uma boa assistência médica e odontológica, inclusive na hora de escolher um emprego. Além de oferecer saúde e melhorar o dia a dia das famílias brasileiras, os planos privados salvam vidas. Nós da Fena Saúde temos o compromisso de promover bem-estar e transformar a vida dos cerca de 50 milhões de beneficiários de planos médico-hospitalares e dos quase 30 milhões de brasileiros com planos odontológicos. Proporcionando assistência 24 horas por dia. Criamos mais de 3 milhões de empregos. Realizamos mais de 1,5 bilhão de procedimentos médicos e odontológicos por ano. E movimentamos mais de 3% do PIB. Nosso desafio é garantir que a saúde suplementar acompanhe as transformações do mundo, priorizando a satisfação dos beneficiários. Nossa missão é oferecer saúde cuidado e qualidade de vida para mais e mais brasileiros todos os dias, garantindo tranquilidade em tempos de tantas incertezas.
Fazer com que as pessoas façam mais, sintam-se melhor e vivam mais. Essa é a nossa missão na GSK. Somos uma empresa de saúde global com foco em ciência. Contamos com 3 negócios globais que atuam na pesquisa, desenvolvimento e fabricação de medicamentos, vacinas e produtos de consumo. Há mais de 110 anos, estamos transformando a saúde dos brasileiros. Somos líderes em soluções para a saúde em diversas áreas, como vacinas, HIV e respiratória. Nossos valores e expectativas guiam tudo o que fazemos na GSK e nos apoiam em nossa missão de ajudar as pessoas a fazer mais, sentir-se melhor e viver mais.
Microsoft Cloud for Healthcare brings together trusted capabilities to healthcare organizations and partners that enhances patient engagement, empowers health team collaboration, improves clinical and operational data insights, and protects sensitive health data. This integrated solution enables your organization to quickly access a portfolio of released and new healthcare capabilities tailored to the unique requirements of health data in the cloud. It unlocks the power of Microsoft 365, Azure, Dynamics 365, Power Platform, and our extensive partner ecosystem to create trusted end-to-end healthcare solutions. Together, it makes it faster and easier to provide more efficient care and helps support the end-to-end security, compliance, accessibility, and interoperability of health data. Microsoft Cloud for Healthcare empowers your organization to engage in more proactive ways with patients and gives caregivers tools to improve workflow efficiency, streamline collaboration, and connect data across existing sources to turn insight into action. Its connected cloud is designed to address your most pressing issues, enabling you with the speed and agility to adjust to change and build resiliency to help you weather today's challenges so you can begin to reimagine tomorrow. Microsoft Cloud for Healthcare empowering health organizations to deliver better experiences, better insights, and better care. Learn more at aka.ms/cloud4healthcare.
A Pronep Life Care, uma marca do grupo Sodexo, é uma das empresas pioneiras na atenção domiciliar no Brasil. Desde sua fundação, a Pronep Life Care já cuidou de mais de 35 mil vidas e atende em todo o país mais de 2.000 pacientes por dia, atuando no cuidado e atenção às mais variadas necessidades. Tudo feito por uma equipe altamente qualificada e especializada na casa do paciente, de acordo com suas necessidades individuais e com acolhimento e cuidado. A qualidade do nosso atendimento garantiu o reconhecimento da Joint Commission International, JCI, que nos certificou com um selo respeitado mundialmente. Tudo isso para levar ao paciente e sua família qualidade de vida e conforto, sem abrir mão de cuidados médicos de excelência.
A Pronep não deixa faltar nada para minha filha. Eu sou muito bem tratada por eles. A equipe é muito boa, é tudo muito bem engrenadinho. É mais vida para o paciente, mais vida para você.
Pronep, movidos pela vontade de fazer o bem.
Nestes mais de 120 anos de história, entendemos o poder de um diagnóstico preciso e rápido na qualidade dos cuidados com a saúde. Quanto mais conhecimento, melhores são as decisões. E maiores as chances de superar desafios para vidas mais longas e com mais saúde. Por isso que na Roche Diagnóstica investimos tanto em pesquisa para o desenvolvimento de soluções e equipamentos. Em pessoas que podem inovar e melhorar processos e serviços. E no compartilhamento deste conhecimento que produzimos para o benefício dos pacientes. Isso é valioso. Como líderes, devemos ter consciência e orgulho do nosso poder de impacto na gestão da saúde no Brasil. De desenvolver o mercado, antecipando necessidades e soluções. Queremos ampliar ainda mais nossas condições de produzir informações relevantes e seguras, viabilizando melhores decisões clínicas, para que as pessoas vivam mais e de maneira mais saudável. É isso que nos move. Possibilitar cada vez mais acesso à melhor medicina de precisão para o maior número de brasileiros.
Seja qual for o seu caminho profissional, o Senac tem um curso para você aprender fazendo. Você pode começar uma profissão do zero ou seguir nossa trilha de desenvolvimento e se aprimorar cada vez mais na sua carreira. A Aprender Fazendo é a metodologia exclusiva do Senac, que tem foco na prática e faz toda a diferença na formação dos nossos alunos. Saiba mais sobre ela aqui no site. Depois, continue navegando para escolher seu curso e garantir sua matrícula. Senac, todas as formas de aprender fazendo.
Developed Protector, Environmental Infection Control. Based on international best practices, so we can assure a clean and safe hospital environment, the Protector Advantage is about people, process, and technology. Through education and management, it achieves expertly trained and motivated frontline cleaning staff committed to their vital role in eradicating hospital-acquired infections. Standard processes detail who is responsible for cleaning which items and areas and what products and techniques to use. Protector incorporates the latest, most effective, clinically proven cleaning and decontamination innovations from across the planet. And from assessment to auditing to analysis, it works with you to drive additional value from under-pressure financial resources, ensuring patients are kept free from harm so they can go home when they should. Protector, Environmental Infection Control from Sodexo. Your advantage in the fight against hospital-acquired infections.
Você está na FIS Week. Aqui você encontra as versões imersivas do nosso evento, que vou explicar mais tarde. Você pode escolher o idioma aqui. Aqui você encontra todas as áreas da FIS Week representadas por monumentos históricos. Na pirâmide, você pode acessar o FIS e ainda conhecer mais sobre a história da construção. Aqui você poderá assistir aos painéis do FIS 21, participar da discussão através do chat, enviando perguntas e comentários, além de conferir informações sobre o painel e os participantes. O mesmo vale para o Simetria e o Commits. Clique nos monumentos para acessar os eventos. Você também pode acessar a Meeting Zone no nosso mercado central. Lá você pode agendar um meeting com os nossos parceiros e encontrar outras pessoas que estão participando da FIS Week. E você também pode conferir a programação, os palestrantes, relaxar ouvindo música no nosso oásis e muito, muito mais. Aproveite a FIS Week e faça parte da maior experiência da saúde na América Latina.
Transformar o cuidado, criando soluções acessíveis, proporcionando excelência em cada detalhe, somando expertises e multiplicando as capacidades assistenciais. É para isso que o Américas existe. Composto por 18 hospitais e 37 centros médicos e centros de excelência, distribuídos em 5 estados brasileiros e no Distrito Federal, o Américas promove o cuidado em mais de 60 especialidades médicas. Juntas, nossas marcas formam um sistema integrado de serviços de saúde, garantindo acesso a um atendimento diferenciado em todas as fases da vida, com excelência no acolhimento, humanização e alta performance. É assim, unindo estrutura, solidez, experiência e paixão pela medicina, que cumprimos a cada dia a nossa missão de ajudar as pessoas a viver de forma mais saudável e contribuir para que o sistema de saúde funcione melhor para todos. Onde tem Américas, tem saúde.
Trying to find my way. Every day, just trying to find my way. Every day.
É muito nova pra ficar tomando remédio pra louco. Essa geração é cheia de história.
I'm gonna break through.
Saúde mental é real. E quando alguém minimiza esse assunto, só aumenta o problema. Se você está passando por isso ou quer entender mais, a Amil pode ajudar. Saiba mais em amilsaudemental.com.br.
This is for scientists and those who believe in the potential of science. It starts with curiosity. A surprise in the pattern, an obstacle that can't be explained. Step by step by step, they challenge, explore, and unlock the unknown, fueled by imagination, alone and with others, repeating an experiment 1,000 times to have the chance to get it right, once, but for forever. Making brave choices, choosing to push the boundaries, and choosing again and again to be led by science. In everyday decisions, everyday interactions, no matter where they are. Because putting science at the center of everything is the best way to understand and transform disease. The best way to change people's lives. This is why we believe in what science can do.
O O Rio tem um laboratório que se importa com você, certificado e acreditado. Não paramos um minuto sequer na pandemia, realizando mais de 1 milhão de exames por mês. Conheça mais. Laboratório Blessing, de mãos dadas com a saúde e com você.
Em meio a tantas mudanças, temos uma certeza: a saúde continua sendo um fator decisivo na vida das pessoas. 1 a cada 4 brasileiros busca um plano de saúde para ter atendimento de qualidade. São pessoas que se preocupam com uma boa assistência médica e odontológica, inclusive na hora de escolher um emprego. Além de oferecer saúde e melhorar o dia a dia das famílias brasileiras, os planos privados salvam vidas. Nós da Fena Saúde temos o compromisso de promover bem-estar e transformar a vida dos cerca de 50 milhões de beneficiários de planos médico-hospitalares e dos quase 30 milhões de brasileiros com planos odontológicos, proporcionando assistência 24 horas por dia. Criamos mais de 3 milhões de empregos, realizamos mais de 1,5 bilhão de procedimentos médicos e odontológicos por ano e movimentamos mais de 3% do PIB. Nosso desafio é garantir que a saúde suplementar acompanhe as transformações do mundo, priorizando a satisfação dos beneficiários. Nossa missão é oferecer saúde, cuidado e qualidade de vida para mais e mais brasileiros todos os dias, garantindo tranquilidade em tempos de tantas incertezas.
Fazer com que as pessoas façam mais, sintam-se melhor e vivam mais. Essa é a nossa missão na GSK. Somos uma empresa de saúde global com foco em ciência. Contamos com 3 negócios globais que atuam na pesquisa, desenvolvimento e fabricação de medicamentos, vacinas e produtos de consumo. Há mais de 110 anos, estamos transformando a saúde dos brasileiros. Somos líderes em soluções para a saúde em diversas áreas, como vacinas, HIV e respiratória. Nossos valores e expectativas guiam tudo o que fazemos na GSK e nos apoiam em nossa missão de ajudar as pessoas a fazer mais, sentir-se melhor e viver mais.
Microsoft Cloud for Healthcare brings together trusted capabilities to healthcare organizations and partners that enhances patient engagement, empowers health team collaboration, improves clinical and operational data insights, and protects sensitive health data. This integrated solution enables your organization to quickly access a portfolio of released and new healthcare capabilities tailored to the unique requirements of health data in the cloud. It unlocks the power of Microsoft 365, Azure, Dynamics 365, Power Platform, and our extensive partner ecosystem to create trusted end-to-end healthcare solutions. Together, it makes it faster and easier to provide more efficient care and helps support the end-to-end security, compliance, accessibility, and interoperability of health data. Microsoft Cloud for Healthcare empowers your organization to engage in more proactive ways with patients and gives caregivers tools to improve workflow efficiency, streamline collaboration, and connect data across existing sources to turn insight into action. Its connected cloud is designed to address your most pressing issues, enabling you with the speed and agility to adjust to change and build resiliency to help you weather today's challenges so you can begin to reimagine tomorrow. Microsoft Cloud for Healthcare, empowering health organizations to deliver better experiences, better insights, and better care. Learn more at aka.ms/cloud-for-healthcare.
A Pronep Lifecare, uma marca do grupo Sodexo, é uma das empresas pioneiras na atenção domiciliar no Brasil. Desde sua fundação, a Pronep Lifecare já cuidou de mais de 35 mil vidas e atende em todo o país mais de 2.000 pacientes por dia, atuando no cuidado e atenção às mais variadas necessidades. Tudo feito por uma equipe altamente qualificada e especializada na casa do paciente, de acordo com suas necessidades individuais e com acolhimento e cuidado. A qualidade do nosso atendimento garantiu o reconhecimento da Joint Commission International, JCI, que nos certificou com um selo respeitado mundialmente. Tudo isso para levar ao paciente e sua família qualidade de vida e conforto, sem abrir mão de cuidados médicos de excelência.
A Pronep não deixa faltar nada para minha filha. Eu sou muito bem tratada por eles. A equipe é muito boa, é tudo muito bem engrenadinho. É mais vida para o paciente, mais vida para você.
Pronep, movidos pela vontade de fazer o bem.
Nestes mais de 120 anos de história, entendemos o poder de um diagnóstico preciso e rápido na qualidade dos cuidados com a saúde. Quanto mais conhecimento, melhores são as decisões. E maiores as chances de superar desafios para vidas mais longas e com mais saúde. Por isso que na Roche Diagnóstica, investimos tanto em pesquisa para o desenvolvimento de soluções e equipamentos, em pessoas que podem inovar e melhorar processos e serviços, e no compartilhamento deste conhecimento que produzimos para o benefício dos pacientes. Isso é valioso. Como líderes, devemos ter consciência e orgulho do nosso poder de impacto na gestão da saúde no Brasil. De desenvolver o mercado, antecipando necessidades e soluções. Queremos ampliar ainda mais nossas condições de produzir informações relevantes e seguras, viabilizando melhores decisões clínicas para que as pessoas vivam mais e de maneira mais saudável. É isso que nos move. Possibilitar cada vez mais acesso à melhor medicina de precisão para o maior número de brasileiros.
Seja qual for o seu caminho profissional, o Senac tem um curso para você aprender fazendo. Você pode começar uma profissão do zero ou seguir nossa trilha de desenvolvimento e se aprimorar cada vez mais na sua carreira. Aprender fazendo é a metodologia exclusiva do Senac, que tem foco na prática e faz toda a diferença na formação dos nossos alunos. Saiba mais sobre ela aqui no site. Depois, continue navegando para escolher seu curso e garantir sua matrícula. Senac. Todas as formas de aprender fazendo.
Developed Protector, Environmental Infection Control. Based on international best practices, so we can assure a clean and safe hospital environment, the Protector Advantage is about people, process, and technology. Through education and management, it achieves expertly trained and motivated frontline cleaning staff committed to their vital role in eradicating hospital-acquired infections. Standard processes detail who is responsible for cleaning which items and areas and what products and techniques to use. Protector incorporates the latest, most effective, clinically proven cleaning and decontamination innovations from across the planet. And from assessment to auditing to analysis, it works with you to drive additional value from under-pressure financial resources, ensuring patients are kept free from harm so they can go home when they should. Protector, environmental infection control from Sodexo. Your advantage in the fight against hospital-acquired infections.
Você está na FIS Week. Aqui você encontra as versões imersivas do nosso evento, que vou explicar mais tarde. Você pode escolher o idioma aqui. Aqui você encontra todas as áreas da FIS Week representadas por monumentos históricos. Na pirâmide, você pode acessar o FIS e ainda conhecer mais sobre a história da construção. Aqui você poderá assistir aos painéis do FIS 21, participar da discussão através do chat, enviando perguntas e comentários, além de conferir informações sobre o painel e os participantes. O mesmo vale para o Simetria e o Commits. Clique nos monumentos para acessar os eventos. Você também pode acessar a Meeting Zone no nosso mercado central. Lá você pode agendar um meeting com os nossos parceiros e encontrar outras pessoas que estão participando da FIS Week. E você também pode conferir a programação, os palestrantes, relaxar ouvindo música no nosso oásis e muito, muito mais. Aproveite a FIS Week e faça parte da maior experiência da saúde na América Latina.
Transformar o cuidado, criando soluções acessíveis, proporcionando excelência em cada detalhe, somando expertises e multiplicando as capacidades assistenciais. É para isso que o Américas existe. Composto por 18 hospitais e 37 centros médicos e centros de excelência, distribuídos em 5 estados brasileiros e no Distrito Federal, o Américas promove o cuidado em mais de 60 especialidades médicas. Juntas, nossas marcas formam um sistema integrado de serviços de saúde, garantindo acesso a um atendimento diferenciado em todas as fases da vida, com excelência no acolhimento, humanização e alta performance. É assim, unindo estrutura, solidez, experiência e paixão pela medicina, que cumprimos a cada dia a nossa missão de ajudar as pessoas a viver de forma mais saudável e contribuir para que o sistema de saúde funcione melhor para todos. Onde tem Américas, tem saúde.
Trying to find my way. Every day, just trying to find my way. Every day.
É muito nova pra ficar tomando remédio pra louco. Essa geração é cheia de história.
I'm gonna break through.
Saúde mental é real. E quando alguém minimiza esse assunto, só aumenta o problema. Se você está passando por isso ou quer entender mais, a AMIL pode ajudar. Saiba mais em amilsaudemental.com.br.
This is for scientists and those who believe in the potential of science. It starts with curiosity. A surprise in the pattern, an obstacle that can't be explained. Step by step by step, they challenge, explore, and unlock the unknown. Fueled by imagination, alone and with others. Repeating an experiment 1,000 times to have the chance to get it right. Once, but for forever. Making brave choices, choosing to push the boundaries, and choosing again and again to be led by science. In everyday decisions, everyday interactions, no matter where they are. Because putting science at the center of everything is the best way to understand and transform disease. The best way to change people's lives. This is why we believe in what science can do.
O Rio tem um laboratório que se importa com você, certificado e acreditado. Não paramos um minuto sequer na pandemia, realizando mais de 1 milhão de exames por mês. Conheça mais. Laboratório Blessing, de mãos dadas com a saúde e com você.
Em meio a tantas mudanças, temos uma certeza: a saúde continua sendo um fator decisivo na vida das pessoas. 1 a cada 4 brasileiros busca um plano de saúde para ter atendimento de qualidade. São pessoas que se preocupam com uma boa assistência médica e odontológica, inclusive na hora de escolher um emprego. Além de oferecer saúde e melhorar o dia a dia das famílias brasileiras, os planos privados salvam vidas. Nós da Fena Saúde temos o compromisso de promover bem-estar e transformar a vida dos cerca de 50 milhões de beneficiários de planos médico-hospitalares e dos quase 30 milhões de brasileiros com planos odontológicos. Proporcionando assistência 24 horas por dia. Criamos mais de 3 milhões de empregos. Realizamos mais de 1,5 bilhão de procedimentos médicos e odontológicos por ano. E movimentamos mais de 3% do PIB. Nosso desafio é garantir que a saúde suplementar acompanhe as transformações do mundo, priorizando a satisfação dos beneficiários. Nossa missão é oferecer saúde, cuidado e qualidade de vida para mais e mais brasileiros todos os dias, garantindo tranquilidade em tempos de tantas incertezas.
Fazer com que as pessoas façam mais, sintam-se melhor e vivam mais. Essa é a nossa missão na GSK. Somos uma empresa de saúde global com foco em ciência. Contamos com 3 negócios globais que atuam na pesquisa, desenvolvimento e fabricação de medicamentos, vacinas e produtos de consumo. Há mais de 110 anos, estamos transformando a saúde dos brasileiros. Somos líderes em soluções para a saúde em diversas áreas, como vacinas, HIV e respiratória. Nossos valores e expectativas guiam tudo o que fazemos na GSK e nos apoiam em nossa missão de ajudar as pessoas a fazer mais, sentir-se melhor e viver mais.
Microsoft Cloud for Healthcare brings together trusted capabilities to healthcare organizations and partners that enhances patient engagement, empowers health team collaboration, improves clinical and operational data insights, and protects sensitive health data. This integrated solution enables your organization to quickly access a portfolio of released and new healthcare capabilities tailored to the unique requirements of health data in the cloud. It unlocks the power of Microsoft 365, Azure, Dynamics 365, Power Platform, and our extensive partner ecosystem to create trusted end-to-end healthcare solutions. Together, it makes it faster and easier to provide more efficient care and helps support the end-to-end security, compliance, accessibility, and interoperability of health data. Microsoft Cloud for Healthcare empowers your organization to engage in more proactive ways with patients and gives caregivers tools to improve workflow efficiency, streamline collaboration, and connect data across existing sources to turn insight into action. Its connected cloud is designed to address your most pressing issues. enabling you with the speed and agility to adjust to change and build resiliency to help you weather today's challenges so you can begin to reimagine tomorrow. Microsoft Cloud for Healthcare, empowering health organizations to deliver better experiences, better insights, and better care. Learn more at aka.ms/cloud-for-healthcare.
A Pronep Lifecare, uma marca do grupo Sodexo, é uma das empresas pioneiras na atenção domiciliar no Brasil. Desde sua fundação, a Pronep Lifecare já cuidou de mais de 35 mil vidas e atende em todo o país mais de 2 mil pacientes por dia, atuando no cuidado e atenção às mais variadas necessidades. Tudo feito por uma equipe altamente qualificada e especializada na casa do paciente, de acordo com suas necessidades individuais e com acolhimento e cuidado. A qualidade do nosso atendimento garantiu o reconhecimento da Joint Commission International, JCI, que nos certificou com um selo respeitado mundialmente. Tudo isso para levar ao paciente e sua família qualidade de vida e conforto, sem abrir mão de cuidados médicos de excelência.
A Pronep não deixa faltar nada para minha filha. Eu sou muito bem tratada por eles. A equipe é muito boa, é tudo muito bem engrenadinho. É mais vida para o paciente, mais vida para você.
Pronep, movidos pela vontade de fazer o bem.
Nestes mais de 120 anos de história, entendemos o poder de um diagnóstico preciso e rápido na qualidade dos cuidados com a saúde. Quanto mais conhecimento, melhores são as decisões. E maiores as chances de superar desafios para vidas mais longas e com mais saúde. Por isso que na Roche Diagnóstica investimos tanto em pesquisa para o desenvolvimento de soluções e equipamentos. Em pessoas que podem inovar e melhorar processos e serviços. E no compartilhamento deste conhecimento que produzimos para o benefício dos pacientes. Isso é valioso. Como líderes, devemos ter consciência e orgulho do nosso poder de impacto na gestão da saúde no Brasil. De desenvolver o mercado, antecipando necessidades e soluções. Queremos ampliar ainda mais nossas condições de produzir informações relevantes e seguras, viabilizando melhores decisões clínicas para que as pessoas vivam mais e de maneira mais saudável. É isso que nos move. Possibilitar cada vez mais acesso à melhor medicina de precisão para o maior número de brasileiros.
Seja qual for o seu caminho profissional, o Senac tem um curso para você aprender fazendo. Você pode começar uma profissão do zero ou seguir nossa trilha de desenvolvimento e se aprimorar cada vez mais na sua carreira. Aprender fazendo é a metodologia exclusiva do Senac, que tem foco na prática e faz toda a diferença.
As Rodrigo Livar tells us, we are flying. You all have access. You can start talking and work together. This is the platform of FIS Week, which is going to be here after the events. Let us go into the next panel, CEO Summit, Digital Transformation and Innovation in Healthcare, with Armando Lopes, Director of Siemens HealthNet, Guilherme Anbar, CEO of CGN Brazil, and moderator Lydia Abdallah with Group Sabin. So please use your camera to read the QR code and answer your survey. Let's start our next panel. Good afternoon. It is a pleasure to be here. I'm very glad to be here to participate in one more FIS. FIS 2021 is speaking about healthcare and everything that we've been experiencing in terms of changes. Our panel today will be about digital transformation, health innovation with Armando Lopes from Siemens and Guilherme Amber of CGN. During the past 2 years, we've had so many learnings, also uncertainties and questions about how the future will be. But there is one thing which we are absolutely sure: the future of our businesses, the future of health organization, healthcare organization will experience changes, transformational changes, not only in digital, but also in other disruptive innovations that we have all experienced. And that has been really driven also by the pandemic. But the healthcare industry and a number of our other organizations had been working on a number of innovation process, discussion. Always think that technology is a way ahead and there is no coming back. We have a large country with structural differences, and the pandemic has shown a lot about that. And we have a number of possibilities. Technology and what's available today in the world has really provided us the possibility to say that we can have a more sustainable healthcare with better quality and more possibility to offer quality of life to the population who's living longer. Five or 10 years ago, we discussed that people would be living longer, would have more comorbidities, they would be more concerned on quality of life, realizing that preventive medicine has to be our main focus. And we, of course, we cannot speak about personalized care, genetics and genomics without addressing technology for digital transformation. We have here today 2 companies which are referenced in healthcare, and we are going to hear from them what they've been doing and how digital transformation can generate and bring more value to our clients, and what we would like to hear what you have been observing for the past year, and what are your plans for the future. Let me start with you, Armando. Thank you very much for being here with us today. You are on mute, Armando. Well, Lydia, such a pleasure to be here in the panel. It's a pleasure to hear you. It is an honor to be with you here today. I am going to start talking about the transformation of healthcare. What are the main vectors that are promoting healthcare transformation? Thanks to the revolution we've all experienced in medicine, people are living longer. In Brazil, we also have the triple load. So parasitic, infectious disease, lack of sanitation, violence. And finally, the degenerative chronic diseases. But regardless, people are living longer. In addition to that, there is an increased awareness of citizens, of people. We want to manage our health, prevent potential diseases. And of course, COVID has really given impulse to some changes. A CEO of a hospital has recently told me that people had, some of them would undergo tests or results and would never collect the test results. It has changed now. People are really more focused on managing their own health, and it has really it's a reality with the pandemic. And so much is said about that, especially in the media. I have recently learned about longevity. Throughout our lives, we are impacted by diseases that can be cured, whereas when we are older, we also suffer of diseases and eventually end up dying. But much has been said about lifespan as well, where diseases are less frequent. All strategies of prevention based on data, based on artificial intelligence. And the morbidity stage will be compressed, increasingly more compressed in the last years of our lives. So longevity, we are going to live longer with higher quality of life and compress morbidity when we are close to our last days. This is the dream of medicine in the future, effective health management. To get there, there are three main pillars. We should go into expanded diagnosis, and there are three pillars, as I told you. So, digital world having the ambition that each and every citizen would have a information, a system with all the information about health, including simulation of treatment, also to provide clinical solutions. So the decision is always in the hands of physicians, but the more information we have, And the more information we have about the history, so much the better. So this is one pillar. Secondly, precision medicine, minimally invasive medicine, so that we can treat people at the right time, at the right moment. And this is fully individualized. Finally, data use and how we can provide interoperability and the benefits resulting from them. You can work with a series of predictive algorithms. It goes beyond prevention. It goes into not only predicting, but prevention. And we can select groups that need added support. So all towards longevity, living with enhanced quality of life. And once again, all of that to support clinical decision-making. I would also like to take this time to tell you more about the catalyst action that was the pandemic. There are a number of tools that have always been in place. I don't think it's necessarily technology, but our willingness to use it. Telemedicine. My father used to be a doctor. My brother is a doctor. My father used to give recommendations over the phone, then saw them in his private practice if he knew them, of course. Today, we can see people, we can talk and interact with them. But it started being used once we had no other option. And a number of other services provided at Siemens Healthineers. Whenever there is a new device offered to our clients, we teach them how to use. We teach to explore it as much as possible. We call it application. It used to be on-site, although it could always have been remotely. Now, of course, we are just doing it remotely, training them on to use new machines. And clients told us it was even better. And rather than having 5 days and radiologists might not have, let's say, enough time to be with us for 6 hours a day. So we just broke into smaller chunks. So presented one initial piece of information, protocol, the person tested, then could review the next day. We've been using augmented reality to fix devices. And it all happened because we had no other solutions. Of course, the pandemic has been horrible. But what we have learned, we will try to maintain and use the best of the two worlds. Acknowledge the benefit of telemedicine and a number of algorithms that we can build that will provide a solid, robust support for clinical decision-making. Understanding the health continuum, which is something really important, from prevention to treatment, and just monitoring the patient's journey. So how can we have it all protected, but at the same time well structured, because the benefit is non-disputable? These are things that we have to do correctly, and we cannot simply postpone and expect a new pandemic to come. Fortunately, we had the tools in place and we could use them. But there are a number of capabilities that we have to build to have a VUCA world. And then we will be prepared to work with them no matter what comes. Great. Thank you. Thank you, Armando. I think you've made it very clear about what we've learned and also about the future. The importance of healthcare, diagnostic medicine. At Hospital Sabin, at our group, we have also experienced a change in the profile of patients. They are really concerned about preventive medicine. And here at Sabin, throughout the year, we've seen a change in the profile of the audience that needed our services. And we could see the age range, primarily of men, that used to come. Well, children come to be tested with the mothers up to teenager years. Then men just, women comes at the age of 18 and up, and men just come back when they are 40s, when they are in their 40s and start performing checkups, provided that they have no healthcare issues. But we've seen a change in profile. We now have younger people, people who are in their 20s coming to our services, undergoing medical visits and also diagnostic tests concerned about prevention, which is something that has also been brought by the pandemic. And the pandemic has shown that we have to invest in prevention and quality of life. Because then if we have an infection or anything, we can be personally prepared, healthier to deal with any issues. So this is something that we've observed, younger people coming to us. Let me now hand it over to Guilherme, who is going to tell about the topic and his experiences. Good afternoon, Lydia and Armando. It's a pleasure to be here with you. Thank you for the invitation. I think what you were saying is right to the point. We've been emphasizing a lot the improvement in quality of life, transforming medicine from treatment to more diagnostic. With the pandemic and everything we've been through, I think we have taken a higher leap, greater leap, going from diagnostics to prevention. There were many campaigns ongoing, and the pandemic has really increased the number of patients coming for prevention care. Everyone has access to internet, and we know that people are constantly searching for information, but there is such an overload of information, sometimes they don't know what's right and wrong. So being in closer contact with the doctor or the lab is good, because then they can have better reference. They can have a, let's say, someone they can resort to, trustful sources, of course. We know now who should we ask for when we need information. As you have pointed out, the pandemic has laid bare a number of problems we have. Thinking in Brazil, accessibility, and there are regions in Brazil that maybe didn't even hear there was a pandemic. And we have to deal with a number of situations. I think that what really concerns digitalization is exactly there. make medicine come closer to us, having patients really fully aware of their health, paying close attention with what's going on, and thinking about two things: what is going to be to the physician, what's going to be to the patient. Thinking about telemedicine as a reality, the number of other tests rather than COVID really dropped in the first year. First, because of the number of tests that the labs received and they had to get organized. But secondly, we've seen that people were afraid of going to the lab because of the pandemic, because in the lab there would be greater risks, more people who were sick. These technologies were available, but people were looking for options, looking for ways to being treated, to be taken care of in the pandemic. So new technologies will come into play to give more information. Now we know that the smart watches are really common. We use thermography, some easy and wearable technologies. At Sigina, what we've been developing, because we are developer of technology for diagnosis, and we've always been focused on making a diagnosis, closing a diagnosis. We wanted people to really know what they have. And we've been thinking about a number of possibilities for patients and for labs. We've also detected the importance of developing Brazilian technology, our own solutions. We tend to use what comes from abroad. We are a multinational company, but sometimes what applies in a system in Europe or in the US is not exactly what's going to be appropriate for our own reality. And I think that this is something that the pandemic has shown us. We have to address our reality, rely on our resources. We've been developing things with in partnership with Brazilian companies. So less invasive tests, self-collection, patients that can collect a sample at home and take to the lab, integration of results through apps so that they are accessible to physicians that can really access them. Also, commuting, so how to get to regions which are far away from the large centers. We have a project which is to grant access to labs, to physicians, and to Brazilian hospitals so that they can develop their own solutions. For them to use all this digital framework that we have created in panels that would meet the reality of that specific community. The natural progression of it all would be to generate high quality data to really serve as input for both sides. On the one side, patient, on the other side, the service center, hospital. Telemedicine is excellent. You can reach a patient in situations that were never thought before, but at the same time, you need rich information to provide a treatment solution. So it's a whole myriad of things that come from digitalization. So provide enough data for a patient to understand the situation. So that can be done through home collection, less invasive methods. Really making it accessible. In addition to diagnosis and treatment, this is what is going to help us leverage further prevention. Thinking about longevity, quality of life, and the trend. And just saying a lot about that. About data that is going to be generated in our daily practice. This is what we've been trying to do, really have personalized and something which would be much easier for the lab and accessible to everyone. When we think about that, and we think about the beginning of the pandemic, we've had problems of supply chain, not only inappropriate access to machine, but also PPI. And a lot has been said about the national industry, investments in science in the country, the campaign of immunization, and what has been in Brazil. Because we have reference centers and what we have for different vaccines in Brazil. This is also a legacy of the pandemic, and we as leaders in our organizations, which are representative in the country, we really have to focus on that, building together with the government and other companies, forging partnerships that can really encourage national investments in research and science. Really invest in research, science, and education. We talk a lot about digital transformation, innovation, but we've also been realizing that we don't have enough technology professionals with training at technical level and higher education level. So I would like to hear from you whether you've seen that in your companies. What have you noticed in the market in terms of access to talents in the area of technology? Do you think there is a shortage of qualified professionals in these areas? And how have you prepared your companies for the future? When we're talking about digitalization, so we really need professionals who are qualified.
Well, you're totally right. No doubt, we look at our country, we have a high rate of unemployment and areas and industries where we have lack of professionals, and also in healthcare. We had a great issue during the pandemic. so that we can provide access to our 220 million inhabitants, we must have strategies that are not only training, education, healthcare, technology professionals, but also to have tools that allow you to leverage and maximize their work. So an example that we have, you can have MRI remotely monitored. People can take care of both, or you can ship the equipment and AI tools that allow tests to be conducted faster. So the sum of what technology can provide and the support in training people, actually we were talking the other day, the training of healthcare professionals. I make a comparison that is kind of naive. What the scientific calculator means to engineers, we need to continue, obviously, with the money, knowing what concepts to apply. But it's a fantastic tool for doctors, healthcare professionals. AI will be a great tool to be able to care for more people with better quality, more speed, and so on and so forth. So they are important tools, and we need to learn how to use them appropriately. And I'd like to, before I hand over to Guilherme, I'd like to address another topic that I think it's super important regarding reducing waste that we see a lot happening in health. How can we leverage the engagement of citizens, patients? This goes through, as Guilherme mentioned, we have a lot of things generating data, small devices like oximeter, smart watches, that people say that it tells you how long you've slept, how much exercise you've done, etc., etc. Look, so we have an image that if we create a layer where the data is actually loaded, how much can we savings can we have in terms of saving that could be actually expand access for more people? So it's a personal history. My mother, during a certain period of her life, then she underwent several surgeries, and then we had another institution. And then I got there and they asked, oh, then I can ask her, what do you have? What's the matter with you? She was able to tell 1/3 of what she went through. Then I told the other third, and my brother told the other third, and so on and so forth. If all this record were available, we would avoid not only telling stories, this is not an issue, but obviously some information could have gotten lost halfway, and important for the other procedure. Just as we look at the beginning of the continuum of health, people that wear a smartwatch, how much are they motivated to doing more physical exercise, caring for the time they go to bed, they wake up? For you to have this information available also helps in this virtuous circle for you caring for your health. Somehow you're almost playing a game on that. That's another aspect that I consider very important. And then I'd like to ask your permission for us to tell you a bit of what we're doing at Sabing. Today at Sabing, we have a data platform for image, for clinical tests that is established. What are the benefits that we perceive? The access of citizens and patients to information is very simple. They have everything in the palm of their hands for doctors. And this is ready for us to start plugging some algorithms or adding some algorithm on top. For example, an algorithm that reads images and helps radiologist in his report. So they process everything, they can actually add information and make information available. In other words, building other attributes of value becomes not easier, but feasible, and also provide space for you to be able to, the quantity of information is infinite for you to build value on a system like this. And then again, you're providing a playground so that more people can be trained, more people can be prepared, both from the technological standpoint of health management, to be able to bring these benefits. So I'd like to close your question. So saying training of people is knowing what exists and give space so this creativity can be exercised. And Guilherme, you brought up a point that is quite interesting. So we are used to consuming what comes from abroad. We will have conditions, as in many cases today, that we create solutions here and we export the solutions. And we have some unique advantages in our country. For example, diversity, genetic diversity. We have people from all over the world living here. The word of Hospital das Clínicas is mapping people. You know that the diversity, and this for you to train an algorithm, it will be much more powerful, because rather than what a person tested with a sort of single feature, and it gives room to prepare us or to prepare people to be highly qualified, having both things together to our country and abroad. Thank you. Perfect. Thank you very much. Guilherme? I'm going to try to follow what Lydia mentioned. I'm a biologist. My profession has never been so valued as it is today. Thinking about training of professionals, we have a lot of opportunities. Actually, we have excellent universities. We have professionals with excellent training, but what I think is lacking, something that we've been trying to do, is greater participation of the private sector in universities, something that happens a lot in Europe, in the United States. You have very good professionals in technology, databases, handling information, etc., because they bring this demand into the university, into research centers, and then they develop professionals that are very competent. This is what we lack. We have the minds, excellent people, we have excellent universities. What we lack is taking these demands, so we get to this, that the more technology, the more development that we have, greater opportunities we have for people to work with universities to develop those professionals for these markets. They are new markets. They know quite well what they are like. I have a degree in biology and diagnosis pre-pandemic. We know what it was like, so we're still starting. So we have professionals that were not prepared for a market that did not exist in Brazil. So this is starting. So the idea is to have private initiative adding to actually prepare specialized labor for the demand that will be increasing. And what actually Amanda mentioned or commented, thinking about the professional side, we're also at the rush to get information, to obtain information, and then we have to be careful with the quality of the information generated, and also we have to see what to do with so much information. So today we see, for example, you have MDS panels mapping the whole genome, and what do you do with all that? So this generates a need on the side of professionals and doctors how to work with that. And digitization helps a lot for you to have a group of professionals working on the patient. And we know quite unlikely a single professional with a single type of training will help with all that information, considering the quality of life of patients. We're talking about several specialties, the clinical record of the patient, everything on a single place. We can have a team of professionals working on that, and this incredibly increases the quality of the care the patient will get. And the need of professionals could be more generalist. So dealing with all that information and give some direction. So we have this gene, okay. And what do I do with this piece of information? Where am I going to head to? So sometimes we're talking about not the gene. When you think about the whole genome, so 100 pages of report. And what are we going to do with that? So this is something we have to grow in parallel. Data generation and also how we deal with the data. How we're going to use that in the best way possible and turn this into something palatable for the greatest person interested, who is the patient. Thank you. Thank you, Armando. Thank you, Guilherme. Very good. So when we think about digital expansion, innovation, we went through talking about the importance of professionals, and for us to finalize this panel and thank Armando for all the contribution, for his vision, Guilherme too, arriving, the flight is delayed. He was able to get to take part. Thank you very much. And I think also this is a legacy that we have in this pandemic that will be very important for the future, which is collaboration and cooperation projects. So here we are representing 3 companies, saving partners of Sidini, Siemens. That's important for our projects, our businesses, everything that you have been doing, have been developing, the investments of the companies, of your companies, to us on our side, be able to offer better solutions and new business models to our clients, patients and clients. So if we look into the future much more with this vision of collectiveness, cooperation and collaboration, I believe we'll manage to get faster results, and the population we gain from that, the country. I've been with Armando this morning at another panel where we talked about how much our country has, 210 million inhabitants, a growing country that will need a lot of health, complementary health care. We have 50 million lives, 150 in public health, and how much of all these people require increasingly more health. We have a lot of challenges ahead, but no doubt many opportunities, and we know how much our companies can and need to be protagonists at this time, post-pandemic, I would say. I do hope that, in fact, we are going through them, leaving them behind, then learnings remain, legacy remains, and we have ahead of us a lot of good fruits to reap from everything that has been invested in, all the work of all our companies. Thank you very much, Armando. Thank you very much, Guilherme FIS. Thank you for this opportunity. We do hope you have contributed to the event of this week. Thank you all very much for having attended us so far. Thank you very much.
A Abrange completa seus 55 anos de caminhada com o propósito de democratizar o acesso ao sistema privado de saúde, de eficiência e qualidade. Enxergamos o futuro com bons olhos, mas sempre priorizando o presente. Abrange 55 anos. Nossa origem, nossas histórias e nossas conquistas.
Desde que a Covid-19 chegou ao Brasil, uma força-tarefa de proporção histórica entrou em ação, ampliando a parceria entre os setores de saúde privado e público. Um conceito central para nós ganhou ainda mais força. A saúde brasileira é uma só. É um orgulho fazer parte dessa corrente. ANAP, Associação Nacional de Hospitais Privados. Unidos pela saúde.
O conhecimento transforma. A transformação te carrega para o futuro. Onde você quer estar daqui a alguns anos? Qual habilidade você quer aprimorar? Que profissional de saúde você deseja ser? Como caminhar de mãos dadas com o seu futuro? As respostas de todas estas perguntas não se alcança sozinho. Ask Mind, porque nós somos incansáveis por conhecimento. E você?
Bradesco Saúde desenvolveu uma série de iniciativas que promovem orientação e cuidado em meio à pandemia de Covid-19. É o Saúde Digital. Com ele, quem tem Bradesco Saúde pode realizar consultas médicas por videochamada sem sair de casa. Veja como funciona. Para dúvidas e sintomas de Covid-19 ou outras questões de saúde, você deverá acessar o app Bradesco Saúde. Se você ainda não tem instalado, faça o download gratuito na App Store ou no Google Play. Para consultas médicas regulares com médicos referenciados, acesse o site bradescosaude.com.br. Confira as especialidades disponíveis para atendimento por videochamada e como agendar sua consulta. Bradesco Saúde, ao seu lado contra o coronavírus.
É pra ficar junto.
Inspira.
É pra saber sua história. É pro seu estilo de vida. É pra olhar nos olhos. É pra cada fase da vida. A DASA é uma rede de saúde integrada que acompanha as pessoas ao longo da vida. DASA é pra toda a vida.
Para ser referência em medicina, é preciso ir além. É preciso ciência, método de pesquisa, fomentar conhecimento, compartilhar e formar talentos. Ao longo do tempo, investimos para termos o melhor corpo médico, as melhores instalações, a melhor equipe assistencial, a tecnologia mais avançada. É nisso que acreditamos. É isso que buscamos. Somos o Hospital Moinhos de Vento. Referência em medicina, referência em saúde.
The body is an amazing organism designed to run marathons, think of ideas, and see a beautiful world. It's capable of complex tasks. But when the body is compromised by disease or disorders, disabled by trauma or wounds, it needs help getting better. And that's why we are here, to create medical technology that saves lives and changes lives. For the heart, the soul, the ambitions, and the dreams of every person we touch. We are here to innovate, to look at challenges from all angles, to follow patients beyond diagnosis, through treatment and recovery, to get them back to their best body, living their best lives, and being their best selves. Our ambitions are big. We are working to give people surgery without incisions, contact lenses that treat allergies, implants that monitor themselves, real-time maps of the heart. We are redefining what the body can accomplish. And even though we are a diverse group of businesses, we share a common goal: save lives and ignite all that's possible in everybody.
Super-heróis são seres com poderes mágicos que voam, que enxergam o que ninguém enxerga. Hoje, fica claro que vivemos rodeados de super-heróis, dirigindo, acolhendo, cuidando, que têm feito da proteção do outro sua missão. Eles sempre estiveram aqui, só estavam disfarçados. Homenagem a quem tem feito mais do que seu trabalho para mais gente ficar bem. Mater Dei 40 anos.
Em 2021, o prontuário eletrônico do paciente do SOMV, solução da empresa para o setor hospitalar, ganhou pela 6ª vez consecutiva o reconhecimento de melhor da América Latina, de acordo com o Instituto Norte-Americano CLES. Uma vitória que é nossa, de cada um que trabalha na MV. Quem faz o PEP sabe que por trás da solução tem muito esforço, dedicação e comprometimento. É por isso que esta conquista não é apenas da MV, é do Brasil, é nossa.
Nós nascemos na saúde e nos movemos pela saúde. Impulsionados por essa paixão, nos tornamos uma das maiores empresas de tecnologia para a saúde do Brasil. Nosso caminho é trilhado por 400 colaboradores e mais de 6.000 clientes. Somos tecnologia que evolui todos os dias. Somos Fixion.
Inspirar pessoas a cuidar de pessoas. Isso está conectado no olhar e no sorriso de quem é Sabin. De norte a sul do país, o jeito Sabin conecta você ao que existe de melhor em saúde integrada. Construímos pontes e histórias para contribuir com a comunidade, o meio ambiente e com um ecossistema empresarial mais humano, diverso e inclusivo. Seja aqui na sua casa ou na nossa casa, estamos de mãos dadas com a inovação e tecnologia para que a sua jornada de saúde seja completa. Grupo Sabin, presente e futuro conectados com a sua saúde.
Nascemos com o desafio de mudar o olhar para a saúde de cada pessoa, transformando informação em conhecimento. Tudo em um mesmo lugar, dados e serviços juntos para permitir pela primeira vez que cada um tenha a visão completa sobre sua saúde. Todos reunidos em uma plataforma, unindo forças para criar soluções extraordinárias e oferecer todo o cuidado que cada pessoa merece e precisa, de maneira coordenada e digital. Afinal, acreditamos que usar a tecnologia de forma inteligente e integrada é o primeiro passo para preservar o maior ativo de nossas vidas, a saúde. ID. Toda saúde é única.
THB é uma das maiores consultorias em saúde, benefícios, seguros, resseguros e affinity. Com foco em inovação e proximidade com o cliente, a THB tem uma equipe multidisciplinar, com consultores especialistas na estruturação e administração de programas customizados. Fundada em 1978, faz parte do grupo MODELOS, o maior wholesale broker dos Estados Unidos, e está presente em todo o Brasil. THB, soluções que vão além do seguro.
Você está na FIS Week. Aqui você encontra as versões imersivas do nosso evento, que vou explicar mais tarde. Você pode escolher o idioma aqui. Aqui você encontra todas as áreas da FIS Week representadas por monumentos históricos. Na pirâmide, você pode acessar o FIS e ainda conhecer mais sobre a história da construção. Aqui você poderá assistir aos painéis do FIS 21, participar da discussão através do chat, enviando perguntas e comentários, além de conferir informações sobre o painel e os participantes. O mesmo vale para o Simetria e o Commits. Clique nos monumentos para acessar os eventos. Você também pode acessar a Meeting Zone no nosso mercado central. Lá você pode agendar um meeting com os nossos parceiros e encontrar outras pessoas que estão participando da FIS Week. E você também pode conferir a programação, os palestrantes, relaxar ouvindo música no nosso oásis e muito, muito mais. Aproveite a FIS Week e faça parte da maior experiência da saúde na América Latina.
abrange e completa seus 55 anos de caminhada com o propósito de democratizar o acesso.
Have you heard the news, Priscilla? There will be 2 FIS Week a year, one in May and another one in November. That's nice. 4 events in May. FOMENDO Summit, the largest innovation event in Latin America. We've had this one, we have one this year, and the e-commerce, and 2 other new events, the FIES Marketing Summit and Liga, focused on education. This is just great news. Okay, we're starting yet another panel. This is going crazy. So, learning during times of crisis. So, Andrea from Coca-Cola, Mohamed Pareni from the Moinhos de Vento Hospital, Paulo Manso, Senior VP of Design at Kohler Hotels in South America, and the president of Mater Dei, Henrique Salvador. He will be our moderator. All right, let's go. Good afternoon, everyone. I would like to congratulate Rosier, Villar, and the entire FIS team for putting together this very successful conference. This has been wonderful to discuss innovation in the health industry. We have the chance to now discuss a very relevant topic, even more so based on what we have seen in the past 2 years. We've had to overcome several challenges, but there have been some opportunities as well. We had to reinvent ourselves to manage our organizations. We have 3 important experiences from different industries, and they will be very helpful in understanding this topic. I'll turn over to Andrea Mota first. She'll be describing her experience with the Coca-Cola company. She is one executive there, and she'll be describing what was more important to her and to her company, especially to manage this crisis. Over to you, Andrea. Thank you, Henrique. Thank you. It's a pleasure and an honor to be here. I'm sure I'm going to learn a lot as well. I liked the topic of this panel because, just like Henrique mentioned, we can contribute by providing different perspectives from different industries. So this is the point of view of a large multinational corporation. We were all caught off guard, the largest crisis we've ever experienced. And I would like to start by reminding you that we've been in this pandemic for almost 2 years. At the beginning, it was something in China. We didn't know what was going to happen. Coca-Cola and so many other companies have that characteristic. We operate globally, unlike a government that will look at its own territory, its own country. We look with a kind of borderless approach. We received news from China and we had no information whatsoever. There were so many doubts, but right off the bat, we felt we had to prepare. There was something different about it. This is something that companies can contribute. From the very start, we got in touch with our team in China. They were witnessing it firsthand. We collected a lot of data. We never knew, there was no way of knowing where it was going to lead us. But what happened from that point on is that we defined a strategy. From the get-go, we defined 3 phases. The first one was focused on awareness, trying to help people understand as to the care, the prevention. We lacked information, so the first goal was information. Phase 2, we realized that, well, this is going to take longer than we first thought. So we started supporting communities, especially those that are most vulnerable. And then on to phase 3. So there was some back and forth between phases 2 and 3. After that more acute phase, we realized there was an economic impact. So we decided to help small retailers, an important portion of Coca-Cola. So we were supporting the vaccination effort for those that had already access to that, and also the economic recovery. So these were the 3 phases and how we approached it. As I said, the initial phase was more communication focused. March, April, May of last year, the very beginning. Initially, we were off the air as a company. The brand Coca-Cola is advertising every week, 52 weeks a year. We're dependent upon commercial. So we decided to go off the air. It was a tough decision for such a huge brand like Coca-Cola. So that was so painful. There was so much uncertainty. We couldn't conceive of any positive message to convey. So that was for 54 days, almost 2 months, not airing any commercials. We're not concerned about selling the product. We were trying to find out ways to help. Here are the lessons learned. So we used those resources that we ended up saving from not airing commercials to help people. Our logistics people, our intelligence people concentrated on this effort. And here are the top lessons we learned. Number 1, actually 5 major lessons and 3 other things that are here to stay. Okay, lesson number 1, active listening. So before you start helping, hand sanitizer, what do you have to do? Let's talk to governments, to ministries of health, health professionals, communities. So we tried to first understand how a company such as Coca-Cola could help. Listen actively before we start doing something, thinking that you know what others need. You have to first listen so that you can more effectively contribute. Lesson number 2, planning. We learned that, and then China, and then Italy, planning was key. And I mean, having an active plan. We heard from our team in China that the pandemic would have cycles. Our initial action was communication focus, prevention focus. We knew we had to go back to that communication because people end up forgetting about these things. So that was an active and flexible plan. We were fearful, doubtful at the beginning, but then we had to focus on health systems and then vaccines. So there was a second important lesson there. The third lesson has to do with what I've just said. Habits. Habits take time. Communications, actions, care, prevention. We knew that it wouldn't require just one action. So we had a couple or a series of actions. So we worked with government agencies, communications or education campaigns. So we had posters in the back of our trucks. So we used the labels of our bottles to convey the message we received from the Ministry of Health. Drawings, we want anyone to understand that message. Habits take time, as I said. So we had to do that a number of times. People are still question or are doubtful about how to prevent themselves, how to prevent from the disease. Lesson number 4 was to use what we already had. I don't have to reinvent the wheel. Oh, I discovered the best way to do that. There are many good people already doing it. So the role of a major organization was to leverage what was already going on. We weren't conceited and believed we would be able to come up with something on our own. So we helped support. We wanted to be helpful. It takes time. And that's the lesson I'm going to refer to now. Think in a network thinking, to think collaboratively, how to join efforts. And I'm talking about the Coca-Cola system. There are 9 groups of bottlers. So we reach many different areas. So we involved partners and other organizations to come up with that network thinking. So these were the 5 major lessons that we learned during the crisis. And I would like to conclude by saying that once we were done with that more critical period, what's left? What remains? I'm still working from home. Coca-Cola is very careful. Where tests will start only in late December. Let me just point out 3 major changes. We're no longer a business-centric company. Of course, the business is important. A company has to be profitable. But we are a people-centric company now. Employees, suppliers, customers, consumers. So that remains. So we are now a people-centric company. The second legacy, if I may, it has to do with a network. As a company today, we have a networked model. We are no longer a company that operates broken down by silos. That's very complex. It involves a lot of pain. You have to review and revise the way you work, the political structure. But after a year almost working in a network, the results are just amazing. So that is here to stay. And finally, as a sustainability director, I'm very pleased because we no longer have a model in which we would look at a specific activities that Coca-Cola could do to help society. Now, we want to make sure that this social impact becomes our business agenda. It's no longer a separate department, something to be in a sustainability report, and that's it. It has to be connected to the business. And we're taking care of that agenda with the same importance, discipline, taking into account metrics, all business or results meetings, because this is our business. If we can't look at the social impact and what a company leaves behind to a society, to a country, it cannot be considered a business. So ESG is part and parcel of our business today. So these are the 3 lessons that are here to stay. And I'll get back to you, Enrique. Thank you, Andrea. That was very nice. We can detect many opportunities out there, especially these last 3 lessons that you mentioned. New guidelines, well, they may not be new, but these are guidelines that have to be taken into account today. I'll give the floor now to Mohamed Pahini. He is the executive director of Moinhos de Vento Hospital in Porto Alegre. But he has a very comprehensive background. You have experience in other industries, and I'm sure you resorted to that experience to one of the largest hospitals in our country. Over to you, Mohamed. Thank you, Enrique. It's an honor to be here today. Yes, Moinhos and Mater Dei, one of the top hospitals in our country in terms of medical services. I'm very proud to be here with Andrea, Paulo, and with you, sharing my experience. I like the topic that you picked, so that we in the health industry, with people from other industries, I paid close attention to what Andrea said, and I'm very pleased to know that traditional corporations are beginning to understand the importance. And she, of course, as sustainability director, should be proud, because her department is no longer supplementary. It takes center stage now. We're no longer talking about products. I was the director of a hotel chain for Latin America. It's the Marriott now, hotel chain. And we used to say that it's not only a box. A hotel is not only a room, it's an entire experience. How can our customers perceive that experience if our employees do not feel welcome? If they don't realize that what we say, we do what we say. And the pandemic was a great opportunity. But those that are not in the health industry, we've seen that tragedy, this long-lasting tragedy. I was a child, maybe Enrique was younger. But we remember the 80s and the 90s, and we had the HIV pandemic. So we had isolated units to treat patients with HIV. And for those of you that are not in the health industry, so we were very afraid of what could happen. The strength of the virus. I remember people live streaming, country singers, drinking beer, people clapping their hands for professional health professionals. And our folks could not get into the elevator in their own buildings. People did not want to get close to health professionals when things were a little worse, of course. So I was in the United States. I was working for the Johns Hopkins, and then Health Ministry or Health Minister Mandetta asked us to help us coordinate that effort. When I joined, or when I came back to Porto Alegre, we had a tent put up, 80 professions to have emergency services. We canceled all elective surgeries. The first community contagion level, we were the first to communicate that it took place in our hospital. So we decided to protect our employees completely. Traditional labs had some shortages. We've invested to come up with our own lab. We realized that it would be too much for them. So we built our own lab. And then we offer our services to the state of Rio Grande do Sul. These are just a few examples. We had the responsibility center, and that's our commitment to society. The results were awful, of course. So financial results were terrible. We came out of it much stronger, actually, along the same lines of what Andrea said. People from other states migrate, come to us because they know how serious we are, how strong we are. And in order to do so, you have to have that strong and resilient culture, because you have to be somewhat prepared. A risk management culture, but a network of employees that are passionate about your company, about your cause. Health professionals are somewhat like that. Some institutions more than others, but that's the case in our organization. This hospital is called Moinhos de Vento because it had to change names. It used to be a German hospital. It served migrants from Germany, because those that migrate because of a hunger, war, religious friction, or ethnic conflicts. So these families came to the Rio Grande do Sul. I'm from Rio. 80% of beds used to be in Rio de Janeiro.
So that's why the hospitals had to join hands and set up the institution that we're part of today. We had to change our name as well, because in World War II, the Brazilians were threatening to invade because this was where the Nazi were. So we changed our name, we reinvented ourselves, and I think that we have this feeling of belonging, to see ourselves represented in a population that is fully Brazilian now. You can tell by my name that I'm not German. I'm from Rio, and also from the Arab community. And what connects us is our values, our desire to do good. And I'm very happy to see that we did our job. And I saw that there was a huge amount of companies that sowed a seed of solidarity. For the first time, I saw Brazilians do not have a strong donation culture from a perspective of philanthropy, as the case with the American or European model. We have this rationale of perpetuating wealth from generation to generation, and it's not really in our DNA to see large donations being made by families as we see in other countries. And I saw that during the pandemic, a seed was sowed and several companies expanded these possibilities. I'm not saying that Brazilians are not generous. Actually, we are generous as a people. But for the first time, I saw families and companies and heirs for the first time actively participating in an initiative of solidarity and of helping other people. So I think from the perspective of healthcare, we should have more professionalization and more and better methods. And from the perspective of businesses, we should be more solidary because at the end of the day, products come and go. Except for Coca-Cola, very few products survive the test of time. So products go away, but the brand, the purpose, they stay. And that's the DNA that connects us. Thank you, Mohammed, for your in-depth explanation. We know about the initiatives developed by Moinhos Vento over the course of these last 2 years, and they're very important for the community and for this general context of fighting the pandemic. I'll give the floor to Paulo Manso, who works in an industry that probably is among the most impacted industries during the pandemic, which is the tourism sector, whether it is for business or leisure. Tourism was highly impacted during the pandemic, and I'm sure that Paulo's experience is really going to give us a very good perspective about that. Because when the going gets rough, the rough get going. Like Mohammed said, it's very important to join hands with other organizations when we are faced with problems such as the one that we are and have been facing during the last year. You have the floor. Thank you, Enrique. It's amazing to be with you. I'm at a loss for words because the talks were really brilliant. And by the way, Mohammed will be taking over a hotel next month, which is right across from your hotel, from your company, Moinhos Vento. And what will I say about Coca-Cola, a century-old brand? Well, I'm here to share with you a bit of the timeline, as Enrique asked me, and I will take a step back and tell you a bit of our industry and what happened with the pandemic. 1 year before the pandemic, the hotel industry, the travel industry was one of the very few industries in the world that had been growing by over 10% per month for over 10 years. In the world, it's known as the blessed industry. Accor is a global leader in terms of hospitality and the world, so we're really strong. So that was a very interesting situation for us, and you're going to understand why I'm telling you about the year 2019 with excellent results, several innovations. I could spend 2 hours telling you about what we were doing. So all of that was happening in 2020, and it was pointing towards a brilliant year for us. Came January, and the hospitality and tourism industry is highly connected to the business industry, whereas the leisure trips are a supplement to that. When everything is fine, hotels are doing fine, and hospitals and Coca-Cola, and we can travel for Congress and for leisure. So as a company, we benefit from that. We were doing very well. January was very good. And then came the pandemic. We're really well established in Asia and China. And we started getting relatively accurate information from the get-go. And we thought that, of course, that was a wave that was going to hit Brazil. So we started gearing up for what was coming. And one relevant thing about that year, 2019, was that we're going to distribute dividend bonuses in 2020. And the company that's headquartered in Paris made the first big decision in the first week of March, beginning of April, that we would not be sharing dividends, and we set up a fund. So what we did with that important amount was what we'd been trained to do for the last 5 years. And here I'll pick up on the words of Andrea. We placed people at the center of the company. 5 years ago, Accor placed the human being and the experience of people, as Mohammed said very well. We do not sell one night in a hotel. We sell an experience, a dream, even solitude, by treating our guests well. So for the last 5 or 6 years, it's been a mantra to talk about human beings at Accor. And our collaborators, I've always been treated differently. We have guidelines and procedures, and we have a very nice program. I could spend hours talking about it. It's a program where every collaborator at Accor, we call it the heart is, so or hardest. It's a heart because this ties back to the idea that there is a heart and an artist in each collaborator. So in March, April, and May, 85% of our hotels were closed. And it's just like having grounded airplanes. No one told us to close our doors. It was simply the economy. Very few hotels in the world were closed by force of law. It was simply for economic reasons. But in Brazil, 90% of our hotels also had 0% occupancy, and we were fully ready for an excellent year. But then we had to look at the human beings surrounding us. We had to look and cater to the needs of our employees. So that fund was put at the disposal of any and all core collaborators that needed treatment. So we had very small margins for extremely severe treatments, and we took that responsibility. We did not ask anybody. We made that available. And we have 8 hubs across the world that took on the responsibility of taking care of our collaborators. And that was an extremely valuable message that we sent out. And we found out, and we have very good references in this panel, we found out that not too many people knew about COVID. What we knew for sure was one thing that we noticed right off the bat, that people were scared, and we had to try to mitigate that fear. And we launched a series of actions and initiatives. One of the nicest things that Accor ended up supporting was the global program against violence against women. When everybody went back to living in very small homes, the numbers went skyrocketing in terms of violence against women and also men. So we supported families, people, women, and men who needed that support with the solidarity tariff. And we have several of our hotels which are close to hospitals, and we transformed several of our hotels as places to give support to physicians and to medical teams, to nurses that couldn't go back home because they couldn't have contact with their family members. So they would stay at our hotels, and we would often bring in their families to visit them. And once again, putting the human being at the center of the situation very intensely. So things continue to evolve. And as I told you, there is a series of measures. There's the hardest fund, where we looked at our collaborators and we tried to transform our hotels into tools for society. And lastly, I want to mention one last aspect that is also very interesting. When we really didn't know what we were going to do moving forward, back in August or September last year, it was really hazy, the situation about what we were going to do in terms of vaccines and drugs and so forth. We were wondering, well, how can we go back to providing our customers with safety and security? We had to try to mitigate their fears. So we thought, well, we're going to bring an international insurance company into our hotels, and it's AXA, which is one of the biggest health insurance companies in the world, and they came to Brazil so our guests could stay with us. And if they had any symptoms and if they felt ashamed of calling the front desk and asking for an anti-cough drug, the other day I was on an airplane and I was coughing, and I had to start looking around me, and I was really embarrassed. But anyway, that happened. So if the guests were embarrassed, we would offer them a free medical virtual visit, paid for by a core. And we did something beyond that. We created our protocols. And as we all know, everybody during the pandemic became specialists in sanitation. We created protocols and brought professionals. I created a technical committee of professionals with Brazil's best specialists. Of course, we work with AC at our hotels, and we have to take care of the air circulation. So we wanted to go back to providing our guests with this feeling of safety, but we didn't have a good response. So we thought, well, how are we going to mitigate that? We invited an insurance company, and we asked them to verify that not only were we doing the right things to provide our collaborators and customers with the highest safety standards, but we were also audited by the Bureau Veritas, telling our customers that they could come if they are coming from the north of Brazil or from the south of Brazil or from wherever, they could stay with us because we were taking care of human beings, whether they're customers or collaborators or people who are in need. We wanted to extend a helping hand, and that's fundamental. I think that's the first and most important message. I really saw a very important initiative by many companies, many people, and I think that once again, the take-home message here is that we're leaving the pandemic more humane. Of course, we could talk about several innovations, and we implemented several innovations. We transformed our hotels, but that's not the point. The point is this pandemic has made us even more humane. That was essential for us to leave this pandemic behind. So these were my messages. Thank you, Paulo. And that was also a very relevant message. Thank you for sharing your amazing experience. So now I think we have 20 minutes to look more deeply into some subjects that you touched upon. So to get the conversation going, since we're talking about, we're in a panel with 3 professionals that represent extremely relevant companies with their very unique experience as administrators. I'd like to hear from you. What are the new skills and competencies, in your opinion, that an executive should develop moving forward to be able to deal with the crisis and everything that stems from it, and to better perform his or her tasks? Is there anything new that you identified, or anything that already existed in the past, but that you had to reinforce in terms of your professional activities or of your teams? I'd like to hear you, because there's something that is common across all of your talks, which is placing people at the center of your activities, whether they're partners, collaborators, or customers, or even competitors. We did see some very interesting partnerships between competitors during the crisis. So in your perspective, what should we be looking at and trying to develop as professionals moving forward? Well, I can start. There's lots of different things. The first one is empathy. And empathy is about placing other people at the center of the situation. Empathy has always been important. Another very important thing, especially now, because this pandemic is now way too long already. And I'm talking on behalf of my team, and obviously on behalf of others in this conversation. We should be able to tell people, or let people know, that we're vulnerable. It's okay not to be okay. Everybody has a day when they don't want to turn on their camera. Paula mentioned violence against women. That is absolutely true, but not only violence, but also overwork. Oftentimes, and that happens to me as well, you have to play double shift. You go to work, and you work at the office, and you come back home, and you do everything that you need to do at home. And it's okay for you to be vulnerable. People have to understand that it's okay for you to feel tired, and to take on a more compassionate perspective about burnout and stress. And Enrique mentioned that we've always liked to work with competitors. We do things with Ambev, with Pepsi, and it's really good when direct competitors join hands towards a common agenda. We do that in several different sectors, but during the pandemic, we did a business program with our competitors, because we saw that the difficulties that each customer has is the same, regardless of which company we're talking about. So we created this initiative with special conditions and support and help and capacity building to resume our activities. And of course, retailers are competitors. Many of them they went bankrupt. So that was a huge impact.
I agree with Andrea. We lost many people. Maybe the same thing happened at Mater Dei. Many people quit, many doctors. Of course, there was exposure. They risked their lives, both doctors and health professionals, and many older doctors quit, simply quit. Many people changed careers. It's cold in here. Many people from the state moved to Santa Catarina. It's not that warm of a place, but there are beaches, and many nurses had to work twice, or they were working 2 shifts, decided to go back to working just 1 shift. Many people were afraid and left the job and quit. Many people lost relatives. So we ended up losing many people. So people are willing to live with less money. I don't know whether we're ready to manage or to do people management just like in the developed world. So in the past, you used to have personal departments or personnel departments, not human resources. So that's a reality in developing nations. You are the employer, period. What if there's a movement coming from the bottom, people wanting to work less? Are we ready to lead these people? How can you be a new leader of people that are willing to contribute, people that are willing to work, to give their time, not just because they need the job? So the pandemic brought our attention to these issues. We have younger generations rethinking these concepts, hybrid formats, working even for a health-related institute, for a health company. I lost 20% of my workforce, very skilled personnel. You can't easily replace them. So that's a tragedy. Catastrophic. We have to reinvent ourselves. And even in Latin America, how are we going to attract people that are willing to remain, to stay? But let me remind you, there's no such thing as a company. We have people that represent the company. Who are the directors, the executives that will represent us when we are not looking? This is new. This is the learning lesson. This is the number one, in my opinion. Thank you. Thank you, Mohammed. Very nice comments. Let me reconsider what I was going to say. Let me put it. I'll try to be clear. We're going through major changes, all of us. These are critical times we're going through. And these executives have to be sensitive enough that we're going through some transformations. Those solutions that used to work in the past, so they have to go through some reviewing. The communication with our employees, suppliers, oftentimes we forget about them, just like Mohammed said. We work as an employer, as a boss, period. These guys or these suppliers are human beings. They feel our pain, and there's no guarantee for them. So this is the characteristic that we need from an executive. So they have to find new answers. They have to be very sensitive. We have a very large team. We have over 20,000 employees before the pandemic. There was turnover Yes. So we have to be sensitive enough, careful enough to understand the new habits of these new employees. Let me share some information. I have a brilliant team in my a person in my team. He lost a relative. He decided to move elsewhere to a small town. I've always saved throughout my life. I've always done the right thing. I suffered, and now I want to enjoy life. What can I tell them? No, don't do this? Of course not. This is just one example. It may seem very simplistic, but it represents the current scenario. Well, two important characteristics for this new leader is sensitiveness and the power to communicate. So we are giving new meaning to those truths that we used to believe 100% in the past, because they're going to be reviewed and revised. Anyway, there's another issue we have to discuss. All organizations suffered from the pandemic, but we're talking about 3 leading organizations in their industries. These 3 leading organizations did their part. How do you manage that balance between doing the right thing and still maintaining business as usual, taking good care of business? How do you keep those 2 plates up in the air, spinning? When you look at cash flow dwindling, how did you honor your debt, payroll, taxes, suppliers asking for a renegotiation? Government helped to pay salaries, but still we didn't know how long that would take. So again, how do you balance these 2 fronts? Would you like to start now, Paulo? Yeah, that's a very complex question indeed. I'll try to be very clear as to the decision we made. I even said that in my initial answer. 2020 was going to be a spectacular year. We had been preparing the company for that wonderful year. We were going to pull it off. And of course, this information is public. First, we asked our board, and then we published it because we are a public company. It's a French corporation with a very strict regulation. So we decided to look at human beings. A very difficult year. Results are public. Our results in 2020 was a negative results, but there was a decision made and approved, and it was a public decision. We looked at human beings. We wanted to take good care of our employees, partners, suppliers. In 2021, we've been working hard and we've been involving in the impact of science. And I mean, the vaccine, the drugs. This is something that we clearly advocate for, and we are very open about it. Results are moderate. And we hope to have a reasonable Q4. I'm being very careful as to the words I choose. 2020 was a very difficult year, negative results. There was a conscious decision. We focused on the human beings. Results were not there, of course. And now, 2021, we're trying to break even, which is no easy feat. 2022, 23 is going to be the uptake. That's what I've been doing. That's it. We have 3 more minutes. I would like to ask you to be very brief, both Andrea and Mohammed. Unfortunately, when the conversation is nice, time flies, right? But over to you guys. Well, let me be straightforward. Coca-Cola has been in business for 136 years. It's not the first pandemic, 2 world wars, several regional conflicts, the Spanish flu, and now this terrible pandemic. We shouldn't look at the year only. Maybe digital companies that their share prices went through the roof, but few companies had good results. We're trying to understand what it's going to look like in 2021, but we should look at the year. We should look at the decade. We should look ahead into the future and take this opportunity to prepare. When you train, because selling Coca-Cola won't be the same after the pandemic. We have digital tools, other types of deliveries. Consumers changed their eating habits. They're more concerned about their health, and that impacts our business. So take this opportunity to learn and to implement important change, knowing that later on, you're going to come out of it much stronger. Not only as an organization, but as people. That's what I believe in. Mohammed, I would like to thank you for inviting me. It was a great opportunity to learn from all of you. Congratulate FIS. And I would like to say that I agree with my colleagues here today. Losses and crises are directly connected to a long-term strategy. No stock investor, I don't know who the minority shareholder, Warren Buffett, Berkshire, they're not concerned about a short term. Of course, I don't know what the funds are behind Accor. It's a long-term journey. The hospital is celebrating its 95th anniversary, almost 100 years. Mater Dei has a long history, part of the state of Minas Gerais. Again, it's a midterm journey. And as an executive, as a company, we have to keep in mind that shareholders, partners, board members, they're there. They understand that our role is to reinvent ourselves. You have to emerge stronger, reinventing ourselves, be it Moinhos de Vento, Mater Dei, Accor, or Coca-Cola. Not only as companies, but as people, as individuals, and ultimately as a society. And thinking about the country, when we think about Brazil, what is the project for the country? What's our flight plan for 5, 10 years? Where do you want to go? We executives are no superheroes. I hope we don't need superheroes. I hope we have a project for the entire country. We should think about our 5, 10, 20-year long journey. Thank you. Thank you, Onsiman. And hope we are all successful in the future and our country be successful in the future too. I hope we can have executives that are citizens, looking at their businesses, of course, but looking at the needs of society, the community where they operate, and even generating more value to their own business. That was a very interesting hour, very productive conversation. Thank you, Andrea. Thank you, Mohammed and Paulo. Thank you for your insights. Congratulations to all of you. This concludes our panel. Thank you once again. Thank you.
Transformar o cuidado, criando soluções acessíveis, proporcionando excelência em cada detalhe, somando expertises e multiplicando as capacidades assistenciais. É para isso que o Américas existe. Composto por 18 hospitais e 37 centros médicos e centros de excelência, distribuídos em 5 estados brasileiros e no Distrito Federal, o Américas promove o cuidado em mais de 60 especialidades médicas. Juntas, nossas marcas formam um sistema integrado de serviços de saúde, garantindo acesso a um atendimento diferenciado em todas as fases da vida, com excelência no acolhimento, humanização e alta performance. É assim, unindo estrutura, solidez, experiência e paixão pela medicina, que cumprimos a cada dia a nossa missão de ajudar as pessoas a viver de forma mais saudável e contribuir para que o sistema de saúde funcione melhor para todos. Onde tem Américas, tem saúde.
Trying to find my way. Every day, just trying to find my way. Every day. É muito nova pra ficar tomando remédio pra louco. Essa geração é cheia de história. I'm gonna break through.
Saúde mental é real. E quando alguém minimiza esse assunto, só aumenta o problema. Se você está passando por isso ou quer entender mais, a Amil pode ajudar. Saiba mais em amilsaudemental.com.br.
This is for scientists and those who believe in the potential of science. It starts with curiosity. A surprise in the pattern, an obstacle that can't be explained. Step by step by step, they challenge, explore, and unlock the unknown, fueled by imagination, alone and with others, repeating an experiment 1,000 times to have the chance to get it right, once, but for forever. Making brave choices, choosing to push the boundaries, and choosing again and again to be led by science in everyday decisions, everyday interactions, no matter where they are. Because putting science at the center of everything is the best way to understand and transform disease, the best way to change people's lives. This is why we believe in what science can do.
O Rio tem um laboratório que se importa com você, certificado e acreditado. Não paramos um minuto sequer na pandemia, realizando mais de 1 milhão de exames por mês. Conheça mais. Laboratório Blessing, de mãos dadas com a saúde e com você.
Em meio a tantas mudanças, temos uma certeza: a saúde continua sendo um fator decisivo na vida das pessoas. 1 a cada 4 brasileiros busca um plano de saúde para ter atendimento de qualidade. São pessoas que se preocupam com uma boa assistência médica e odontológica, inclusive na hora de escolher um emprego. Além de oferecer saúde e melhorar o dia a dia das famílias brasileiras, os planos privados salvam vidas. Nós da Fena Saúde temos o compromisso de promover bem-estar e transformar a vida dos cerca de 50 milhões de beneficiários de planos médico-hospitalares e dos quase 30 milhões de brasileiros com planos odontológicos. Proporcionando assistência 24 horas por dia. Criamos mais de 3 milhões de empregos. Realizamos mais de 1,5 bilhão de procedimentos médicos e odontológicos por ano. E movimentamos mais de 3% do PIB. Nosso desafio é garantir que a saúde suplementar acompanhe as transformações do mundo, priorizando a satisfação dos beneficiários. Nossa missão é oferecer saúde, cuidado e qualidade de vida para mais e mais brasileiros todos os dias, garantindo tranquilidade em tempos de tantas incertezas.
Fazer com que as pessoas façam mais, sintam-se melhor e vivam mais. Essa é a nossa missão na GSK. Somos uma empresa de saúde global com foco em ciência. Contamos com 3 negócios globais que atuam na pesquisa, desenvolvimento e fabricação de medicamentos, vacinas e produtos de consumo. Há mais de 110 anos, estamos transformando a saúde dos brasileiros. Somos líderes em soluções para a saúde em diversas áreas, como vacinas, HIV e respiratória. Nossos valores e expectativas guiam tudo o que fazemos na GSK e nos apoiam em nossa missão de ajudar as pessoas a fazer mais, sentir-se melhor e viver mais.
Microsoft Cloud for Healthcare brings together trusted capabilities to healthcare organizations and partners that enhances patient engagement, empowers health team collaboration, improves clinical and operational data insights, and protects sensitive health data. This integrated solution enables your organization to quickly access a portfolio of released and new healthcare capabilities tailored to the unique requirements of health data in the cloud. It unlocks the power of Microsoft 365, Azure, Dynamics 365, Power Platform, and our extensive partner ecosystem to create trusted end-to-end healthcare solutions. Together, it makes it faster and easier to provide more efficient care and helps support the end-to-end security, compliance, accessibility, and interoperability of health data. Microsoft Cloud for Healthcare empowers your organization to engage in more proactive ways with patients and gives caregivers tools to improve workflow efficiency, streamline collaboration, and connect data across existing sources to turn insight into action. Its connected cloud is designed to address your most pressing issues, enabling you with the speed and agility to adjust to change and build resiliency to help you weather today's challenges so you can begin to reimagine tomorrow. Microsoft Cloud for Healthcare, empowering health organizations to deliver better experiences, better insights, and better care. Learn more at aka.ms/cloud-for-healthcare.
A Pronep Life Care, uma marca do grupo Sodexo, é uma das empresas pioneiras na atenção domiciliar no Brasil. Desde sua fundação, a Pronep Life Care já cuidou de mais de 35 mil vidas e atende em todo o país mais de 2.000 pacientes por dia, atuando no cuidado e atenção às mais variadas necessidades. Tudo feito por uma equipe altamente qualificada e especializada na casa do paciente, de acordo com suas necessidades individuais e com acolhimento e cuidado. A qualidade do nosso atendimento garantiu o reconhecimento da Joint Commission International, JCI, que nos certificou com um selo respeitado mundialmente. Tudo isso para levar ao paciente e sua família qualidade de vida e conforto, sem abrir mão de cuidados médicos de excelência.
A Pronep não deixa faltar nada para minha filha. Eu sou muito bem tratada por eles. A equipe é muito boa, é tudo muito bem engrenadinho. É mais vida para o paciente, mais vida para você.
Pronep, movidos pela vontade de fazer o bem.
Nestes mais de 120 anos de história, entendemos o poder de um diagnóstico preciso e rápido na qualidade dos cuidados com a saúde. Quanto mais conhecimento, melhores são as decisões. E maiores as chances de superar desafios para vidas mais longas e com mais saúde. Por isso que na Roche Diagnóstica, investimos tanto em pesquisa para o desenvolvimento de soluções e equipamentos. Em pessoas que podem inovar e melhorar processos e serviços. E no compartilhamento deste conhecimento que produzimos para o benefício dos pacientes. Isso é valioso. Como líderes, devemos ter consciência e orgulho do nosso poder de impacto na gestão da saúde no Brasil. De desenvolver o mercado, antecipando necessidades e soluções. Queremos ampliar ainda mais nossas condições de produzir informações relevantes e seguras, viabilizando melhores decisões clínicas, para que as pessoas vivam mais e de maneira mais saudável. É isso que nos move. Possibilitar cada vez mais acesso à melhor medicina de precisão para o maior número de brasileiros.
Seja qual for o seu caminho profissional, o Senac tem um curso para você aprender fazendo. Você pode começar uma profissão do zero ou seguir nossa trilha de desenvolvimento e se aprimorar cada vez mais na sua carreira. Aprender fazendo é a metodologia exclusiva do Senac, que tem foco na prática e faz toda a diferença na formação dos nossos alunos. Saiba mais sobre ela aqui no site. Depois, continue navegando para escolher seu curso e garantir sua matrícula. Senac. Todas as formas de aprender fazendo.
Developed Protector, Environmental Infection Control. Based on international best practices, so we can assure a clean and safe hospital environment, the Protector Advantage is about people, process, and technology. Through education and management, it achieves expertly trained and motivated frontline cleaning staff committed to their vital role in eradicating hospital-acquired infections. Standard processes detail who is responsible for cleaning which items and areas and what products and techniques to use. Protector incorporates the latest, most effective, clinically proven cleaning and decontamination innovations from across the planet. And from assessment to auditing to analysis, it works with you to drive additional value from under-pressure financial resources, ensuring patients are kept free from harm so they can go home when they should. Protector, environmental infection control from Sodexo. Your advantage in the fight against hospital-acquired infections.
Você está na FIS Week. Aqui você encontra as versões imersivas do nosso evento, que vou explicar mais tarde. Você pode escolher o idioma aqui. Aqui você encontra todas as áreas da FIS Week representadas por monumentos históricos. Na pirâmide, você pode acessar o FIS e ainda conhecer mais sobre a história da construção. Aqui você poderá assistir aos painéis do FIS 21, participar da discussão através do chat, enviando perguntas e comentários, além de conferir informações sobre o painel e os participantes. O mesmo vale para o Simetria e o Commits. Clique nos monumentos para acessar os eventos. Você também pode acessar a Meeting Zone no nosso mercado central. Lá você pode agendar um meeting com os nossos parceiros e encontrar outras pessoas que estão participando da FIS Week. E você também pode conferir a programação, os palestrantes, relaxar ouvindo música no nosso oásis e muito, muito mais. Aproveite a FIS Week e faça parte da maior experiência da saúde na América Latina.
So welcome to our last panel for today. Ju, yes, we had a full day with a lot of content. And if you missed out any of our panels, please rest assured that all of them are going to be available on our channels. Yes, and now I'm going to invite Fernando Torelli, Julio Derni, Luciano Falula, Director of Development and Professor at the Brown Foundation, and the President of G Healthcare for Latin America, and Leandro Tavares, Vice President at the Door Chain. And as moderators for the last panel of today, the challenge of training new healthcare managers. And as you know, please point your camera at the QR code that you see on your screen and fill out our survey. Let's get started. Good afternoon. It's an honor and a pleasure to be here with you for yet another FIS event in 2021. Thank you, Josias Villar, Rodrigo Villar, for the invitation to moderate this panel. It is certainly a panel with a lot of authority on the subjects that we're going to discuss. These are unquestionable leaders and people who are challenged every day around this subject of major companies that want to become perennial and want to give back to society as much as they can to train new managers. So I want to start out by thanking you from the panel. Thank Torelli, Faluba, and Palomini for the opportunity to be here with us discussing the subject. We are going to follow a method where we're going to have, each of us is going to have 8 to 10 minutes for their initial comments. And after the first round, we'll be able to participate in a Q&A session and a more direct discussion about the subject, which is undoubtedly the most challenging subject, more than any other, in my opinion. So, Torelli, please, would you please open our panel? I'll give you the floor. And I want to thank you for your generosity in being here with us. Good afternoon, Leandro. Good afternoon, everybody. I want to thank the FIS Initiative for the invitation to participate. It is an honor for me to be here and to talk about our experience. Leandro, I want to start out by talking a very specific my professional trajectory. My initial dream was to be a human resources manager because I wanted to work with people. And for some reason, in the hospital of clinics, I became a supply manager for 9 years. And every day I would pester my directors to let me become an HR manager. And eventually I did become an HR manager, and I spent 8 happy years working as an HR manager. To work with the capacity building of leaders. And I think that hospitals are businesses, they're companies, they're all about taking care of people. You may have automation in a hospital, but you cannot replace one single job position. So it's people taking care of people. But I got frustrated as an HR manager in that my projects were not approved by the hospital administration because they did not understand the importance of those projects. So then I decided to do my master's in administration, and I wanted to become a manager at the company. And after a long time, I became the CEO at the same company where I used to be the HR manager, the Hospital of Clinics of Porto Alegre. And I found out that my HR projects were really bad because they had this very peculiar perspective in that they took on an HR-centric perspective and not a wider perspective. And that really served as a stepping stone because now I worked as a CEO at the hospital, but I continue to work very closely with the HR practices. And in my opinion, the training of leaders and managers must be treated with three separate agendas. A professional, a CEO, an executive that works with training leaders, in my opinion, should have three very well-defined training agendas, and they cannot be dealt with simultaneously. The first agenda is what Porter teaches us is the agenda of strategy. It's all about being able to define strategic planning that will serve as the base for the entire institution, and have a market training. It's not enough to know your organization in depth. You have to be a global citizen and study the strategies of your competitors if you want to implement a successful strategy in your organization. So it's an agenda of all of the disruptive technologies that we're working with. So it's an agenda that should take all of that into account. And it's an extremely important agenda, but many people think that this is the predominant agenda of a leader. The second most important agenda is efficiency, operational management. When the EBITDA is not doing well, it's no use having good ideas because you can't implement the ideas. And very few leaders currently dedicate time to understand how the organization, the management of your organization works, and the operational business model. And I have been working at hospitals for over 30 years. I've only done this throughout my entire life. That's the only thing I can do. And there's one thing that I used to say, that every healthcare organization is inefficient, all of them. And we try to achieve efficiency in our operations, and we could even quantify that. I think that our organizations are something in the range of 15 to 20% inefficient, and quite often leaders have a background focusing on strategy, but they cannot see their efficiency in supplies, operations, revenues, and whatnot. The entire operational process, because they think that as a leader, they should always take on a more strategic perspective versus an operational perspective. As far as I know, yes, you have to have a strategic perspective, but you have to have a separate agenda. There is an article by Porter about operational excellence where he says that you have to have two agendas. One, to develop strategic knowledge, and another one to take care of the operation. And more recently, with the pandemic, I understand that there's a third agenda that a healthcare leader needs to have. Social inequality in the healthcare sector is terrible. In São Paulo, we have a publication, the map of social inequality, showing that the difference in terms of a life expectancy between the poorest and wealthiest neighborhoods is 40%. We have a bubble of in the hospitals that we use to visit, but there's an entire periphery of healthcare institutions that are inefficient with not even the minimum conditions of sustainability. During the pandemic, I posted on social media a suggestion to create an initiative where every healthcare professional interested could donate a bit of their time to help organizations of the public health system. Now, we are currently 600 professionals, and we have our name is Healthcare Volunteers, and we provide services to 8 hospitals in the public health system, from strategic planning and everything. And you have no idea how much the knowledge of the professionals that are currently in our organizations can contribute to decrease the gap and democratize knowledge and the quality of the unified health system. So in my perspective, as an introduction to our discussion, I think that the education of a healthcare leader must be based on 3 agendas that need to be very well defined. The agenda of strategy, the agenda of operation, maintaining results and cash flow, and the agenda of reduction of inequality. You need to define these 3 agendas very well and structure them very well if you want to contribute to the education of new healthcare leaders. We can no longer accept that in Brazil's wealthiest city, the difference in terms of life expectancy is 40% between the poorest and wealthiest neighborhoods. And we have a direct contribution in that. And we also have a fantastic power to contribute. You have no idea of what happens in most Brazilian hospitals, the level of difficulty to have access to competent professionals, and how we can change that if we dedicate only 5 hours per week from our agenda to try to help democratize efficiency in the healthcare scenario. These are my first comments. Thank you. Thank you, Dr. Elio. Thank you for sharing your knowledge, and thank you for sharing this beautiful example of a project. We need to be constantly developing people. That should be our commitment if we want to see progress in our industry. Of course, social development has to include developing the healthcare sector and educating professionals, and that should be at the top of our agendas. I'll give the floor to Julio Bernie. Julio, please have the floor for your initial comments. Please share your experience and knowledge with us. Thank you for being with us. I appreciate the introduction. It's an honor and a pleasure to participate in this panel. Thank you for the invitation. Thank you for the initiative. And I'd like to thank you on behalf of my company as well. This is a broad subject, one that is also legitimate. I fully agree with the formal aspects mentioned by Dr. Elio. In opening this discussion, we need this level of knowledge, we need this level of management, or this level of training for our managers with these more formal management tools. And we also need to take into account when it comes to the healthcare system, and this is a constant discussion for us at Abbott. Abbott is a company that's been in the market for 130 years. And it was started by Dr. Wallace Abbott, preparing medicines on his own, and it's been expanding since then. And certainly since its inception, since the initiative by Mr. Abbott till now, one of the aspects that was required to get us to this point were certainly the management elements that my predecessor mentioned. And when it comes to the healthcare system, it's even more complex. When we talk about education and knowledge, well, that's a given. We all agree, I'm sure, that we have to constantly educate, to constantly train, and to build capacity among our teams so they can move forward with the agendas of our businesses, the public agendas, or whatever these agendas are. In terms of the healthcare industry, I want to highlight the level of complexity. We know that the system is fragmented, it's a multidisciplinary system, and highly specialized. Healthcare per se requires a lot of specialization. All of us who work with healthcare and healthcare education, we know that we need to be specialists. However, in the last 15 or 20 years, this is even more pressing. We need to take on a more systemic perspective. I think that the most important challenge, in addition to all of the strategic and operational aspects and their execution as the first challenge is to bring this system-wide perspective and across all levels of the organization. Of course, each individual, regardless of where they are in the organization, they must have an idea of their impact on the entire system as a whole. The system is highly fragmented, as we said, and when you become too specialized, you kind of set aside or unable to see things from a systemic standpoint. So when it comes to gaining efficiency and increasing access to healthcare and rationalizing resources, we ended up looking at these system-wide aspects. And that's what we have to emphasize, I would say, in the training sections, training forms of professionals. So Abbott, as a healthcare company, we're present across the entire continuum of healthcare, and from preventative care, early diagnosis, intervention, and post-intervention care, our nutrition and diagnosis and medical devices and pharmaceutical product divisions are united in that goal. So if we look across the continuum, healthcare professionals need to understand the impacts of their activities at the lab or as representatives of the pharma industry, the impact of their activities on the system as a whole in terms of the patient journey. So I see that as the biggest challenge in terms of training professionals is to give them this systemic perspective and how to see this integration across the chain of the healthcare industry so that the diagnostic activities have a real impact on treatment or prevention, and that the treatment itself is successful. And, well, in my perspective, that's the biggest challenge that we are facing in training healthcare professionals. Of course, that goes beyond all of these more formal aspects related to education and investment in education. We have learning and development area, and the technology that we develop, any technology we develop, requires a lot of knowledge and technical background and specialized training. Our biggest discussion now is how to look across the system and the healthcare continuum and start generating real impact towards a greater efficiency and rationalizing costs. And we know that this has had a huge impact on every system, regardless of whether it is a developed country or emerging country. Everyone's suffering with the scarcity of resources. So, taking into account this systemic approach is required if we want to tackle these challenges related to education and many other aspects as well, availability of the workforce and the cross-generational aspects and many other elements that end up having an influence on that. But if we talk simply about health and the challenge of administration, I think this is what really resonates with Abbott. Thank you, Julia. The system-wide perspective and this perspective of integrated healthcare as the means of really developing are important to its needs, and be able to discuss this subject in greater depth. As a multinational company, you also have your own challenges, and it's important that you share them with us. So thanks for that. Thank you for your initial comments. Luciano Falupa, Development Director and Professor in the Dom Cabral Foundation in Minas Gerais. Please, you have the floor. Hi, Andrew. Good afternoon. It's a pleasure to be with you. Thank you for the invitation. It's an honor to share this panel with such brilliant professionals with such a relevant impact on the healthcare sector, and also to be able to talk on behalf of the Dr. Brown Foundation. This is what we do. We are we're not in the healthcare business, but we are in the business of training leaders and administrators. So in my initial minutes, I'm going to give you a general overview of what we do at our foundation in terms of training of administrators and more specifically administrators in the healthcare sector. I think we're all familiar with the transformations that the healthcare sector has been undergoing over the course of the last few years, especially in Brazil. To mention a few, there is the consolidation of the industry, a greater involvement with consumers, with patients, when it comes to making decisions about their healthcare treatments. The digitalization of the industry that was expedited by the pandemic, and the use of data analysis, just to mention a few. And we know that this transformation, amidst these dynamics, the managers of healthcare companies are being challenged to innovate. And in this context, the basic activities of a manager, we could quickly list them. They consist of planning, organizing, leading. They've taken on a new perspective, and they become more complex. In that regard, new competencies are being demanded from these managers, since new challenges require new competencies. And I brought to our organization for challenges that are instrumental for managers, and they are, well, first, making more complex decisions, the adequate use of management tools, and also working with data, with a data-driven decision-making process. And that's important because the business administration has become more complex, and the sheer amount of information. Being able to analyze the data and working with data is an important competency for administrators within the business. And this what Torelli said during the opening words when he talks about efficiency and knowing the business. So this complexity will require a greater affinity with data that is in the future of every healthcare organization. The second aspect that I'd like to highlight also just what Torelli said when he talks about strategies and looking into the future. And I agree that that's related to leading the business and organizational transformations in alignment with the strategies and changes from global context. The business environments are increasingly more connected as a natural consequence of globalization. So expanding this perspective and being connected to local context in your segment and also in other segments that have an impact on your business is a competency that's aligned with the ability of looking at the future and looking around you. The advantage, I was thinking, is a 3.0 perspective that's in line with the global perspective and an intersectoral perspective. So that's the second aspect. The third aspect, Torelli, it seems that we seems like we were thought about them together, is to expand perspective about the needs of stakeholders, integrating the welfare of the organizations and societies in the decision-making process. So the perspective of what a healthcare organization can give back to society, but not as something specific on and off, but rather as something institutionalized. And for that to happen, that needs to come from leaders, from managers. They need to have that in themselves. They need to be committed with the social impact, and that's related to social inequality, as mentioned by Torelli. And the beginning. And I think Julia also mentioned that. We talked about complexity. And last but not least, this manager, to be able to, well, be up to par, they have to expand their self-knowledge, to evolve in their personal purposes, and also as a leader. So they're able to inspire and engage people around their projects. That's extremely important, and it's becoming more and more challenging for leaders. So in conclusion, to summarize these 4 elements, I can say that data-driven decision-making that is related to the complexity that Julio mentioned in his speech. That's the perspective of a results-oriented manager. The 3.0 strategic perspective is all about the visionary and managers, including the perspectives of stakeholders and society, is all about having managers with a purpose, and increasing self-knowledge to inspire and engage people is all about having inspiring leaders. So these 4 competencies, business-driven, visionary, with a purpose, and inspiring, are the 4 competencies that I would highlight for administrators. And that's it. Thank you.
Thank you. Only a professor could help us organize our ideas. Thank you. It helped us put our ideas in a more organized fashion. We can then discuss hard and soft skills. So that's a combination between both hard skills. You're based on hard skills, but what can make a difference is a related soft skill related to that hard skill, which is basic knowledge of any given discipline. Yes, that was just great. Thank you. Rafael Palomini, CEO of GE Healthcare Latam. You have the floor now. Thank you. It's a pleasure to be here today. It's a very interesting conversation. We need focus because we need a group. We can't do anything on our own. It's just great to discuss these ideas collectively. I'll be speaking on behalf of the largest manufacturer of equipment and solutions. I'll be speaking both as an employee and as an executive. On top of hard skills, soft skills, operational efficiency, behavior, etc. But I would like to focus on focus. So everything during the development, the outcome of that work is what we want to pay close attention to. What's the focus in the health industry? Our clients help save lives. The focus, the ultimate focus, is on patients. On top of the themes that have been mentioned, we have to focus on the outcome. We may focus so much on the efficiency, a new tool, new knowledge, but if it does not result in a positive outcome through an internal team or external teams, this won't do us any good. This new world has been depleting us from our energy. So focus on the outcome. But anyway, I'd like to break that down just like my previous colleagues mentioned. We have to connect development with more relevance to each one of the different positions. It's not a one-size-fits-all to us. How can you go beyond profiles? What's the benefit to have specific training program for one area? How can that impact one executive so that they can move ahead in their career to support the company and the entire industry? So we have to map that out. And then we go hard skills, operational efficiency. In the case of GE, we focus on lean management. How do we keep track of the efficiency? Through scorecards. Today, we have new disciplines, cybersecurity, something we may not have had when we started out. Inclusion and diversity, I don't think it's a soft skill, but however, it's important to be in a diverse environment so that you have different opinions and you can readjust your own beliefs. So these are topics that are interconnected, and we focus on all of them. Experience, feedback, you bring in examples, constructive conversations to train our managers so that they can in turn train other managers. We can evolve collectively, not individually. Of course, we have to understand the entire chain from end to end. How can you gain efficiencies? And how can you support that horizontal connection? Not only your vertical focus where you operate, but how can you improve and expand on the connections that you have? That's indeed as important. It's not a simple environment. That's why continued education is very important. Not what you learn matters. It's what you learn today is what actually matters. And we have to be humble. We have to realize we know less and less. How can we be humble enough while maintaining our relevance and evolve, move ahead? Throughout the year, we have reassessed our training grid, our training programs. So that's the internal team is revisiting that matrix. Dom Cabral Foundation is very helpful in that sense. But the goal is to keep on evolving. So we reviewed our training programs. The scope includes influencing skills, emotional intelligence, consultative sales, problem solving, lean thinking. There's all that. But being humble, being willing to learn, listen to your client, focus on what's important. It's a set of things. The most important thing is what I said at the beginning. How can we pay attention so that our effort, individual and collective, is generating importance to what the company needs, to what the executive needs. So these are my opening remarks. So we should be plural and being able to look at the hard data, but how it connects to the rest, and being humble enough to learn and to know how to work with people. Thank you, Rafael. I think we should pay attention to what's going on inside large corporations like yours. All right, moving on. Torelli, I know you are working for a hospital that has philanthropic purposes as well. And you have been training executives to provide that support to the public sector. My question to you, Torelli, do you see a difference between the way executives are trained, both in the public and private sectors, both including hard and soft skills? What's your take on your experience? I worked at Moinhos de Vento Hospital. It's the southernmost region in the city of Porto Alegre. So you had a hospital in the richest neighborhood, and we had a similar hospital in the poorest neighborhood. And I worked at Syrio-Libanese Hospital. Syrio-Libanese manages 3 hospitals through a social entity. And I worked with these professionals and said, I always talked about how much we could help them. We could help the public. The monthly budget of hospitals such as Syrio-Libanese accounted for 34 hours of Syrio-Libanese budget. And then I asked them, who should help who? Public administration deals with with few resources. They are under a lot of restrictions. I found important and very skilled leaders in both hospitals. The difference is not between private and public, and the difference is wanting to do or be willing to do the right thing. We are privileged, those of us here. We work for well-structured organizations. They are benchmarks. And we feel obliged to give back. Whenever I talk about giving back, I was born in 1964. Life expectation back then was 56 years old. I was born in 64 in Brazil. I would have lived 56. I'm 57. This would be my last conference if Brazil hadn't gone through a major social transformation, a sanitary transformation. From 1970 to 2005, our population doubled. This is the merit of the public system, of hospitals, entrepreneurs that invested in health. So today, we see a major transformation. We only talk about health, we talk about major investments. And we have to come up with a way to democratize competence and management skills. This is a key purpose because public system professionals are motivated. They have a fantastic purpose, but they lack the knowledge. They don't have methodology and support. And our organizations, our professionals, the team of voluntary, Rebridor, Syrio, Einstein, Agacor, Moinhos de Vento, they're working for free. And you have no idea how much that helps. I don't see any difference between the public and private sector managers. The only difference is the level of opportunity, the resource that you have available, the knowledge of competent people in both public and private sectors. The public manager has this characteristics. They have to be more efficient than those in the private sector. When I came to São Paulo 6 years ago, the price of drugs and materials in São Paulo We're at least 30% above those in Porto Alegre. In Porto Alegre, we have fewer resources and you have to be more efficient, period. So efficiency, competence has to do or have to do with the opportunities you have available and the need that you have to bring in results. Thank you, Torelli. Over to you now, Julio. What is Abbott's take on how they train their executives, being a multinational corporation? Being a transnational organization, does that bring extra difficulties to train executives, and how do you address that? That's a great question. That has to do with my personal experience in recent months. Let me start by saying that there's a shortage of talent, of good managers. I mean, a global shortage. Major corporations, be them multinational or not, this is something we're faced with on a daily basis. As senior managers retire, we come to the conclusion that we have to speed up training processes. We do have global programs. We adjust these programs according to the seniority levels within the organization. But from a certain point on, we make sure that these executives go through these global processes. And why is that? We've all talked about the need of having to expand the point of view, trying to understand the complexity of these systems. And you can only have that in classrooms that are multidisciplinary and multicultural. So regardless of where we are, the message has to be very well aligned. Our purpose is to have people living their lives to the fullest. And then we come up with a series of initiatives. And we must convey that message everywhere we operate. We operate in 160 countries. We are over 100,000 employees. We provide that comprehensive scope in the message we convey. That question reminded me of my personal experience. I attended one of these global leadership programs for the senior leadership team. And in that program, we checked all these good concepts, important quotations that you brought about. We do have a program to train general managers, a program that would bring in information from universities, but it also includes practical elements, something that was also mentioned today. And that message, that strategy, aligning mission and vision and the actions we want to implement, everything is combined regardless of the location where we operate. So it's a blend between a more theoretical and practical approaches, trying to focus on the implementation of our strategies. This is a program that allows for that kind of connection. This year, the program was virtual. I had sessions at 8 p.m. My colleagues in China attended the meeting 9 a.m. So we had to be very dynamic despite that virtual environment. But nonetheless, we managed to exchange ideas as to how the market operates in China, France, and Brazil. So that multicultural approach is very important to all of us. As executives reach that seniority level, they are exposed to that type of experience. Of course, you had to take the local approach too, taking into account the local characteristics of the market you operate. In a nutshell, that's the process. We want to be as multidisciplinary, as multicultural as we possibly can, so that it can be transformed into our tactics and actions. Thank you very much, Julio. Over to you now, Luciana. In this dynamic world we're living and the challenges we're presented with, it would impact an educational institution such as the Dom Cabral Foundation. How have you changed your syllabus? We used to take extension programs, MBAs. What has changed? How much have you gone into organizations? So how much has your syllabus changed at Dom Cabral Foundation, please?
Sure, that is a great question, because the healthcare industry is undergoing transformations. If that's the case with us, the education industry has been totally uprooted by the pandemic. So we had the opportunity to review several paradigms and concepts that we had as the business school, and that was a very interesting process. I'll start by talking about the education format. The online health services also they had a paradigm. The online courses also suffered the same thing, and that was eliminated during the pandemic when it comes to the cost benefit ratio, especially for companies and for organizing their educational programs with interesting results. That was really good. So that is the first dimension of transformation of Dom Cabral Foundation. We have 100% online courses. We have 100% in-person courses, as well as hybrid methodologies, which opened up the doors to us. And like I said about the education of healthcare professionals, that requires new competencies, a new repertoire, and for the professor themselves, that brings about interesting difficulties when it comes to the transformation of content. Dom Cabral has been working on sustainability for over 10 years, and in terms of the social impact and the legacy. We believe our mission is to transform society through managers and organizations, because organizations have an important role in society. not only in the healthcare sector, but also in others. So this repertoire is actually has been absorbed by a business school because we're sowing the seeds that the market is currently embracing really well. But in the beginning, people would push back on these initiatives. And we are also proud of developing this awareness about sustainability and social impact, and more specifically, the perspective of individuals, the awareness of legacy. What legacy do I leave the world and society with? And the third aspect, you mentioned, um, okay, this has moved from the educational institutions and has migrated to companies. Yes, and now we're seeing that more and more individuals have to take responsibility for their own education and development. So that's also one thing that we've been monitoring. And initially at schools, the organizations took on that role, and individuals are more and more becoming the protagonists of their development, and that's an interesting aspect. And one last aspect that I want to highlight, one that is pretty aligned with what Rafael said. He used the expression, it's hard to work with the one-size-fits-all methodology. That's one thing that we also see in training, high management. We've been working more and more with capacity building and personalized development, not for group development or team development, but rather to understand the backgrounds of individuals and their goals with broad diagnostic tools. And based on that, we define a specific development plan for that individual. And that could have the support of mentors that is increasingly demanded to supply these practical needs. We have, of course, theoretical training, and that works very well for the classroom and the consolidation of knowledge. But in terms of the practical repertoire, what we've been seeing is that the mentoring sessions, that's where leaders are able to discuss specific things about their daily routine and connect themselves with the disciplines, and with the mentor helping them make sense of that. And that's also been quite efficient currently in the development of leaders, not only organizations, but also healthcare organizations. And one thing that I cannot fail to mention, and that is quite interesting, in the past few years, the Dom Cabral Foundation has been approached by healthcare institutions increasingly more. And that's quite interesting because that is along the path of building capacity in the industry. Thank you, Luciana. So, Rafael, in your talk, you mentioned important disciplines for you and for the industry as a whole, such as the lean methodology, cybersecurity, and even the importance of values, such as conveying a diversity and progress. I'd like to understand at GE, what is the training process like for your collaborators and executives to use a methodologies that we established for all hierarchical levels, or how does that work in general? You also talked about a training context that places a lot of importance on intelligence. So can you tell us about this training and education structure at GE and what that is like, or if it varies across regions? Because you're the Latin American president for the LATAM arm of the company. So can you tell us how GE defines that? Sure. I'll talk about that in a nutshell. We have technical training of several positions. So an easy example is a field engineer with a series of technical trainings to be able to operate a machine. We also have training, as Victor said, of executives, where we have specific leadership programs that can be global, or they could be an assignment of a different sector, or you could have a specific project, and so on and so forth. And we also have the training for our customers in terms of how to use the machines, and training for most of the population that are probably not able to engineer or an executive. But yes, we do have a matrix, and we work with different ways of providing training. We have external resources. We have the trainer program, where some employees will volunteer to train others. And we have this matrix that evolves, as I was telling you. So this grid that we have at LATAM was the result of customization, something that we identified that was important for our team, with guidelines of things that we should continue to apply. So I think it's recommend that managers are aware of what's most relevant, and also aware of his or her team's feedback. To us, training is not about awarding prizes and regression. It's actually about evolution, and it's important to, as I said, try to crisscross that matrix with your investment possibilities. And one thing that we did in the past was to get a real-time feedback from the class that completes the training session, and constantly improve the content and see if they're using it. And if you have a certain type of training, then you have to monitor the team to see if the training is so that it's being kept there and put away and not used. So I know that we're to some time, but there are several aspects to what we're doing in terms of training, and that's the reality. But I think that what's good at GE that we have is that we have a mixture of autonomy and also these possibilities, as Julia was saying, of making connections with colleagues globally and local projects. That's really nice. And also being close to partners. Of course, the foundation is a reference. They've been here to work with our team, and we have to keep our eyes and ears open. But yeah, that's it in a nutshell. Thank you, Rafael. We have lots of questions, and I'll send to the panel, but we won't have time for them. We're reaching 60 minutes of conversation. We only have 10 more minutes, so I'll just do another last round, and I'll ask you please wrap up in 2.5 minutes and say goodbye, so that we finish our session after 70 minutes sharp. So I'll give the floor to Relly. I would like you to share with us what you do for the middle management in terms of at-home training, where at the plants, you've been focusing more on your own facilities and how you've been dealing with behavioral training, because of course the technicalities are in literature, but you cannot really teach behavioral aspects such as facial expressions, people dealing with distressed patients. Well, that's a huge challenge. So maybe you can tell us how you deal with this process and the EEH and across your institutions. Oh, with the pandemic, your question became even more complex because every healthcare professional is emotionally and physically tired as a result of everything that we went through during this period. The hospital has its internal university and partnership with many other organizations. So the collaborators have their own mandatory trainings, and in the variable compensation from all the collaborators of the company, there is a deflator. There is a no award, but if you don't complete your mandatory trainings, there is a deflator that's applied to your compensation, and that's very clear in our policy. And we initiated a training that we call the core way of serving, looking people in the eye and providing more humanized service. That's very important because people that come to a hospital, of course, they come in a different emotional state. No one goes to a hospital if they're totally normal in terms of health conditions. But there is a program that is very good. I've been sitting with groups of professionals at the hospital, and I tell them that, well, you've been nominated the CEO of our company. If you were the CEO, what would you do to improve customer service? To give you an idea, the nurses at the emergency room prepared a presentation with 10 pages worth of actions they would undertake if they were in my position to improve patient care. And this process COVID taught us that the traditional model of hierarchy is not useful any longer, because to face this battle, this war, we had to forget hierarchy and face our daily challenges. So this process of constant learning and of putting yourself in the position of a leader and having to make decisions, and leaders must be humble enough to recognize that, and the nurses gave us a real lesson to improve patient care. So you should be humble enough and resilient. I used to say that my professional project is to become useless. When every professional in my institution is trained, and with only people of the highest level of performance exists, I won't have anything else left to do. So the biggest challenge of leaders nowadays is undoubtedly to hire people that are better than them to set up a team. And I want to say goodbye and thank you for the opportunity. I want to thank our friends for sharing their knowledge and reiterate that we're privileged for working at the institutions where we work. And this privilege requires that we give back to society. Thank you. Thank you, Dr. Leo. Thank you for your generosity in sharing your knowledge. Julio, that habit, it's really frequent in the pharma industry and in the healthcare materials. There's a support. I mean, the support that is given to the sector is a way of training the industry itself to use the raw materials that they use with wisdom. So I want you to share how Abbott sees that and what Abbott has been using that, or if they haven't been using that at all. Well, Rafael mentioned that with the development of technology, we have to train and have specialized leaders at the company. And take knowledge to users or to the chain as a whole. And what's been happening is that we increasingly see technology empowering patients, and patients then become the direct users of technology, and that's something that we have with our freestyle blood sugar monitor, where we see that there is a need to disseminate knowledge to the rest of the population. Recently, with the pandemic, our quick test and diagnostic division made it available to drugstores, the COVID antigen test, and that created a need for us to have a more well-adjusted process to pass knowledge onto people who are not our traditional audience. They're usually people from labs, hospitals, and specialized people, and that led to the need for us to try to expedite that process. What I want to highlight that is a mandatory process. We need to have this very well established with tests, with standards that are clear and precise. So that's why we as providers, we are intrinsically connected to the process of development of knowledge, education, and administration. Because as Luciana said at the beginning, using data and using tools and talking about going digital, in addition to delivering technology and the diagnostic kit and the blood sugar monitor, the neuromodulator, we also need to start interacting with the chain, and we need to have a more holistic conversation so that together we generate insights and information and the necessary knowledge if we want to cause a system-wide impact. And that's something that we see as something mandatory, and that's also an opportunity for us to disseminate knowledge and make the process a little bit more effective. This session really went by really quickly. I spent much more time talking to you. This is a panel with usually diverse background. So thank you. I'd like to thank the FIS Foundation for the invitation and hope to see you soon. Thank you for your participation. So, Luciana, please tell us, you said that the healthcare institutions are trying to train people more and more. Which specific demands do these institutions have, in your opinion? Over to you.
Well, that's a wonderful question. The health industry has peculiar characteristics, and that poses us a challenge to train managers for that industry. Our focus has been on senior management. So we have that perspective of strategic vision, the legacy aspect. This is something that we pay close attention to. At the same time, we take into account efficiency, managing the tools to make these management processes professional. We're out of time, but I'm going to give you a very brief answer. And I would like to once again say that it was a pleasure for me to share this panel with such distinguished executives. It's always a pleasure to see you, Leandro. My pleasure, my dear friend. I always like to leave organizers very uncomfortable. I want to see them going nuts. Don't hurry. Palomini. GE is a source of inspiration. GE brought about management practices, and its company recognized the world over for its management excellence. Let's imagine a young executive being trained by you. What if he or she were to sit on your chair? What would you say? That's a tough question. I love the fact that there are young people that want to move ahead in the corporate ladder. They go straight to the point. They're not arrogant at all. The first thing I'd say, well, that's wonderful that you're coming to ask that question to me, because you show that you're interested. You not always get what you want, but taking the first step is very important. Well, there's a complete process in place. You have to take one step at a time. But the first thing is that what you're looking for? Does that reside in your heart? Do you have what it takes to face all the challenges? Sometimes you think about something you want, but you're not willing to face the challenges. If it's not within you or in your heart, you won't succeed. You have to look for something that you are really passionate about. Resilience, of course, that is key. There will be times in which you have to take 5 steps back and no step forward. But anyway, there's good and bad. But let me try to be very brief in my answer. I think we have to be willing to learn. You can find professionals that are arrogant. They want to talk more. They're not willing to listen. They're not receiving feedback with open arms. You're being just superficial. And you see brilliant people, technically speaking, but they cannot move ahead. You have to know how to work in teams. You have to know when to speak your mind. You have to be humble enough, because being humble, it has to do with being secure, not the opposite. There's that philosophical aspect, but moving away from it, but thinking about learning. You have to learn at all times. You make a mistake. We make mistakes every day. Rest assured that we'll make a mistake. Think about the mistakes you made on that day, and how can you ask for help? What is the example you're going to be based on next time you try to do that? So the willingness to learn and being vulnerable enough. So if you work with your heart and mind, if you're resilient, if you have that stamina to grow through walls whenever it's necessary because you really want it, and if you are humble enough to listen to advice and make that distinction, what is good for you, and maybe that's an opinion that you still don't understand. So this would be a very good starting point. Thank you, Rafael. You all contributed brilliantly. I would like to invite all the attendees to keep on attending. And I would recommend a book written by a psychoanalyst called George Forbes. Do you want what you desire? Try to identify your real needs and your professional objectives. Thank you so much. Thank you. Bye-bye. That concludes the second day of FIS week. I hope you liked it, and I hope you've learned a lot with these leaders, and also, of course, having fun with all of us. Share your experience in social media, tag us, use our hashtag and our Instagram filter, because we love to keep track of what you do. See you tomorrow with a lot more content. See you then. Bye-bye.